Good morning. Sorry, we're having a few technical difficulties. In the old days, when everybody was here and it was time, we just started. But now we have to make sure there's virtual people and it's all set up. So we're all set and good to go, starting just a tiny bit late. Welcome to our October 19, 2024 County Board meeting. As probably most of you know, I'm County Board Chair Libby Garvey, and I've got my colleagues here, all of us. Vice Chair Takis Karantonis, members Matt DeFrancis, Susan Cunningham, and Maureen Coffey. And if you're online, please mute your speakers. Thank you all who are here, joining us here and virtually. Some members of our staff are here, and some will be joining us virtually during the meeting. Masks are optional, but if you would like a mask, they are available from our clerk here and in the atrium outside. So if you'd like a mask, you are very welcome to ask for one and wear it. A couple of announcements. The podium right here can be adjusted up and down. There's a button there, so you can get it to a height that's comfortable for you. It probably is going to need to be raised for most people, I think. Please speak clearly into the microphone, and if you've got any documents you want to submit as part of your testimony, which somebody already has, just give them to our clerk here, Mr. Kushner. For the remote speakers, keep your microphones muted until and your cameras off, please, if you can, until you're called on to speak. And you'll need to unmute yourself. Don't forget to do that. A Spanish language interpreter, I believe, is available for public comment, this beginning portion. And right here, two of them. Thank you. Could you please introduce yourselves in English and in Spanish?
Morning, Diego Soto, Spanish interpreter. Buenos días, mi nombre es Diego Soto, yo soy el intérprete de español.
Good morning, I am Rosa Williams, and a Spanish interpreter. Buenos días, mi nombre es Rosa Williams y soy la intérprete de español.
Good morning. Thank you. And for all of you here, if you've not been here, we have to, the meetings go long. Sometimes we need to get up and stretch our legs, take a little break. However, there's speakers in the back, so you might not be able to see and hear us, but we can see and hear you even if we're not right here at the dais. And we're getting to our public comment. Just a reminder to folks that public comment is a chance for us to hear from people about issues that are not on the agenda and not coming up soon. It's just a way to alert us to a lot of different topics. We do have a rule that just one person per topic, because this is not a public hearing on a particular issue and we need to keep moving. But if you're here with somebody and you agree with them, and it's already been said, but you can wave your hands like this or somehow signify that you are in agreement. And I think I will stop at that, except to say, we will respond a bit to all of the comments we hear at public comment. If you really would like to have a conversation, there are a lot of ways to do that. We have Open Door Monday, the first 4 Mondays of the month, and you can have really an interactive, dynamic conversation with a board member if you would like. And of course, you're also welcome to set up a meeting or email, text, all of those things. So there are a lot of ways to get in touch with us about issues that you've got. And I think with that, we're ready to move to public comment. And Mr. Kushner, would you please call the first 2 speakers?
Of course. One moment, please. Our first speaker is David Girk, followed by Scott Gruber.
Okay. See the button there? You got it.
And you may need to...
Yeah, no, we had young people here before, I think, and so it got fairly...
And you'll want to press the button in the middle of the microphone to turn it on. There you go.
Good morning. David Girk, Arlingtonians for Upzoning Transparency. On September 27th, EHO was voided on substance and procedure. The court held the EHO framework itself violated Virginia law, as the board itself must hold a unique special use or variance proceeding for each and every property it seeks to modify from existing single-family zoning. This board has already spent over $1.2 million taxpayer dollars on legal fees and much more in county resources on EHO affordability initiative that is incapable of providing housing affordability. AFUT analyzed 15 months of EHO applications. As real estate experts, economists, and citizens themselves clearly stated from the start, EHO is not an affordability solution of any kind. It's just bumper sticker politics. EHO does advance a few things. Developer teardown of the most affordable single-family homes, those under $1 million and in short supply and most needed for young families in Arlington. Replaced with EHO luxury 1 and 2 bedroom condos at $700K to $1 million, townhomes at $1.2 to $1.8 million, which already proliferate Arlington. This is not speculation, but hard data from Arlington's 15-month failed experiment with EHO. No square footage, bedrooms, location in Arlington, all info provided by developers in EHO applications, and you can accurately predict the very high sale price of these properties. So we ask you today, stop county perpetuation of the debunked falsehood that EHO is about housing affordability. Conduct a board review of EHO with community engagement, given the lawsuit revealed evidence undercutting many of the county's EHO assumptions. AFUT requested such a review in our September 5th letter, and such a review is even more prudent now. When can we look forward to a response and to that review with the county? Let's start exploring actual affordability solutions with the community and move on from the divisive EHO experiment.
Thank you, Mr. Girk. Thank you.
Our next speaker is Scott Gruber, followed by Dionysia Thompson.
All right. Are we on? Good morning.
Morning.
Yeah, hi, I'm Scott Gruber with Arlington Medicare for All Coalition, and I'm here to talk about medical debt. According to recent studies, medical debt is a $220 billion problem in the United States. 20 million people, 1 in 12 adults in the U.S. owe more than $250 in debt, 6% of adults more than $1,000 in debt. This burden disproportionately impacts Black Americans, disabled people, low-income households, and people without health insurance. People with long-term medical debt are also more likely to be part of the 44% of Americans who are living paycheck to paycheck and are unable to save enough money to cover an unexpected medical expense. People with medical debt are more likely to skip medical tests, leave prescriptions unfilled, or just avoid seeing a doctor completely out of fear of taking on more debt. And this, of course, leads to worse health outcomes down the road, more expensive treatments. Medical debt is a national crisis, but there are ways that localities such as Arlington can help reduce the burden of medical debt. And one of these is investing in debt forgiveness through the nonprofit organization Undo Medical Debt. This organization buys bundles of medical debt from debt brokerages for pennies on the dollar and then wipes it out completely. This is debt that would normally be sold to collections agencies and lead to, months, if not years, of harassing phone calls and whatnot. Undo Medical Debt just wipes it away. While much of this work is donor funded, in recent years, local governments have started partnering with Undo Medical Debt to buy debt to help their constituents. This started with Cook County, Illinois. Cities such as New Orleans, Cleveland, Akron have started doing this. We reached out to Undo Medical Debt. They identified $1.7 million of debt here in Arlington that they could wipe out for $10,000. So I'm here to propose this idea to the council, to the board here, and see if you'd be willing to adopt that proposal. Thank you.
Thank you, Mr. Gruber.
Okay.
Our next speaker is Dionysia Thompson, followed by Linda Robertson. Ms. Thompson. Oh.
Good morning.
Good morning.
Everybody.
Yeah, and you can lower that
I'm
if you'd
here.
like. You can lower there's a button, but that's okay too.
Pardon?
actually.
I'm sorry.
That's fine, that's just fine.
I'm here concerned about the neighborhood, Cherrydale and Arlington area. Some reason lately, a lot of people are not stopping in the stop sign. And some people are also parking right by the stop sign. And I have a picture of it. It's right there in my neighborhood. And I've been seeing it more and more in the area that they park on the stop sign. I've been here in our area in Cherrydale for 25 years. And it's giving me a problem when I'm trying to do the rules to stop on the stop sign, and I can't stop because there is a car parked right there. And the traffic flow, it's difficult for the other side to get through because they expect me to stop when I can have a space to stop my car. And another issue also of what's going on in Arlington, people are doing U-turn illegally everywhere. And here's a two traffic flow, and there's somebody suddenly will make a U-turn towards you, and it's really caused somebody to I get nervous. And if there's a car on the opposite direction that on a certain amount of speed, it can cause an accident. I always stop, even though I have the right of way, just to make sure I'm safe. And one more issue about it is people are parking everywhere, commuter all over in Arlington, especially in my area, Cherrydale. And the street is two-way, and both sides are parked. There's no way you cannot even go through, and if it's a two-way street. And it really makes my day frustrated, no matter what. You know, I've never been so frustrated driving in our area, and I cannot even go out in my street without trouble. So that's what I'm to address, that hopefully there will, there's somebody gonna enforce the
Parking
parking
regulations,
meter,
yes.
or the parking area in our area, because
Thank you.
it's out of control. The cars is everywhere, and I saw
Thank you,
them,
Ms.
they're
Thompson.
commuter.
Thank you, Ms. Thompson. Yeah,
Thank you.
Our next speaker is Linda Robertson, followed by Sabrina Jones.
Good morning. I'm Linda Robertson with the Worcester Mercer condominiums. We oppose the county's plan to construct a large bus stop island in the 1600 block of Clarendon Boulevard. For your orientation, this site is a very short block between Queen Street and Pierce. Worcester and Mercer and Grasslight have recently met with many county officials, specifically Diane Trent, the bus stop manager, Claudia Pors, the Department of Environmental Service, Caitlin Thomas and Jenny Hodge with the Management Constituent Services, and Maureen Coffey, our board member. All promised to look into this situation, provide us with more information. None has been forthcoming. All have declined to visit this site and to learn of these issues firsthand with us. So I am here today to address the safety, traffic, and operational reasons for concern about this bus stop. Number one, no notification as required was given to us. Under the Arlington engagement standards, we were failed to be notified by the county. Instead of providing notification to us, a communication was sent to a real estate agent who has absolutely no connection with us, the condominium owners, or our board of directors. When we asked about this, we were told that that communication was identified because this was a agent whose website came up first in your search. So this is clearly inadequate and not meeting the standard of good government. Safety and traffic. As you know, there are two exits on Route 50 between Roslyn and the courthouse, and that is at Queen Street. So all that traffic comes up Queen Street to navigate a turn on Clarendon Boulevard. So it's already creating congestion, and it will do so with this. In addition, the traffic that turns and navigates Pierce Street to go to the new Woodland School will be only made worse with this bus stop. And a large daycare center was recently added to the block in the 1700 area of Clarendon.
Thank you, Ms. Robertson.
Finally, let me just say that there is no justification for this cost. There are already two bus stops within
Ms. Robertson.
a
Yeah,
four-block
thank you.
area.
Yeah.
That, in
Thank you.
conclusion, this means
Yeah.
you will be creating
Thank
three
you.
bus stops
Thank you,
in
Ms.
4
Thompson.
blocks.
Yeah, we will be talking. Thank you.
Thank you.
Right. We do have a minor adjustment to the speaking order, which both of our speakers have agreed to. So our next speaker is Ms. Bobby Fisher, followed by Sabrina Jones. Ms. Fisher?
This is not a good morning. My name again is Bobby Fisher. First, I would like to say something to the beautiful black men who are here today. This is the first time I have seen black people, other than myself, come to to speak before an all-white Democratic Party. You will not win on November 5. I have this ongoing problem against Diane Kress, who is the Arlington Director of Public Libraries. I am writing a book about racism in Arlington County. I have been harassed. I have been verbally abused by Diane Kress. She has sent police officers to the libraries in my neighborhood, Shirlington, Aurora Hill, to ban me from the library. I've done nothing other than to complain about homeless people inside the library. I was sent to the hospital because I contracted the virus. In the hospital, I have to sit next to people and smell their bodies. 12 police officers, 12 police officers came to handcuff me out of the library, out of Aurora Hills Library. I'm looking for an attorney. I'm going to sue Arlington County government. I am so angry, so upset. 12 police officers within the year, 5 incidents, who
Thank you, Ms.
wanted
Fisher.
to arrest me.
Thank you, Ms.
Arrest me,
Fisher.
and they handcuffed me
Yes.
in front of everybody.
I'm sorry, we have
And you're
we
the
have your-
worst, and you're the worst, Libby Garvey. You've been to my home.
I have been to-
You are the worst.
I have
You
been to your
are
home.
a racist.
You have been angry for a long time. We have all of your written materials. Thank you.
Right to be angry.
That's just right. Thank you. Thank you. Our next speaker, please.
Yes, our next and final speaker is Sabrina Jones.
Good morning. Thanks for having me. Good morning. My name is Sabrina Jones. I stand before you today as a proud worker at Arlington Transit and a member of ATU Local 689. Unfortunately, ART stands as the sole transit agency in Northern Virginia without a union contract. ATU Local 689 and TransDev has been negotiating over the ART collective bargaining agreement since May 2024. TransDev has consistently come to the table either with insulting low offers that have included cuts for already underpaid workers or has canceled bargaining sessions altogether. Even under TransDev's latest proposal, our workers would still be the lowest paid in the whole region. It's totally disgusting. To put this into perspective, the living wage for a single adult with no children in Arlington is $28.29, according to MIT. Similarly, for 2 working adults with a child, it is $28.34 cents. For a single adult with a child, it is $52.84 cents an hour. TransDev offers simply do not make it there for new workers, which is especially ridiculous in the midst of national shortage of a CDL permit holders. Likewise, they fall short of the top rate of peer transit companies for more senior workers, who should be treated with the respect they have thoroughly earned. In fact, we are only being offered 5 days of sick leave despite being supposed frontline heroes. If Transdev refused to pay its workers living wages and provide benefits in line with the rest of the region, its contract should not be renewed. This means either that the company refused to adequately pay art workers or underbid the contract to run art. It also adds that the county has complete freedom to speak with ATU Local 689 while they cannot directly bargain. Art is a public service, and nothing stops the county from communicating with employees providing those services. It's time to stop hiding behind contract and transit models of the past and do right by the working families in Arlington.
Thank you, Ms. Jones. Thank you. And I think you have people with you.
The operators can stand up, please.
Yeah?
These are just a few of your operators here in Arlington. We love our residents. We love you guys. Thank you.
Thank you, and thank you for the service that you provide. Thank you. All right, I think that's our final speaker. And we're going to take just a quick pause and adjust the curtains here because some of us up here are finding we can't see because of the sun in our eyes. So Mr. Kushner's just going to adjust the curtains a little bit. And once we've got that set, we'll go ahead. Does that work? We're good. All right, very good. Thank you. All right, thank you, everybody, for coming today. We started out with David Girk and was coming to talk about EHO and when we're going to be making comments or hearing things or interacting more with our public about it. And at the moment, the judge has not rendered a final opinion in this case, and until that time, we really can't talk about it. I don't know, Mr. Girk, are you here? I don't see you. There you are, right up front, yeah. So once the judge renders his opinion, which we think is going to be the 25th, is that correct? We think by the 25th, Ms. Kaur, that the judge will be making a final decision that we can see?
Yes, it's currently, well, he said that he would enter an order on or before the 25th.
Okay, on or before the 25th. So once that happens, that will change. But up until that time, we really can't comment publicly. So but thank you for coming. And then we had, I think, Mr. Gruber, I think, coming and talking about medical debt. And I have read about this, about other places doing it. I think it's a great idea. We have, as a county, we have done a pilot with guaranteed annual income and some things like this that also can be worked with. So I suspect I'll let my colleagues comment, but it's an interesting thought, and I think it can make a huge difference in people's lives, and I'll just invite my colleagues to see if they would like to comment on it. I'd be interested in looking into it at least. Anybody else want to say anything? Mr. DiFranti.
Thank you, Madam Chair. There was as I'm sure you know, there was a Washington Post article about the work that the District of Columbia has done on this. I don't save many articles from the Washington Post but in paper, but I did save this one, and so I'd like to just join the chair and in wanting to follow up on it. I do think we need to figure out the specifics, and mindful that, you know, we would, working with any individual organization, we would have processes regarding procurement that we have to follow. So I'll just take willingness to follow up with you or whichever colleague and engage with the manager. I do also think we need to, you can imagine that what constitutes debt for whom, right? There are wealthy folks who absolutely have large amounts of debt. We probably wouldn't be interested necessarily in that policy, so we will follow up.
Okay, any other? Yep, Mr. Karantonis.
Thank you, Madam Chair. In alignment with everything that's already been said, after I had a conversation or an exchange of emails with Mr. Gruber on this, I looked a little bit about what DC is doing and how they're doing. One thing that I found absolutely interesting, not in a positive way, is that the pennies for when a city comes to the rescue and buys pennies for pennies on the dollar. This is most debt that has been torturing the households, the affected households, for a very long time. So it is about time to have a very honest conversation about this, and I agree with my colleagues here that we should dive into that and look at this. There is an additional reason, and I say that for the public awareness. Just this week, we had a round of regular check-ins and working with our affordable housing providers. One of these housing providers did some deeper dive into the statistics of how their tenants are insured. This is affordable housing, we're talking about that. These are households that make less than 60% AMI. 25% of the households have no health insurance. 1 out of 4. Can you imagine that? This is really the order of magnitude of the problem we're dealing with. And I believe that this is only the crust, and the iceberg is really below that. So this is a real issue, and we should continue to focus on that. Thank you.
Ms. Coffey.
Yeah, I'll try not to restate things others have said, but I've done a lot of work in my professional career on social determinants of health, and I think it's very clear when we have place-based and racial differences in terms of healthcare access that manifests in actual healthcare outcomes. And so we have a 10-year difference in life expectancy in Arlington. And the data that Mr. Cantones has cited, and of course what you've shared as well, we know that that's a contributing factor. And so I would be very interested in looking into this.
All right. Ms. Cunningham.
I'm also interested, but don't need to say more.
Yeah, no, that's fine. Thank you. All right, so thank you for coming. And actually, for those listening, we do have the Arlington Free Clinic that does provide healthcare. So there are services, and of course, our own Department of Human Services. So if you're listening to this and have a need, there are services that are available to you. But this is a very intriguing thought that I think, as you can tell, we've all actually been thinking about. So thank you for coming. Next, we had Ms. Thompson, Dinesha Thompson, talking about traffic in Cherrydale and a variety of concerns. Some are easier to address than others. We do have Vision Zero. Ms. Thompson, are you, I like to, there you are. Yeah, I'm sorry, I'm not seeing as clearly as I should. Anyway, we do have our Vision Zero, which works a lot on safety, pedestrian safety particularly. And I would think, particularly with your stop sign, that some well-timed ticketing probably would help that. And I know we have also got more, we've hired more people to do traffic enforcement, which can help. So it is a problem that we are aware of, and thank you for bringing to our attention that particularly maybe Cherrydale's got issues, and we can bring that to the attention of our police and our ticketing. I don't know if our manager wants to add anything at this point on Vision Zero or what we're doing with traffic enforcement.
I think you summarized the steps we're taking also. I would encourage the individual who came, she can speak with Caitlin afterwards, but also call the non-emergency police number. We cannot be everywhere at all times, and we're looking at future steps to try to improve traffic enforcement, perhaps with some help from the General Assembly. But we will absolutely follow up on that. We're able to focus patrols if we have information on it.
That's great, thank you. And so, Ms. Thompson, if you'd like to meet Caitlin Thomas, right, you'd like to raise your hand. She'll be in room 311 afterwards if you'd like to talk to her, and she can give you a little, like the number to call and some things like that if you would like, okay? She'll be after we break up here, after the public comment.
Madam Chairman.
Yes.
And I would just add specifically to Cherrydale, we have had a number of requests for additional parking enforcement, especially around some of the businesses in Cherrydale. So Ms. Thomas may be able to find those in the system and give an update on the last couple of weeks of activity. We did prioritize that for police as well as our Commissioner of Revenue to do some checking on what's going on. So thank you for being here.
Yeah, thank you. And then that brings us to, Mr. Carantonis, did you have, or is that just a residual?
No, that was residual.
Okay, thank you. Ms. Robinson came to tell us of the opposition for a stop island for a bus, I think, bus stop at the 1600 block of Clarendon Boulevard. Thank you. We have been hearing from folks, and I gather Ms. Coffey has been out there to see you. I will ask, I am not as familiar with this particular issue as I might be. I know we're aware, I assume we are doing into it. And I don't know, Ms. Coffey, if you'd like to make a comment, or I'd ask our manager again on what the process is and where we are. Ms. Coffey?
I'll pass it to the manager, Caitlin. I know that you've met with the residents as well.
Yeah, let me start, and then, again, Caitlin will be available to talk to Ms. Robertson if she'd like. There was a bus stop in that block that was removed at one point, and when we're trying to figure out where to put in the bus stop, we received some comments from a sight-impaired resident about where the bus stop had been. So we explored alternatives, and also there's been introduction of a bike lane there. So, you know, I don't want to be dismissive of people's concerns, but at the end of the day, there really aren't all that many places when you do the engineering where you can actually put a bus stop, and this is one of them. It may not be the best stop for everybody, but overall, it's the best choice we make based on our standards. And I don't know, do you want to add anything to that, Caitlin?
You're on. Nope, you just turned yourself off. It's hard to say. Yeah, that's good.
Yes, thank you, Mr. Schwartz. That, in addition to the fact that, yes, it was initiated by a visually impaired resident, WMATA and transit staff did an on-site review and decided it was warranted based on many factors which are included in the Arlington bus stop guidelines and standards. And among many factors, a couple that were cited were bus stop spacing and ADA accessibility.
Thank you. So, Ms. Robertson, I think there have been a lot of professionals looking at this, and I assume we could have them do a more thorough explanation, Ms. Robertson, where she's not here. Okay. So it's possible that we need to do a more thorough explanation of why we are doing what we're doing.
We'd be happy to do that. And also, she did make a point up front, which I don't want to skip over, which is that she said that the Worcester and the apartments weren't contacted. So I will say that it's always a work in progress for us to get the right contacts in our multifamily buildings. We did have a contact, and it was a good contact at the time we had the contact, and then the management changed, and we didn't get an update of that. That will happen on occasion, but we did meet with the local civic association. We try as best as we can to provide information, and also information on the scene about what's going on. But I will tell you, because it's happened to me, sometimes not everybody will hear about what they need to hear about. So I acknowledge that. I'm not sure what we could have done differently, but we will continue to endeavor to do better on in those circumstances.
Thank you. Thank you for addressing that particular issue as well. Ms. Cunningham?
And Mr. Manager, Caitlin, may I ask a question about the response? I think there was also a question about having written in perhaps or called in and not getting a response back. Are we still within the 2-week window that we anticipate getting back to each constituent?
Multiple staff in DES have collaborated with a resident at the Worcester. He has been in contact with myself. I met with him for an hour in person. He's been to Open Door Monday, and he is now, we have updated our contacts. He is the correct contact for that building in our records. And just yesterday, we had an SME explain in detail to him. So happy to speak about it again. I'm happy to give everything we have to the residents.
Great, thank you.
Okay. All right, thank you. And I'm pleased to see that we have obviously trying to do a lot of outreach, and sometimes people just don't like the results. But I understand if we've got people who are impaired, vision impaired, or have some issues, we have to make sure that the stops are safe for them. Okay, we'll go on to, that brings us to Ms. Fisher, who has been here before and has a longstanding issue with Diane Kresh. I know in our library that we have heard about, and I know our staff, not only the police, but a lot of our staff have been in touch with you quite frequently over the years. And that brings me to Ms. Jones and all of the folks from all of our drivers. Thank you for coming. I am going to have to turn to our manager or maybe it's even our attorney. As I understand it, TransDev is doing negotiations right now, which I think are not complete, and we are not part of those at this point. We have a contract with TransDev, and I believe I can say that the contract provides them with funds to provide a good, fair wage, and then they do negotiating, and I will stop at that because I'm going to get out of my depth pretty quickly, I think. Mr. Manager, would you like to comment on where we are with
I'm not sure I can add much more to that, but I do want to make sure, and I know you were all going to say this anyway, to thank all the drivers who came today. They do a fantastic job. And I think Ms. Jones said that we love having you work in Arlington. It's a great place to work, and we're really optimistic that to the extent we've had conversations with TransDev, we've made it clear to them that it's the right thing to do to reach an agreement so that we can, get on with providing the bus services.
Yeah, an agreement that's fair to everybody. Yeah, thank you. Any other comments that my colleagues would like to make? Mr. Karantonis.
Thank you. Ms. Jones, I believe I know you. You are either my driver on 77, 45, or 41. And thank you for coming here. And thank you, everybody, for being here. This is an essential service. We absolutely understand that. And we understand that it needs to be properly compensated for the enormous support and infrastructure service that it provides to Arlington. What you hear here is we don't want to intervene in a negotiation, but that doesn't mean that we are not watching what happens in a negotiation. So in that sense, I leave it there. We are really watching. I think this applies to all my colleagues and to the county manager as well. Thank you.
And I think, Mr. Schwartz, this is a new situation, right? It hasn't been handled this way before, so it's new to us as well, I think. Is that correct?
Well, and I think that the drivers here will know about, I think it's accurate to state there was a change in ownership and also a change in collective bargaining representation. So there has been, that's an unusual set of circumstances that's being worked through.
Yeah, thank you. So it's a bit bumpy. It's new to us too, new to you. And again, just to reiterate what we've all said, we really appreciate your service. Thank you very much. We can't be directly involved because that's not our role, but we are absolutely watching, and we appreciate hearing from you and appreciate what you do each and every day for our residents. So thank you very much, and thank you for coming. I think that brings us to the end of our public comment at this point, and I will go on to our consent items. If you would like to stay for a very exciting meeting coming up, you are welcome. But if you have other things you'd like to do with your day, you're also welcome to leave. So thank you all for coming. Take care. Enjoy the weekend. They're all late. All right. Okay, colleagues, that brings us now to our consent agenda. Mr. Kushner, have any items been pulled from our consent agenda today?
There have not.
All right, nothing has been pulled. I will entertain a motion to adopt the consent agenda.
So moved.
All right, motion has been moved and seconded, moved by Mr. DeFranti, seconded by Mr. Karantonis, and that's items 1 through 29. All right, thank you very much. All in favor of the consent agenda, please say aye.
Aye.
Aye. All not in favor, no. Motion passes 5-0. Thank you very much. All right. I will go over a number of the items on the consent agenda because just because it's consent, it just means it's not controversial. It doesn't mean it's important. A lot of times it involves a lot of money, depending on what the item is. So I'm going to just go over a couple and highlight for folks a couple of the more interesting items, and we've got some slides to go with that. First was an amendment, we approved a zoning ordinance amendment that will allow the owners of non-conforming townhouses and multifamily buildings in RA and R27 zoning districts. It's very kind of administrative, this particular change, but to allow them now to make interior structural alterations, and if they can change what's inside the house in these non-conforming buildings without having to go to the Board of Zoning Appeals. And this is just something that makes it more reasonable for people trying to make reasonable changes. And this project affects a number of communities, including my own Fairlington, where it has become an issue that's been difficult for homeowners, difficult for the contractors, and difficult for the Board of Zoning Appeals, all for no good reason. We fixed it. So glad that went. Next, we also approved the use of $1,276,000 of Arlington Neighborhoods Program bond funds for 3 priority neighborhood projects that have been worked through our Arlington Neighborhood Advisory Committee. And this is a group that looks at projects here in Arlington, and it's a way of having people be able to find projects that they particularly want to have done in their neighborhood, and there's quite a process, but it really helps people improve their own neighborhoods with help from the county. The first was a neighborhood science program, so a number of places would like to maintain, replace, relocate, and redesign their neighborhood signs across 16 different neighborhoods, so we're going to spruce up how we look. You'll probably notice it as you're driving around. And then also Shirlington Park on 2601 South Arlington, it's right up here in front of you. This is going to include some significant pedestrian safety improvements. If you sat and listened to the discussion we just had about Vision Zero and things, we are constantly working to improve our pedestrian safety, and this should help with that. And then also some improvements to Glen Carlin Park, Grandma's Creek, and this should help mitigate erosion and eliminate invasive plant growth. We're trying to continue to improve our natural environment and strengthen it. And then that gets us to number 20, and I would like to turn item 20. Usually the chair goes through all of these, but this is one that's near and dear to the heart of Maureen Coffey, and I'd like her to just talk about that a little bit.
Yeah, thank you. I'm happy to be a special guest star today.
That's good. Gives me a break. That's good.
I can't take credit for starting this, but I'm really excited for where we've gotten. The board is just approved in our consent agenda 3 grants to childcare providers under the expansion of affordable quality childcare notice of funding availability. And so these grants support capital investments that allow providers to expand the number of affordable childcare slots in the county on a sustainable basis. And so the awarded providers, there are 3 in this month. I think we're maybe going to have a couple more hopefully coming in November. But Arlington Montessori House is going to be providing 5 affordable slots for 25 years. And we're giving them capital funds to reduce their debt to build a new standalone classroom. I think hopefully targeted to infants and toddlers, but maybe not specifically. Kinhaven is going to be able to provide 16 affordable slots for 10 years. And we're giving them money to install a playground and fully build out their space. And Northern Virginia Family Services is going to be able to provide 18 affordable slots for 6 years. And the capital money we're giving to them is going to subsidize rent at Dinwiddie and Glebe Road childcare centers. And so these grant awards are part of the county's childcare initiative, which was started by Katie Crystal many years ago, and is continuing onward and doing really good work. It's a strategic framework to address challenges in childcare for Arlington families by focusing on 3 areas: accessibility, availability, and quality. And so in 2023, the board allocated $5 million in one-time funding to this notice of funding availability, and the remaining money we're going to use for another NOFA that's on a bit of a smaller scale, but investing in capital is really important because with the margins on childcare being so thin and families paying so much, it's often really challenging to create affordable childcare slots where you're accepting the subsidy dollars from the state. Those dollars, while they cover maybe the bare minimum cost of care, they don't go that far. And so when we look at expansions of childcare and we look at the average price of childcare in Arlington County, which I believe on average we're approaching almost $30,000 a year, Yeah, I see some heads shaking in the audience. That's not sustainable. And in order to build out new affordability, that often means taking on debt, but lenders don't want to lend to a business that they can't guarantee is going to make that money back. And so to have the county be able to step in and provide those funds is huge. Even though we've been expanding childcare over the last several years, expansions in affordable childcare slots have not kept pace with the total number of slots. And we have many people in our community who are in real need of childcare. It enables people to go to work. It enables them to feel safe and confident that their kids are receiving the care and education that they need. But currently, only 1 in 9, this is a national statistic, but only 1 in 9 eligible children for subsidy actually receive a subsidy. And so it's very competitive. We have a wait list here in Arlington County. And so this is just one part of addressing that. Hopefully we can keep doing some good work. But thank you for my little guest spot in today's consent remarks.
Thank you for being a guest speaker on the consent items and for taking up the mantle of Katie Crystal on childcare. As you can all tell, I've been around a long time. I sort of was involved in trying to worry about childcare many, many years ago and have just been appalled when I kind of resurfaced and look at it again. The problem's still here. Most of the rest of the advanced world has solved this or gotten a lot closer. It's just appalling where we are, and it's hard for local government to step in as much as we do when you don't have state or federal government stepping up like they need to, but we're doing our best. Same thing could all apply to the person's not here anymore, to healthcare, right? There are just so many things that we need to try to fix to take care of our people so that they can be functioning and do well in our society. I think, Mr. Karantonis, did you have something you wanted to add? I was seeing you.
No, I can add only one thing, just as an anecdotal thing. So I was very puzzled by the fact that just yesterday at the VRE board meeting, there was a member, a colleague of us from the city of Manassas who couldn't attend because of childcare problems. So I did a little tally about elected officials who cannot participate fully in their job because they don't have childcare. Also, coincidentally, all female, which is an additional wrinkle to that. So it was 8 out of 21 meetings.
Yep. It isn't always women. Chair of the Fairfax County Board needed childcare to participate.
You're saying, so you add to my statistics.
Exactly. Anyway, thank you all very much. Got a couple more items I wanted to just go over. We also accepted a $50,000 2-year Kaiser Permanente grant, which is kind of cool. This is to compensate people who are participating in our Arlington County's Continuum of Care. Our Arlington Continuum of Care works to make sure that homelessness is rare, brief, and non-recurring, and it provides affordable and sustainable housing, tailored services, and centering the voices and expertise of people with the lived experience. And these are the people who are going to receive this compensation from this $50,000 grant. So people are going to get paid for the experience that they bring and helping us solve this problem, and that experience they have gotten at great expense to themselves. And I'm really glad that we can do this. And then finally, we are advertising the future public hearing on an amendment to the Master Transportation Plan map, and that will add existing public right-of-way in the 2600 block of Shirlington Road as a new street segment, which is going to be called 26th Street South. And both the Planning Commission and County Board will be hearing this proposed amendment to the transportation plan, this new street, at our meetings in November. And with that, I think we're ready to move to our regular hearing items. Mr. Kushner, would you like to call the first item?
Pardon me, apologies.
That's all right.
All right, our first regular hearing item is item number 30, a zoning ordinance amendment, 2024-05, to amend, reenact, and recodify the Arlington County zoning ordinance, Articles 4, 5, 6, 7, 12, and 18, to define recovery residence and allow as a residential use by right for 8 or fewer residents in one-family detached dwellings and subject to use permit approval for more than 8 residents and/or in other dwelling types.
Thank you. Mr. Manager, over to you.
Thank you, Madam Chair. Joining me on the dais is Debbie Albert, who will be making the presentation, assisted by Cliff Hogan, and also Suzanne Somerville. So I'm going to turn it over to you, Debbie. Thank you.
Nice to see you again. Good morning. It's all right. Take your time.
Good morning. So as the manager said, I'm Debbie Albert with the Department of Community Planning, Housing and Development in the Zoning Division. I'm here with Cliff Hogan, also of the Zoning Division, and Suzanne Somerville, our Clinical Services Bureau Director in our Department of Human Services. Just skip the slide.
Can we pause for a second? Our screens just went off.
Hold, please.
Sorry, I just didn't want you to get to your presentation when we can't see it.
Thank you. I could use a minute.
I mean, we can.
I can see, yeah.
These. Just wait, go.
Immediate. Yep. If you give me just a moment, I can reach out to our tech folks, but I do not have an immediate fix for that.
Turn that one around.
You can if you have your own personal laptops. I can send you the Teams link, and that would be the best way to view at the moment.
Do you want me to? I think we only have one. Can we turn that around?
We can print the PDFs if you want to send it, or the PowerPoint.
Sorry?
If you want to send the PowerPoint, we can print paper copies.
To who should I send it to?
If you send it to me, I can run off paper copies right now.
Okay. There's like 30 extra slides in there.
I'd also be happy to, if everyone is okay with the brief interruption, I can reboot the system if that helps.
We can proceed if everybody is okay and being able to follow the presentation on their laptop. So I hope that's okay. I cannot speak for our chair because she has a smaller device here, but I believe it's capable of doing that. And I can share with her, and I have it also printed. So we are good to go. Thank you. We are.
Okay, thank you. So this is a proposed zoning ordinance amendment. Our presentation will cover the proposed amendment, background and staff analysis in terms of how we got to the proposed amendment, and then we'll get to advisory group and commission recommendations as well as the staff recommendation. This is a proposed zoning ordinance amendment that would define recovery residences consistent with the definition in the Code of Virginia, which includes a residence certified by the Virginia Department of Behavioral Health and Developmental Services that provides alcohol and illicit drug-free housing to persons with substance abuse disorders. The proposed amendment would allow the proposed use by right in all single-family dwellings for up to 8 unrelated people and subject to use permit approval by the county board in all other dwelling types and/or for more than 8 people. This study was triggered by a reasonable accommodation request under the Fair Housing Act as a result of a zoning complaint investigation citing too many unrelated people living in a dwelling. The request cited the 1988 amendments to the Fair Housing Act, which define people in drug and alcohol recovery as disabled under the Fair Housing Act. Currently, the zoning ordinance has no path for compliance for recovery residences with 8 unrelated people, as limited by our definition of family that allows a maximum of 4 unrelated people. However, the zoning ordinance does provide, as a matter of right, meaning no legislative approval is required, for up to 8 unrelated people under 2 specific circumstances. That includes up to 8 people with mental illness or intellectual or developmental disability, as well as up to 8 unrelated people who are aged, infirm, or disabled. For these 2 types of groups, the Virginia Code mandates that up to 8 people are allowed in any dwelling with a resident or non-resident staff or counselor, and that facility or residence is required to be licensed under either the Department of Behavioral Health and Developmental Services or Department of Social Services, respectively, depending on the type of disability. In those cases, the requirement for the staff or counselor and the licensing is to ensure that the staff and counselor are properly trained to provide support for activities of daily living to meet the needs of these specific populations. While the recovery use residence had not previously been brought to our attention in the context of zoning recommendations, there is a recommendation in both the county's 2015 Affordable Housing Master Plan as well as the 2023 Regional Fair Housing Plan, Arlington's element, that recommends a future zoning study for the definition of family to consider broadening that definition. The scope of this particular study for recovery residences was intentionally kept very narrow to address just the reasonable accommodation request in front of us today, as that broader study of family, as recommended in those plans, is included on the CPHD Planning Division's work plan and anticipated in calendar year 2025. I want to talk a little bit about the definition of recovery residence as defined in the Code of Virginia. In 2019, so pretty recently, the Virginia Code was amended to include a definition of recovery residences as a housing facility certified by the Department of Behavioral Health and Developmental Services that provides alcohol and illicit drug-free housing to individuals with substance use disorders and co-occurring mental illnesses, not including clinical treatment services. Certification for a recovery residence is a 2-step process, so it's a little different than the licensing process for residential facilities on the previous slide. There are 2 recognized credentialing organizations under the Code of Virginia, and they are Oxford House, Inc. and the Virginia Association of Recovery Residences. So first, a recovery residence must be credentialed under one of these 2 recognized organizations, or in the case of Oxford House, it's an Oxford House charter. Once they have that step, they can apply for certification under the state, and that state certification process generates a list of recovery residences throughout the state. And once they're certified, recertification is an annual process. At this point, I'm going to turn it over to Suzanne Somerville to talk a little bit about substance use and the recovery population in Arlington.
Okay, good morning. I'm Suzanne Somerville. I'm a Bureau Director with Behavioral Health Division in the Department of Human Services. And that's quite a mouthful, I understand. So one of the things that I really want to stress today is that we are talking about people who are Arlington residents. And first and foremost, we are talking about people. We are talking about people who are dealing with substance use disorders and are in need of support, particularly in early recovery. Recovery residences provide this support, provide a safe and sober place for folks to live and to work towards maintaining recovery and returning to a position of fully functioning at their best level within our community. So this is a key element in recovery for people. And again, I say these are our residents, our neighbors, our family members that we are discussing. So substance use is an issue that continues to impact the entire nation, and Arlington, as amazing as we are, also has that issue. I will also oversee the opioid response with the RE stakeholders group. And with that, we do a lot of work around prevention and relapse prevention. And recovery residences are a key component of that. We also have sought federal funding to be able to support people in early recovery in the recovery residences. And we have, for the past couple of years, had 47 exactly, actually, folks that we have supported financially with rental assistance as they're first coming into the recovery residences, with the expectation that they will be able to become independent and function on their own. And we'll continue to do that as long as we can provide this assistance for people, particularly in a very challenging part of their journey. They need that support. Most of the people that are in the recovery residences in Arlington are connected to behavioral health services. Therefore, they have support, they have treatment. It varies on what level of care that they need, and some people are in very intensive level of treatment. Some people are in a much less intensive level. But the majority of the folks that are connected to the recovery residences are in treatment. So I think that covers what I was going to say about that.
Thank you.
Thanks, Suzanne. So now I'm going to jump into staff's analysis as we assessed a proposed zoning ordinance amendment. As part of our analysis, we often, for zoning ordinance amendments, look at how other jurisdictions might regulate a similar use. We looked at other jurisdictions in Virginia. We found that two of our immediate neighbors, Alexandria and Falls Church, already allow up to 8 or an unlimited people in the case of the city of Falls, or Alexandria, to live in a dwelling, so no special provisions would be required to provide a recovery residence for 8 or fewer people in those jurisdictions. Our neighbors in Fairfax County and a little further afield, James City County, both allow recovery residences up to 8 people as a matter of right under interpretation of their existing zoning provision, using that provision that allows developmentally disabled and mental health residences for up to 8 people by right. The city of Harrisonburg has provisions in its ordinance that are almost identical to what we are proposing today. And Chesterfield County has similar provisions that do the same thing. And then finally, in Loudoun County and Newport News, a use permit would be required for more than 5 or 6 people in the case of Newport News, with some additional restrictions. And then finally, Prince William County ordinance looks identical to what ours looks like today, and there is currently no path for compliance for a recovery residence of up to 8 people. As this proposed study started with a zoning complaint related to occupancy, we looked at occupancy complaints across the county over the years. When we use the term occupancy complaints, we are referring to complaints about the number of people in a dwelling under the zoning code, which again has that family definition, which restricts in most cases dwelling to no more than 4 unrelated people. As you can see, we have a chart here going back to 2016 with just 1 year that was missing. In 2018, as data collection didn't occur that year during a staff transition, but you can see that the number of complaints for occupancy under the zoning code has decreased over the years. And if you're looking at the top row of the table, those are the number of complaints that were actually validated to be over occupancy. We also looked at overcrowding complaints. When we talk about overcrowding, we're talking about the building code, which is the number of people that are legally allowed under the building code to live in a dwelling, and that's based on the square feet of the dwelling and the number of people and the number of bedrooms, and that would be for life safety purposes. That is a very, very rare complaint that we don't see very often. We have not received any in the last year. We don't have data for prior years just because it's a little bit more difficult to get it out of our old permitting system. As part of the outreach for this proposed amendment, we heard concerns from neighbors of some of the Oxford houses in the county currently related to the frequency of police service calls at these properties. So as a basis of comparison, we pulled police service call data for the 6 Oxford houses that are listed in Arlington County, as well as 6 of our mental health residences with up to 8 residents, because again, that's the use that we're saying that this is a similar use to and proposing to regulate it the same way. As you can see by the data here, over the last 2 years, there were a total of 55 police service calls for the Oxford House residences, with 46 for the mental health residences that we pulled data for. We see this as similar enough to be a similar use. I will note, in looking at, we've got a few stats on this slide. We do expect an increased volume of calls for these types of populations as compared to the average single-family house. We know that an average single-family house could go decades without a police service call. Others could have more. But we do expect more for these 2 populations due to the existence of comorbidities and mental health issues that are related to the individual's disability. We also expect differences in the types of services needed for these 2 different populations in the recovery residences versus the mental health residences, due to the differences in a substance use disability versus a developmental or mental illness disability. During outreach, we also heard from neighbors of recovery residences, specifically on North Stewart Street, that with the number of police service calls and other behavior, we heard suggestions to require a separation distance between recovery residences so as to prevent multiple recovery residences in close proximity to each other. Through staff analysis of existing recovery residences as compared to other residential facilities, as we discussed on the prior slide, we don't propose a separation distance. We see the uses as being very similar from a land use and service call perspective. Again, though, from a zoning perspective, we are mainly looking at similarities from a land use perspective. We also heard concerns about parking issues related to allowing up to 8 people in a recovery residences when most single-family homes are limited to 4 unrelated people. On this slide, I'm showing parking requirements for single-family neighborhoods. Most single-family zoning districts require 1 off-street parking space. This is something we regulate under zoning, except for our R5, which is our smallest residential district, which requires 2 parking spaces. We also looked at car ownership across the county. The average single-family house has an average of 2.05 cars. And we were able to obtain data for car ownership across the 6 Oxford houses in the county, and they range from 1 car to 4 cars in one of the houses with an average of 2.6. Again, we see a similarity there, and we don't propose to impose an additional off-street parking requirement for recovery residences. We also believe that the number of recovery residences across the county will be limited due to the available rentals and rental costs in this county. This next slide shows a matrix of the types of complaints that we often hear from residential neighborhoods, people complaining about their neighbors or other issues. The reasonable accommodation requests that led to this proposed amendment originated with a neighbor complaint, and the associated enforcement process related to the number of occupants in a dwelling. And this, again, is something we regulate under zoning code under our definition of family. But we also heard a number of complaints about the proposed use, not dissimilar from the range of complaints we hear generally across the county. This slide, if you look at the top row, those complaints listed in, or those types of complaints listed in gray are things that are very multidisciplinary. Often complaints we hear from neighbors don't fit neatly into one code or one discipline, and staff has to collaborate to address these complaints. I want to talk a little bit about some of the specific complaints we heard related to this issue, but I'll start by saying if you focus on the 2 green squares on the slide, off-street parking and over-occupancy, those are the 2 types of complaints that we try to regulate through zoning code. The other complaints that we hear are addressed and enforced through other codes. On the top row, One of the complaints that we did hear was about number of visitor parking. So if you follow that second gray square parking all the way down to the second purple square that says residential parking permit program, that's one of the things that residents, if they find that there are a lot of cars parked on their street, not related to people who live on the street, residential permit parking is something that the neighborhood can collectively pursue and explore. To resolve that issue, we also heard some complaints about condition of private property. Those are things that would be addressed, such as trash or overgrown weeds. Those are things that are addressed under our building code. Happy to talk more about any of these issues and how they're enforced. All that is to say is that, as you can see from that previous slide, interdepartmental collaboration is needed in order to address a lot of complaints received by the county. And we don't necessarily expect private citizens to understand under which code a complaint is addressed, and we don't expect citizens to know what a recovery residence is. This was a new use to us as we pursued this zoning ordinance amendment, or who lives in those residences. So in furtherance of the goal of ensuring that county staff are competently and collaboratively able to elevate issues as they are received for this new use, we have initiated a conversation interdepartmentally with the goal of educating staff of this use and making sure that they have the tools to learn about recovery residences, the forms under which they can be operated under Virginia code, under our zoning ordinance should the proposed amendment be adopted, as well as how they might elevate issues to work and partner with the credentialing agencies in the state whose mission it is to facilitate these recovery residences. Just a couple other regulations throughout the county and I'm focusing a little bit more on the Oxford House model because right now we know we have 6 Oxford houses in our county. We do not have any Virginia Association of Recovery Residence properties in the county. All Oxford houses under their model are rental properties. And so these are just a couple of the things that landlords of rental properties are subject to in the county. If they have more than $10,000 in rental receipts on an annual basis, they are required to have a business license and pay a business tax. In addition, the Virginia Uniform Statewide Building Code and the Code of Virginia require landlords to maintain working smoke alarms and to fabricate proof of that to the fire official upon request. If the proposed amendment were to be adopted, by defining the use, recovery residences, as a new use, if someone wanted to establish a recovery residence in the county, and this would include all of the 6 that are currently existing, they would have to go through this process. They would apply for a certificate of occupancy for a change in use. And that would trigger both a zoning inspection and a courtesy building inspection. We plan to include the contact information for the relevant credentialing agency on the certificate of occupancy. The intent of that is, again, for staff use so that staff can use it to elevate issues in cases to the credentialing agency in cases where that might be appropriate and where they may be able to help resolve issues and or to connect the complainant with the credentialing agency so they may speak directly. And that is, in our conversation, something that Oxford House is happy and willing to do. They want to be good neighbors. So moving on to advisory group and commission recommendations. 4 advisory groups and commissions heard the proposed amendment, with 3 providing letters in support of the proposed amendment and 1 expressing support of the amendment in an information item that staff attended. That includes the Community Service Board, who in their letter affirmed recovery residences as an important element of the continuum of care for individuals in recovery. And in addition, the Planning Commission and the Housing Commission. And then, again, the Disabilities Advisory Commission heard the item as an information item. In their conversations, both the Housing Commission and the Disabilities Advisory Commission did also express support for further expanding the definition of family to address other disability groups. Again, not the scope of this study, but would be part of that future study. Oops, wrong button. So in summary, the amendment proposed by staff is designed to provide the same access to single-family dwellings to residents in recovery from substance abuse disorders in certified recovery residences as the county already allows for residents with mental illness, intellectual or developmental disability in licensed residential facilities. It is designed to complement the services the county provides through our Department of Human Services and the Community Services Board for persons challenged by mental health, developmental disabilities, and substance use disorder. It is designed to be consistent with the definition of recovery residence in the Code of Virginia. And finally, it is to provide an interim step in broadening our definition of family with a narrow scope to meet the reasonable accommodation request in front of us in the short term without presupposing the outcome of a future proposed planned zoning study. With that, staff recommends that the county board adopt the proposed amendment to define recovery residences and allow them by right for up to unrelated people in single-family detached dwellings and for more than 8 subject to use permit approval. We do have some small edits to the proposed definition to make sure it is in alignment with the Virginia Code definition, which I know was mentioned by one of the public comments on this item. It was our intent to align it with the Virginia Code definition, and we do have some edits that we would recommend that the board adopt as well that would align that text more exactly with the Virginia Code definition. That concludes staff's presentation, and we're happy to answer any questions. Thank you.
Thank you. Thank you, Ms. Albert and Ms. Somerville. And I think we'll turn now to our advisory groups. Mr. Kushner, I think we have a number of people here. I can see some of them. Yeah.
Great. I believe we have Elizabeth Escobar here with housing.
Good morning.
My first time here, I speak in the mic, right?
No, that's fine. That's fine. And when you're done, you may want to sit closer because we may have some questions for you when we get into the board discussion. So thank you.
Good morning, everyone. My name is Elizabeth Escobar. I'm here on behalf of the Housing Commission. I would like to keep my statement brief, so I'd like to highlight 3 points that were discussed in our meeting. The first one is that the commission felt strongly that the recovery residents should be treated like any other homes for individuals with disabilities, since, as mentioned, individuals suffering from substance use disorder meet the legal definition for the disability protected class. So it would be discriminatory to restrict people from having 4 unrelated individuals in a home instead of the 8 as proposed by the Oxford House. The second one would be that we took a moment to discuss like the concerns of neighbors and like the police presence and all the calls and issues that were highlighted during the presentation as well, but we don't believe that that's related to the actual ordinance proposal for increasing the cap from 4 to 8 unrelated people in a home. And then the third would be to just think a little bit more broadly about the implications of this rule. We believe that, well, some commissioners expressed concern that the existing zoning ordinance discriminates against non-traditional families, renters, and low-income individuals that would like to live in single-family homes in Arlington. As a result, the commission supports the staff recommendation and voted 8-0 at the October meeting and recommend approval by the county board.
Thank you. Thank you so much, Jeff. And you're welcome to just sit closer if you'd like. Thank you.
We next have 2 members of our Community Services Board, Mr. Paul Kalchbrenner and Daniel Adams, who I believe is joining us virtually.
All right. Good morning. I'm going to invite you to stay up here too, because we may have questions, I'm not sure.
Okay, so I have 2 minutes or 5 minutes?
You have actually, you can actually sit at that table. We do, because you're a commission, we don't limit you.
Okay. Well,
although if you went on for a really long time, I might suggest that you wind it up, but you're fine.
I will not take too long.
I don't think you will. It's fine.
So first of all, thank you to the county board for this opportunity. My name is Paul Kalchbrenner. I'm a member of this CSB. I have been for the last 5 years. I've been a member of the SUD committee for the last 6+ years and its chair for also almost 5 years. And before that, I was also involved with ARI, going back to 2017. I'm a 25-year resident of Arlington. I have 3 kids, 1 in college, 2 in high school. My wife is a longtime teacher in Arlington Public Schools. I'm an attorney and currently serve as a public health advisor with SAMHSA and the Office of Recovery there. I want to start out by saying that 36 years ago, when I was starting my recovery journey from SUD at age 19 into my 20s, I was in the same position as, the residents that we're talking about here. And just like them, I needed help and support. A critical support that I had was living with other people in recovery for most of my first decade in recovery. The landscape was a lot different then in terms of recovery housing, but I did find the value of living with other people on this journey. And over the years, I've encountered, I'm sure, thousands of people and close friends with hundreds of people that have utilized recovery housing and other types of recovery support. And again, was foundational for them getting through those early stages. As you know, many people do not have a family to live with, and oftentimes family or other previous living situations are not safe and supportive. They're not good places to go, and they jeopardize people's recovery and can cause further harm. We know recovery works. At SAMHSA, we've done a lot of surveys. There are an estimated 20 million Americans in recovery from SUD. And so if you extrapolate that, there are no doubt thousands of people living, working, raising families in Arlington who are in long-term recovery. I'm certainly not alone. There's also been many studies conducted around recovery housing and other supports. We know they improve outcomes. Being in a recovery residence does many things. It fosters a sense of community and creates hope. It creates accountability of the individual to the other members and themselves. It provides the stability needed to find employment, pursue an education, develop a career, and meet other personal and family obligations. All these benefits of these supports is why it's important that Arlington provide recovery housing and other supports to people who need it. It's a foundational component of achieving success in recovery and giving the person the best chance to achieve and maintain recovery. From our meetings and what's been discussed here, that Northern Virginia, Arlington and Northern Virginia do not have a whole lot of recovery residences. And obviously the main obstacle is cost. So I think the last thing we want to be doing now is cutting back on housing and or beds in those houses. For example, Richmond, in the Richmond area, there's over 100 recovery houses and 1,000 beds. That's above average, certainly, but just shows you the disparity between some places. So we at the CSB, in terms of, we have several priorities, and I meet with you guys every year, and you've heard me before. Certainly been focused a lot on reducing overdose rates, and fatal overdoses has been a big priority, but we're also looking on ways to increase the availability of recovery housing. We're in the process of hopefully expanding Independence House, and we looked at ways to maybe within the region, get some additional VAR housing. Even if it's not in Arlington, maybe it's a little further out, but we work together with our neighboring counties to provide more opportunities for recovery housing in the region. And as Suzanne mentioned, we often pay new residents their bed fees for a certain amount of time to allow them a time to continue with services, gain employment, and basically get on their feet. So again, this is why we need these Oxford houses and other housing that we have and cannot afford to reduce their capacity right now.
Thank you.
So in relation to this current situation, unfortunately, another thing I've seen over my last 36 years is that there are people who see those with SUD as untrustworthy, as people who have a moral failing, not a disease. The stigma created by these views has caused many, a person with SUD not to seek help for it, for fear of being judged and shamed by their community. I think that has improved greatly over the last few decades, and more people see, addiction and SUD for what it is. But we still see situations like this, and I think at its core is fear. And there are those, again, who see recovering addicts as a threat. That is not my experience working with people in recovery, again, for over 36 years. It is my hope that our entire community can see these residents as a group of people trying to get well, as human beings from our community, working to better their lives, which will only strengthen our community. Again, I've met with many of you on an annual basis as part of my role at the CSP for the last few years, and always appreciated your support for our SUD programs and our staff and our volunteers. You know how critical safe and supportive housing is for people working to recover from SUD.
Thank you.
A lot of the other stuff is covered, and I'll just wrap up by saying I would just therefore respectively ask the board to support the proposed zoning amendment. It is the right thing to do from both a legal and equitable perspective.
Thank you. Thank you very much. Yeah, and again, maybe sit closer to the front in case we have some questions. Thank you very much. Okay.
We do have Mr. Daniel Adams, who should be joining us virtually. I understand he is having technical issues, so if you will give me just a moment, I am attempting to dial him in. In the meantime, Ms. Tenley Peters, the Planning Commission, is also here with us.
I think we're all having, we could go ahead with well, maybe I think it would break it up. We'll go ahead with Mr. Adams if we can manage it. And then we'll take speakers, and then we will take a break, and I think try to fix the fact that the screens.
And I believe we do have Mr. Adams on the line with us. Mr. Adams, can you hear us?
Yeah.
Yes, I am.
Mr. Adams, go ahead.
Good morning, board. I appreciate y'all allowing me to give out a 2-minute speech, and I pray that it makes a difference. I am a person in long-term recovery. I work for the Chris Abbott Foundation, and we provide funds to those in Oxford houses for a down payment in the first 2 weeks and an additional funding source. We all both houses, which is the Stewart House and the Boston House. But most important is I'm a person who comes from Oxford House, and it was a benefit and a blessing that I had that opportunity to go through the Oxford House. And I know that there's issues that arise in Oxford houses, just like there's issues that arise in residential houses as well. But most important is helping a person, giving them a hand up in the Oxford house has been a blessing for them and for those who are in recovery, because everyone deserves another chance in life, whether, no matter what they've done. And most important is a person in recovery from a substance use disorder, because in the process of recovery, it takes time to get equated back to yourself, because the substance use, rather than alcohol misuse or substance use disorder, you become detached from who you originally are. So in the process, people make mistakes, and sometimes, should they continue to be disenfranchised or marginalized because they made a mistake. Recovery allows one to repair, restore, and give them hope in their life. And most important is the Oxford houses here in Arlington does that. And I pray that y'all vote on behalf of keeping those Oxford houses there. because no matter what I do in harm reduction for the Chris Atwood Foundation, we have individuals that we name NIMBYs, which is not in my backyard. People who will complain about things that go on that they don't like, and they don't think that these people deserve to be in these spaces, or even what we do, that we deserve to be doing harm reduction. So once again, I pray that y'all will vote on behalf of allowing both of these houses to stay there, because we do support, the Chris Atwood Foundation does support both houses in Arlington. Thank you very much.
Thank you, Mr. Adams. And then I think that brings us to our Planning Commission.
Indeed. Ms. Tenley-Peterson?
Peterson?
Yeah. And y'all have a blessed day. Thank you.
Thank you, Mr. Adams.
Bye-bye.
Bye-bye.
Can you hear me okay?
We can.
Okay. Hi, I'm Tenley Peterson. I'm the Vice Chair of the Planning Commission, and so I'm happy to talk to you today about our October hearing. This particular subject we first talked about in our ZOCO meeting in July. We had some questions. Then we heard it at our PC hearing in September. We felt like we still had some questions, so we deferred it to our October meeting. At our October meeting, we did vote unanimously to approve it. I'll just read our motion briefly. The Planning Commission recommends that the County Board adopt the attached ordinance to amend, reenact, and recodify Articles 4, 5, 6, 7, 12, and 18 of the Arlington County Zoning Ordinance to redefine recovery residences and allow as a residential use by right for 8 or fewer residents in one family detached dwellings, and subject to use permit approval for more than 8 residents and or in other dwelling types. So that was 8-0 approved. From a land use perspective, we felt that 8 was appropriate. Since enforcement isn't really a zoning or a land use issue, we kind of felt like that was outside of what we would be discussing. We did feel encouraged that the research shows that 8 or more people in a recovery house is shown to be more effective. So we might actually get better neighborhood interactions with 8 or more people. Though this policy specifically is for 8. We also were encouraged that because of this dialogue that we're having, we are getting some more conversations between Oxford House and Human Services, and we hope that that continues for the benefit of all. We do want these programs to be successful for the neighbors, those living there currently, and those who would be introduced to the neighborhood with these new recovery houses. We do hope that Oxford House can be good partners for the neighborhoods. They weren't able to attend our October hearing. I'm not sure if they're here today, but so we just want to make sure that they continue to be in dialogue with the whole neighborhood for the benefit of those who are existing homeowners and the neighbors who need our support, and the vulnerable populations. Just to go over some of what we talked about at our hearing. The question came up, if we want more than 8, that's going to be subject to a use permit. Why was 8 chosen? That mirrors state licensing regulations. Is this a legal issue? Right now, it's not a legal issue, but from a land use perspective, 8 residents is appropriate. This is definitely needed in Arlington County because of substance use issues. There was the sense that compared to neighboring jurisdictions, we're a little bit behind. Questions about limiting the number of units within a particular proximity. Only Newport News limits that, and apparently they don't actually have any recovery houses. They just did that kind of proactively kind of in advance of this being an issue. There was no increased crime issues for our neighboring jurisdictions that have allowed up to 8. Square footage per resident requirements would be handled under building code, and then accountability for the on-site issues would be partnerships between police and Human Services and Oxford House. So we hope that we can get better coordination between them. But again, we saw that as outside of kind of land use decisions and zoning issues. And yeah, I think that's it from the Planning Commission. So thank you very much for giving us the opportunity to present to you today.
Thank you so much. Stay close to, because this really is majorly a zoning issue. I think those are all our commissions, right? And we have, I'm pretty sure we have some speakers.
We do indeed.
We'll take those now.
All right, our first public speaker is Mariah Wilkins, followed by Joshua Cook.
Good morning.
Good morning. Hello, my name is Mariah Wilkins. I'm a fair housing staff attorney at Housing Opportunities Made Equal of Virginia. We're based in Richmond, but we're a statewide fair housing organization. So the Fair Housing Act and the Virginia Fair Housing Law requires that disabled people have the same housing opportunity as able-bodied people. Case law and federal agency and guidance agree, excuse me, people with substance use disorder are considered disabled for the purposes of the law. Group living is sometimes necessary for people with disabilities, so an equal opportunity to housing requires an option for group living. Local governments have a responsibility under the law to provide such an option. And the zoning ordinance, as it is currently, provides no such option, so it's important that we make those changes. Local governments can be liable under the FHA and the VFHL when their zoning codes don't provide equal opportunity or when their exercises of legislative discretion deny equal opportunity housing. This can lead to reversing land use decisions, ruling zoning codes unenforceable. Costs to the county includes damages, attorney's fees, and punitive damages. Each of these repercussions listed are possible if the county does not amend its zoning ordinance. While a local government may handle group homes in a variety of different ways, certain types of restrictions can violate fair housing law on the state and federal level. Several of the restrictions suggested by Oxford House's neighbors during public comment at the Planning Commission violate the law. Restrictions that courts have found violative include restrictions on the proximity, requiring special use permits with no occupancy requirements, and restrictions that can make group homes non-economically feasible, such as low resident requirements or onerous permitting processes. All in all, Arlington has long shown its commitment to housing justice. Your local housing grant program is a national exemplar of its kind. I just want to encourage you all to make all these changes. Thank you. Sorry I ran out of time.
That's okay. Thank you.
Our next speaker is Joshua Cook, followed by Daniel Schmidt.
Good morning, everyone.
Good morning.
Hi, I was an Oxford House resident, and it completely changed my life. I found that basically I was a homeless person in Arlington County, right? So it was an existing problem, right? I ended up being housed in an Oxford House, which was affordable enough because of the number of people where I could pay my own way, which taught me responsibility. It also helped me be around people that were doing positive things, being part of recovery programs like Alcoholics and Narcotics Anonymous, and exercise, good diet, all kinds of things I knew nothing about. It was the springboard for my life. I'm still an Arlington County resident. I have an Arlington County business. I pay loads of taxes. I feel like Carla DePava has me on speed dial, right? And employ a good number of people in Arlington County, right? It has been a total shift, and I needed the example. I needed to do things in a somewhat structured environment, but with the guidance and community of other people, which have brought me to be a better citizen and to continue to pay loads of taxes. And I think that it's necessary. The problem is already there. These people are already in our communities, right? And if you help them, they can change. If not, they will just stay, and you know how that goes. And they'll probably hang out in libraries, and you guys will hear about it. Thank you.
Thank you.
Our next speaker is Daniel Schmidt, followed by our 3-minute speakers, beginning with Paul Stevens.
Good morning.
Morning, everyone. How you doing? My name is Daniel Schmidt. I've been in recovery from opiate use disorder for over 8 years now. I'm a volunteer with Arlington Recovery Initiative and educate Arlington County residents on the use of fentanyl test strips and Narcan nasal spray to reverse the effects of opiates out in the wild here. And I'm a current Oxford House resident. My experience there has been that the housemates I live with have become my family. I have no immediate family in the area, except for my father who's buried in Arlington Cemetery. But this year I had 2 back surgeries to remove the majority of a disc. And despite everyone's work and life schedule, my housemates basically took care of me while I was relearning to walk. And that's something that, you know, I wouldn't have had that support on my own. And I'm grateful for my brothers there for helping me. It's the value of people in recovery pulling together and helping each other is peerless. And so thank you for your time.
Thank you, and congratulations.
Our next speaker for 3 minutes is Mr. Paul Stevens, followed by Allison Bondi.
Good morning, and thank you for the opportunity to speak. My name is Paul Stevens. I'm the regional manager for Oxford House Incorporated in Virginia, D.C., and Maryland. I'm an alumnus of an Oxford House in Richmond, and for 23 years, a person in recovery from substance use disorder. In fact, my recovery journey began right here in Arlington County 23 years ago as a participant in the treatment unit of the Arlington County Detention Facility. I am here in support of the proposal to define recovery residences and allow as residential use by right for 8 or fewer residents in one-family detached dwellings. The self-governing, self-supporting Oxford House model is the gold standard of evidence-based recovery support. Studies funded by NIH found 86.5% total abstinence rates after 1 year. Few to no other substance use disorder interventions can claim such high long-term success rates, including monthly incomes over twice as high and recidivism rates 3 times lower when compared with individuals receiving other conditions of care. SAMHSA, the Office of National Drug Control Policy, the Surgeon General, and numerous experts in the field of addiction and recovery research have repeatedly acknowledged our success. Oxford House began almost 50 years ago, and due to its effectiveness, there are now over 3,800 Oxford Houses across the country. Oxford House Incorporated, the credentialing entity, has been supported by the Virginia Department of Behavioral Health and Developmental Services for almost 35 years. There are 165 Oxford Houses in Virginia, and anywhere from 1 to 6 Oxford Houses have been successfully operating in Arlington County for over 30 years. We have had a much valued partnership with the Arlington Community Services Board that entire time as well, as numerous other Arlington faith-based nonprofit organizations and other government agencies. In addition to credentialing Oxford Houses, OHI provides technical assistance, training, and compliance monitoring. The model requires high standards of accountability and particularly emphasizes the importance of being good neighbors. Houses belong to local chapters which monitor house operations and respond to problems if they arise. From the houses to the chapters to the state association to the OHI field staff, the importance of being good neighbors is taken very seriously. If there is ever a question or concern from the community, myself, my senior outreach coordinator, Debbie Robinson, and the local outreach worker, Tim Tice, who is with me today to support this measure, make ourselves available and respond swiftly if an intervention with the House is called for, and are typically authorized to take any corrective action necessary. It should be noted that OHI extracts no revenue from the houses whatsoever. There is no one making money off the houses except for the landlords and utilities. Unlike other models, there is no financial conflict of interest in the credentialing entity, so we are free to always apply the same high standards and compliance demands to all houses. The proposed measure is affirming what is already well-established federal fair housing law. Not only is it already well-precedented law, but Arlington is somewhat playing catch-up to what most cities and counties already articulate in their zoning code. However, Arlington is one of the first to take an additional step that will further ensure the recovery residences in your community are well-run, safe, and neighborly. In tying the definition of recovery residences to the state certification through DBHDS, you create a mechanism to address bad actors in this space, as they are the ones operating outside the oversight of the credentialing entities, Oxford House and VAR. By the way, all 6 of the houses are actually credentialed. That's just an oversight on DBHDS's website. So in closing, recovery residences are an essential part of the continuum of care. This measure is much needed and overdue, adds new assurances of quality operations, and we recommend you adopt the measure. Thank you for your time.
Mr. Stevens, thank you for being here. Are you all right to be available for questioning?
Absolutely.
If you want to sit near the front, because I suspect we will have some questions for you. Thank you.
Our next speaker is Allison Bondi, followed by Terry Armao.
Hi there, can you hear me?
Yes, we can.
Hi, good morning. My name is Allison. I work for the Office of the Public Defender for Arlington County and the City of Falls Church. I work as a mitigation specialist, so my role encompasses entry services. I want to express my complete support for this amendment, the continued existence of this county's Oxford Houses and other recovery residences. I think that is the choice here that truly values safety and community. Personally, I work day to day creating release plans for indigent individuals. Often they are charged with drug-related crimes, they are also often struggling with addiction and substance use disorder. Also, again, due to the nature of policing in this country and in this county and criminalization, that is disproportionately Black and unhoused people who are criminalized. So I think generally the conceit of recovery residences, as many have talked about today, is just the idea that you can't recover if your basic needs are not met. I also, again, want to point out that recovery residences allow people to accumulate social and financial capital. And again, as I think Mr. Cook alluded to a few seconds ago, especially in a county like Arlington, the accumulation of capital is possible because the housing is somewhat affordable, and that affordability is possible because of the number of people who live in the residence. Recovery residences are associated with longer participation in outpatient treatment. They are associated with gains in employment, and also, of course, lesser involvement with the criminal legal system. So when I initially heard that there was opposition or criticism to one of the existing Oxford houses in the county, it's upsetting, and I'm very much literally burdened with the question of, where else are people going to go? And so, Arlington has a great permanent supportive housing program that is overburdened. Beds at some of our mental health housing options. I know just last month I attempted to refer someone to a DBHDS program and was told there was a year-long wait list for that residence. Summer, we saw an unprecedentedly high burden on the shelter system, where it was almost impossible to get a shelter bed for months on end. So to me, recovery residence is truly the difference between someone having a roof over their head during their recovery or not. That to me is the difference between a relapse or not, between a rearrest or not, between an overdose or not. And if that's not the central safety issue, I don't know what is. So I want to, commend everyone who has spoken today, and again, encourage an ability to discern between encroachments to safety versus encroachments to comfort. And I certainly hope that the safety of this community is prioritized. Thank you.
Thank you, Ms. Bondi. I think Ms. Armeo is next.
I have lost my list. There we go. Our next speaker is Ms. Terry Armeo, followed by Wells Harrell.
Is this on?
Yes, you're good.
Hi, you guys. Been here before. We've heard a lot of good things about Oxford houses, how well-run they are. Nobody is against giving a use permit and allowing the use of recovery houses in Arlington. I think most of the comments that I have heard from my neighbors and other people as we talk about this issue is the number of people in a particular home. So allowing 8 by right gives the county no mechanism to walk back if there are problems in a home. And even in the staff report right here, which I'm reading, increased nuisance and crime. It took 2 years for the 2 houses that were next to each other on Stewart Street to get anything done about the issues they had been complaining about, and that includes from Oxford House. And so there's 2 possibilities. One, that the residents didn't tell Oxford House of the issues ongoing, and 2, they did, and nothing was done about it. And so the neighbors are left with this. So you call code enforcement and nothing gets done because they're not allowed to go in the house. You call the police, they file a report, and little to nothing gets done. And you call DHS, and again, nothing happens. And I have firsthand experience with this with a house in our neighborhood in Penrose, not an Oxford house. It was supposed to be monitored and supervised on site, and in fact it wasn't, and DHS dropped the ball big time. And the man who lived in the house had a list 3 pages long from a FOIA of police calls to the house. And despite calls to the county, code enforcement, the police, and DHS, it was not resolved. And they were not like trash in the yard. It was drug dealing, it was alcohol use, it was people there all night long, parties, knife fights, it was stuff like this. I'm not saying Oxford House would permit anything like that. But it's easy to see how a good situation can get out of control. And I just want to suggest that the county maintain a lever that if need to, that you could exercise to put the brakes on a house that maybe has gone bad. So I'm asking that you only allow 4, and then the rest is done by a special use permit. Oxford House and staff has said that there are mechanisms. I believe Deborah Alpert suggested residential parking passes, but if the house is on that street, they could also get parking passes. So it doesn't solve any problems. But I thank you for your time, and I'll be back with the deer.
Thank you, Ms. Armeo.
Our next speaker is Wells Harrell, followed by Dylan Staples.
Good morning. Can you hear me?
Yes, we can.
All right. Thank you, Chair Garvey, members of the board. You may have noticed that some of the public comments on recovery houses are from residents who've spoken up about missing middle as well. That includes me. Like missing middle, the issue here is really about a more fundamental question, and that is who controls our neighborhoods, and more specifically, who gets the power to keep others out. For almost 100 years, our restrictive zoning laws assured people who bought single-family homes that the neighborhood that they bought into would remain more or less the same. The expectation was that problems like crime and visible poverty would stop at the neighborhood's edge. Inside the neighborhood, only the right sort of people would be allowed in, and any inconvenience would be remedied with a swift complaint. We see it in the myriad restrictions throughout the ordinance. We see it in the extensive process and stringent standards for obtaining variances. And we see it in the backlash when someone tries to build so much as a duplex next door, to say nothing about low-income housing or homes for people recovering from substance use disorders. The single-family homeowner was once the most powerful political constituency in Arlington. It's got some reactionary tendencies and anxieties about the possibility of neighborhood change, so much so that change itself gets mistaken as an existential threat. Misbehaving neighbors become more than just annoying side stories of everyday life. They're treated as violations of a social contract against which the government owes a duty to intervene. Even the narrowest of exceptions will inevitably swallow the rule, and every ease restriction is a slippery slope to disaster. And the thing is, I get it. When decades of mass culture, neighborhood design, and zoning laws have seeded anxieties about neighborhood change and empowered homeowners to stop that change, but being told that your neighborhood will change and that your objections have been overruled would send a lot of people into a panic. When the county legalized small multifamily homes throughout our neighborhoods, it sent a message that homeowners do not, in fact, have veto power over neighborhood change. Our neighborhoods belong to all of us. Now, look, I wouldn't blame anyone for feeling anxious about the prospect of a recovery residence near their home. But being a good neighbor means moving past those feelings and showing compassion for those who have so much less than we do. People recovering from substance use disorders are some of the most neglected, marginalized, vilified members of our community, but they are no less a part of our community. Staff put it well. These are our neighbors. If we're serious about supporting people in recovery and supporting alternatives to the criminal legal system, then we have to support the recovery home model. We shouldn't indulge feelings that might lead us to say, make them live somewhere else, not in my backyard. We can and should have good faith conversations about how best to help people in recovery, but let's be clear. Legislating their homes out of existence does not help them. The way we help them is by welcoming them and then going from there. That's exactly what the board can do today and what the board should do today. Thank you.
Thank you.
Our next speaker is Dylan Staples, followed by Julia Trepanese. My apologies.
Good morning.
Good morning.
My name is Dylan Staples, and I've been in recovery now for almost a year, and I don't think I'd be standing here if it wasn't for the recovery housing in Arlington, Virginia. It gave me an opportunity to get out of the streets of Southeast DC. My mother passed, and then my brother stabbed and killed my other brother. Lost a handful of people close to me to overdose, all within the span of just like 3 or 4 years. And I went down a very dark path. And right now I'm in Independence House, and the recovery housing, Oxford houses, National Capital Treatment and Recovery, Arlington DHS, all was a big part in saving my life. And I would not be standing here today if it wasn't for the recovery housing in Arlington, Virginia. So, thank you very much.
No, thank you for coming.
Our next speaker is Julia Trapanese, followed by Jim Dooley.
Hi guys, I'm Julia Trapanese. I grew up in Arlington. I grew up in Lyon Village. I went to WNL. I'm currently a student at UVA, and I'm also the president of the Glen Carlin Oxford House in the Green Valley neighborhood of Arlington. And I'm really just here today. Not really here to appeal to your emotional side anymore and to say that this could be your kids too, since it feels like everyone here is kind of on the same page and that as a county, it is the right thing to do to explicitly support recovery housing. And I would just like to say it has saved my life. I mean, my parents and I did try everything else. Usually sober living is a last resort. It is for those who are they're most desperate and most committed to sobriety, and it is the only place where I've been successful and where I've seen other people be able to be successful and become contributing members of this community again. I'm coming out of my lean years of recovery. I'm almost back at UVA. I am good with my parents. I work in Clarendon. Things are a lot better, but I wouldn't have gotten this far if it weren't for my Oxford house and the opportunity it gave me to actually support myself and get myself through recovery. And I don't want to be a bad neighbor. I love Arlington. I am so embarrassed. I am so sorry to that woman for all of her police calls. That is so embarrassing on our behalf. I promise you, we do not get away with that stuff. Tim is here today. He will sit us down once a month. All the Oxford houses meet, and I think it would be cool if there was more communication between those Oxford houses and neighbors instead of between neighbors and the police. Because at those meetings, that's when we are told, hey, there's too much noise. Your yard isn't clean enough. So if neighbors have those sorts of complaints, we are usually told those at our monthly chapter meetings. And I think that's a great way for the community to maybe have a better relationship with their sober living houses. So yeah, thank you. And it was nice to put some faces to the county board. So, yeah.
It's nice to put some faces on the people who have done so well with Oxford houses. Thank you for coming.
Thank you, Ms. Trapanese. For the record, our next speaker is Jim Dooley, followed by Audrey Clement.
Good morning. Thanks for the opportunity to address you. My name is Jim Dooley. I've lived in Arlington with my family for more than 26 years. I love this community, and I do what I can to make it a kinder and safer and more hospitable place. I'm also a member of the CSB's Substance Use Disorder Subcommittee. I rise to encourage the board to support the staff changes to the zoning laws. A recent study estimates that there's well over 10,000 recovery housing facilities across the nation. The medical, social science, criminology literature is clear that recovery housing is a vital component for many dealing with their substance use disorder illness. On the other hand, Dr. Morgan Kushel notes that limiting housing options, creating barriers to housing, or simply taking away housing options leads to a personal doom loop in which everything in a person's life worsens: their physical, their mental health, their ability to work, their diet, and their substance use disorder worsens. I can't imagine anyone would want to push a fellow citizen into a personal doom loop. The author Ryan Hampton, in his new book, Fentanyl Nation, notes that in communities that have extremely high median home prices, he focuses on San Francisco, but what he says for San Francisco applies clearly to Arlington. The political cost of allocating scarce and highly valuable private property to provide social safety net services like recovery housing becomes such more obvious and such more contentious. He contrasts it to rural West Virginia, where there's plenty of houses and people don't, there's not an issue with a recovery house being there. I think this is the crux of the problem here. And it's a crux of many problems in Arlington. If housing were cheap and plentiful, easy to obtain, Arlington County could support as many recovery homes as needed, and they could be spread throughout the county. But as we've all learned from Candide, we do not live in the best of all possible worlds. If we did, then perhaps the more than 24 homes currently on the market in North Arlington for over $3.5 million could be repurposed for recovery housing, and that way we could alleviate the burden in other neighborhoods, but I don't think that's likely. I do think Arlington County is home to innovative ideas. So for example, the county's mobile outreach support team, the MOST van, that could be dispatched to these houses as appropriate as a way of limiting EMS and police calls to them. So please, I encourage you to support this. As I've talked to you before, to me, my guiding principle and the Narcan trainings I've done for more than 3,000 people in Arlington County is we first have to keep people alive. Nothing else can be done if we don't do that. Recovering housing is a critical aspect of that. Thank you.
Thank you.
Our next speaker is Audrey Clement, followed by Rachel Haler.
I'm Audrey Clement, the independent candidate for County Board. Suzanne Sundberg has raised serious concerns about the operations of Oxford House, which wants the county to allow it by right permission to operate sober houses with up to 8 occupants. Her comments follow. I'd love to know how Oxford House makes its money and what services it provides. It went from pulling $11.7 million in revenue in 2019 for program services to pulling $27 million in 2023. That's nearly a 3-fold increase in just 4 years. Very unusual growth for a nonprofit. We also don't know who the investors are who own these sober houses or how they are or are not related to Oxford House, as most of these homeowners/investors' identities are shielded by LLCs. Does the organization benefit financially when there are more occupants? Does Oxford House have a financial stake in the number of occupants in each of these dwellings? Under the agreement each tenant must sign, each home's occupants must attend an AA support group or church 3 times a week at their own expense for travel. There is no screening for occupants of these houses for criminal convictions. According to the organization's website, 78% of occupants in these houses have a criminal record from a few days to 10 years. There should be additional changes to the zoning ordinance to discourage other licensed but not certified Oxford House or VARR operators that may engage in patient brokering, to open up shop here because we were forced to increase our occupancy. Federal law is inadequate if there is no enforcement. And in Virginia, at least, there appears to be no meaningful enforcement mechanism to prevent patient brokering or other exploitation of the occupants in these homes. If there is no licensing and only third-party certification of these facilities in Virginia, then that likely means the state has no role in identifying and correcting noncompliance. Because we have such a lax regulatory framework in Virginia with little or no enforcement, these facilities and their occupants are able to operate with impunity and above the law, as it would normally apply to others who are similarly housed. This situation would seem to encourage fraudulent conduct and the exploitation of recovery residents' occupants. End of quote. Until Suzanne Sundberg's concerns are addressed, I agree with Terry Armeo that extending sober house occupancy beyond 4 residents should be by special use permit only. Thank you.
Thank you.
Our next and final speaker is Rachel Haler.
Hi, everyone. I've lived in or worked in or both in Arlington since 2012. It is a place I very much love, and I don't think I'd be sober if I had lived anywhere else or moved. This is known as a really great place to get sober, and that is true whether it's, Virginia, DC, the area, but there are infinite meetings here. You would, like, at all hours of the day. I mean, it's ridiculous. It's probably the best place in the country for that. and access to sober housing is a big part of that. I'm not here because I lived in sober housing, but I have friends who do, and it was important to me that their voices be heard. Much of what they have shared with me has already been said here. I think that I will, note that the community structure in place with sober living is really a thing that's necessary, and how hard it is when you are first recovering to do anything. It is brutal. It feels precarious under the very, very best of circumstances. And having other people around to show you how to live, like literally step by step, like this is how you clean a house, because my brain was not capable of understanding that when I first got sober, is really useful. A friend of mine mentioned that it really helped him reconnect and restore his values, and he has been able to bring that back to his family with a longtime fiance, and they now have a child, which is amazing to see. One of the barriers that people haven't talked about to getting sober is seeing it. I got sober because someone I knew stood in front of me and said, yeah, I stopped drinking, and then I stopped feeling this way. And I said, oh, cool. I'd encourage people to imagine that having these homes in their neighborhood actually gives people a lived example that there is possibility if something like this happens to you and your family. I don't wish that on anyone. Realistically, it will happen. These are huge problems. They're not going away anytime soon. And I really would invite people who are curious to learn more about it. We're the same people as y'all in a lot of ways, same hopes, same dreams. They don't end with learning how to clean a house or whatever it is you're trying to relearn and do. And if people are really curious about the lived experience, getting sober in Arlington, or want to come to an open meeting where people are allowed, I'd be happy to take you. So thank you. Oh, and thanks for the presentation. That was great. I learned a lot. And thanks for all the people in recovery that came today. It's not always easy or possible to out oneself, and it comes with risk to a lot of people. So thanks.
Thank you, Ms. Healer. All right, I think that's our final speaker. Conversation is now with the board, but we're going to take a brief break because our screens are not functioning up here, and that's part of the way we follow how things go. So I'm told, Mr. Kushner, a brief break, they need to come behind my chair and do something to fix that. So we're going to have people come in. Meanwhile, if you haven't voted, there's early voting available just down the hall. You could go vote while we take this break. And also, Mr. Kushner, it's freezing up here. Is it possible to warm up the room a little bit?
We can certainly make that adjustment.
All right, so we're going to take care of a number of housekeeping things, take a little break, vote. We'll be back and have our discussion in just a few minutes. Thank you. Okay, why don't we we'll start with a motion, and then we'll have discussion, questions, and work our way through issues, okay? Go ahead.
Colleagues, I move to adopt the attached ordinance to attach to this staff report, to this item staff report, ordinance to amend, reenact, and recodify Articles 4, 5, 6, 7, 12, and 18 of the Arlington County Zoning Ordinance to define recovery residence and allow as a residential use by right for 8 or fewer residents in one family detached dwellings and subject to use permit approval for more than 8 residents and or in other dwelling types, with an amendment to the definition of recovery residence as shown on the screen, hopefully, Mr.
There it is, oops, there it goes.
Yeah,
Okay.
and so with this projection on the screen of the amendment, my motion is now complete, Madam.
Thank you very much. Do I have a second?
Hope.
Do I have a second?
Second.
All right, motion has been moved and seconded. All right. I will invite you, Mr. Karantonis, to perhaps speak to your motion, start us off with the questions, but actually before that, I think I will indulge my privilege as chair to just say a few things and maybe ask our attorney for a few comments. Just to let folks know, I mean, which is, as indicated, the fact this came to us first in July, and here we are in October, we have taken this issue very seriously. We've heard a number of concerns and really looked into and learned a lot. Met with our staff many times. We actually deferred it again in September to get more information. There's a lot of research that's gone on about what's going on in places. So I think I will just ask our attorney, just to kind of bring it back to what it is exactly we are doing today, because there are a lot of associated issues which we will discuss, but the major ones really are zoning. So Ms. Cork, could you just elaborate again? I know it's in here, but would you, and it has been sort of laid out in the presentation, but I really want to kind of make this really clear. What does the Fair Housing Act require of us at the moment?
So the residents of Oxford House are recognized by federal law as being disabled under the ADA and FHA. So what is required by the Federal Fair Housing Act and ADA is that they be treated the same as people who are not disabled.
Thank you. And when we're looking at this, what specifically are we really allowed to look at or need to look at? As opposed to some of these associated issues, because we're voting on something that's we're not voting on programs, I don't think.
Yeah, so this is coming before you as a zoning amendment, and this is a land use matter. So what you are looking at are land use impacts as opposed to clinical treatment options or things related to that.
Okay, thank you. And I think I'll stop there with my questions. We have quite a number, but I think I will let my colleagues ask them as we'll sort of surface more issues. Mr. Karantonis, I'll call on you first because you made the motion, and then I'll see what other questions come up. And why don't we talk well, no, go ahead. Go where you would like to with your questions.
Madam
Or
Chair,
statement.
I wanted just to recap very briefly, I hope, what this motion and what our action is about. First of all, it is about providing a path to compliance for the six existing recovery residences in a way that's consistent with the Code of Virginia. It secondly provides supportive living options, that is housing, in our county for individuals who are recovering from alcohol and illicit drug addiction. And it makes how we treat recovery residences from the land use regulatory perspective consistent in how we treat similar classes of residents with disabilities, such in settings like group homes. All of which is consistent with also our commitment to proactively furthering fair housing. So that's basically the gist of that. I should also add that in the way we are trying to do that here is it's nothing novel about that. Alexandria does that, Falls Church is doing that, Fairfax is effectively doing the same thing, and several other Virginia jurisdictions. There are some that don't do that this way, but I believe that the majority is going the way we are going today. So I have questions, but I would open that to our colleagues first, since the motion is on the table, and we can take it from there.
Okay, that is fine. Mr. DiFranti, I see your light is on.
Sure. Thank you, Madam Chair. I know we'll have some significant discussion. I want to frame, for me, there's those who are here on towing and retirement issues. There's, by my count, 1 or 2 people in the room who don't support us taking the directional step of allowing this much more often. I have always been there, and I continue to be there, but I will confess to a bit of a learning journey on the number of people in the model, and what is financially possible. The ordinance draft proposes a distinction between 8 and 9 people, and that 9 is where use permit falls. I was always for expanding. I just getting from 6 to 8 has been part of what the last 4 months has been about for me personally. This all leads to the only other issue that I think for me has been a question is related to the distancing requirement. And that we have received, it's a matter of public record, we've received emails on requesting distances between Oxford houses. And so I want to just see if, and I'm persuaded to move in the direction of the amendment, but I want to at least ask our attorney, is a distancing requirement illegal per se? And that would mean even having it, irrespective of facts, is it automatically illegal, as I understand it?
It is not automatically legal, but when you look at accommodations, that is a very fact-specific inquiry, and you have been briefed extensively on that.
Thank you, Madam Attorney. The only other follow-up question that I'll have, and then I'll yield, is to this slide that includes, for me, parking. It was covered in the presentation, but for me, parking was 2.6 versus 2 vehicles is not a reasonable basis in this case under these facts for me to reach a different conclusion. And so the one that I'm talking about is the research that staff did on public safety, which if we can pull that up, that would be just helpful for me.
I think it's coming.
As for me, the analysis under our code and the facts as I understand them is about group homes for those treating those with different disabilities as defined by the 1988 federal amendment. They both, those with developmental disabilities and which are group homes and are mental health residences and Oxford House for those in recovery have to be treated the same absent, additional information, additional facts. And so the items, the columns in the left of this slide, and this slide as a whole, is where I focused my sort of wrestling. There's no emotional question that we need to do better to help those. I have a cousin who recovered. Others have cousins who have not. So, there's a difference between Oxford House at 55 and the mental health at 46, but that is not a significant difference. So what I did is I asked a follow-up question of our manager, and I just said, in your conversations with public safety, do they see a material difference between these two uses based on these facts? And I'd like to just ask that.
No, they do not. And, if you take a look at the information, you can see that it's broken down in different areas, but between the two of them, a lot, you see with Oxford House, there's a quarter of them are administrative, which are things that, really don't involve any sort of untoward kinds of things. And but keeping that in mind, there is no difference. And I've talked with the chief about that and also our folks in the Community Engagement Division, and I feel comfortable stating that.
Thank you, Mr. Manager, and I suppose, for those with any questions, if our manager had a police uniform on and he said the same thing, you should believe him in the same way. And so those are the facts that led me this last part on the proximity. And I appreciate, Debbie, or Ms. Albert, I appreciate you just pulling this up, because I think it's worth highlighting, because these, for me, are facts that were very, very important in addition to the general effort to move in the direction. So I'll stop there.
Thank you. Who would like to go next? Ms. Cunningham.
Yeah, I have a question back on page 5 of the presentation, I believe it is. Are we able to show it?
Yeah, I think we're definitely having whatever's going on with our technology today is having a hard time.
I just would like to understand the first bullet here that says that our current zoning ordinance has no path for compliance for recovery residents with 8 unrelated people. Could you say a little bit about why our existing group living categories could not apply here?
I can. And actually, to do that, I'm going to bring up some of those definitions for you, which I have in some slides. So we have here, these are just definitions reprinted directly from the zoning ordinance, and I've included our definition of family, our definition of group home, and on our next slide, our definition of dormitory. And I will say that just from a zoning perspective, when a use comes in that is a new use to us that we're not familiar with, that's not defined in the zoning ordinance, the first thing we do is we look for similar uses in the zoning ordinance. And that was part of the process that we went through with this. As I mentioned previously, this was initiated as a zoning complaint related to occupancy, and not knowing about Oxford House or the recovery residence definition in Virginia code at that time, they were cited with a violation for having more people than the zoning ordinance allows. And once that violation was cited, then that begins conversations with the residents. So when we looked at uses in the zoning ordinance, let me back up a little bit. From an enforcement process, our goal is always compliance, right? The enforcement process is not about citing people with issues, it's about bringing them into compliance. So we will always look for that first. So we did look at our definition of family, and we noted, once we learned a little bit about the Oxford House use and the Oxford House model, that it is similar. Again, we have this definition C on our family definition for up to 8 people with a different type of disability and under a different licensing structure under the state, as I covered in the previous presentation. We also did look at group home. However, the group home definition is specifically for more than 8. So if someone's coming in with fewer than 8, they really can't meet the group home definition. Furthermore, the group home definition also includes those same licensing requirements as we have in our family definition. We also look at the dormitory use. The dormitory use, neither the dormitory use nor the group home are the best fit for this type of use. Again, the dormitory use is really under the auspices of an organization, which in Oxford House is an organization. However, it is not an organization like, say, a college or university or a YMCA type of organization. You know, once the Oxford House is established, the residents in that use are really living and functioning like a family. These were definitions that were discussed with Oxford House in the conversation related to the enforcement, and it was after those were discussed that Oxford House asked for a reasonable accommodation to be treated equally to other groups of people with disabilities who are treated as a family. And so that was where we looked at in terms of the reasonable accommodation.
Okay, so the question of whether there exists a path in our current zoning ordinance that could make sure that all of our current 6 houses are legal, you believe the answer is no?
We do, yeah. And again, I guess the other thing I didn't say is there are rules of statutory construction when it comes to zoning ordinances, which means that the most specific always applies. So when we look for similar uses, we look for the more specific use. So while a dormitory sort of has a broad allowance for groups of people, we also see that we have a very specific definition in our definition of family that also did not quite fit this use, but we did see it as being most similar to that use.
And an adjacent question is, for a reasonable accommodation, if I understand correctly, it is to make sure you can have an accommodation that would treat anyone not with a disability like the disability requesting the accommodation, right?
That's correct. I mean, this reasonable accommodation request was asking to be treated like a family. That is part of the Oxford House model. I will defer to Ms. Kaur on any other legal definitions.
Okay. I'll come back to that, I think, but I'll cede my time.
Okay, that's fine. I'll go to Ms. Coffey.
Thank you. So I think in terms of legal framework, we have a responsibility to treat those with a disability the same as we would treat those without a disability, but we also have a requirement to treat those two groups with different disabilities that are similarly situated the same as each other, right?
No, it's just that they both have disabilities, and people who have disabilities have a right to be treated the same as people who do not.
Right. So I think I'm trying to understand, because we have a definition of other types of group homes that allows by right with no use permit up to 8 people to be in a residential in a residential home, given their category of disability, that there would have to be justification for why, for another group of people with a different disability, that reasonable accommodation would not also be reasonable for those with substance use.
I would say it's a natural comparison, and I would refer you back to the briefings that you've had.
Thank you. And then another question that I think has pretty much been clarified, but do we have any authority or jurisdiction under Virginia code or federal law over the programmatic aspects of how recovery homes are run?
We do not.
Okay, thank you. A more specific question based on the PowerPoint, because we're creating a new use category and we're going to be issuing new certificates of occupancy and therefore doing a new inspection, what happens if we discover a zoning or building issue when we inspect before providing the CO? Is there a pathway to compliance? Kind of how will we enforce that?
Yeah. If when they apply for the CO for a change in use, as I said in the presentation, that would trigger a zoning and a courtesy building inspection. If we found issues, we would expect them to resolve those issues in compliance with the relevant codes prior to issuance of the CO.
Gotcha. Thank you. I think I will pass along for the time being.
Okay. Mr. Carantonis, your light is on.
Yes.
Did you have more questions?
Yeah, I would like to hear a little bit more about the Oxford House model and, how the self-regulation and well, we heard a lot of very positive testimony here. It says this is the only setting where, the pathway to an extremely difficult, it's an extremely difficult pathway to recovery, and how this model actually works and how it helps people to actually get there, and how the normal tensions are mitigated and managed.
Mr. Stevens, are you okay to answer that? Maybe just come to the podium if that's all right. You can push a button to raise it, which might make it more comfortable for you. It's, yeah. Thank you. On the right. Yeah, there you go. It makes it a little easier.
For those of us less vertically inclined.
And then you'll need to unmute the microphone button in the center.
Yeah.
You got it. All right, thank you.
Yeah,
Yep.
great. Okay. Yeah, thank you for the question. Primarily, the mechanism that makes Oxford House work so well is just the peer support, the accountability that they're holding with each other. We certainly believe, and the research that's been done on Oxford House kind of bears this out, that our model is somewhat unique in that the members are really responsible for the house operations themselves, and that leads to a higher level of investment in operations and accountability, a higher level of investment in, mentoring the new members of the house. But everything that they do, there's a pretty robust, model system of operations that they're required to follow per the charter of an Oxford House. But most of the day-to-day, week-to-week sort of decisions about chores and rules and, how much the house pays every week in order to meet all their financial obligations are all done democratically by the house in their weekly business meetings. I don't know what.
So what happens if somebody, for example, breaks a rule or it's not, or creates a situation that may be not good neighborly?
Right.
So how is that self-regulating system? And I read in the staff report that you also have an established monthly meeting with the residents. So that's the thing I'm after.
Okay. Yeah, when there are behavioral issues with the specific member or members in a house, the house addresses that in their weekly business meetings. There's sort of a graduation of efforts that they'll take from sort of pull-ups to maybe a fine, depending on the circumstances, and then they go to behavioral contracts. We really emphasize in this model that everybody that comes into Oxford House needs a little help with behavioral change, or they wouldn't be coming to an Oxford House. So we encourage them to try their best to help people change those kind of behaviors. There is certainly a list of behaviors that are so egregious that they require and we expect immediate expulsion from the house, violating the law, violence, threats of violence, theft. So that can happen. If somebody returns to use, as a recurrence of use, the house is expected per the charter to sit down, confront them, and determine that a relapse has occurred, actually based on a vote, but the houses do all utilize UAs in sort of informing that vote, and then that person is expected to leave pretty immediately within the next day or so. And we, of course, always make an effort for the houses to have information there to help refer people out to appropriate services, to treatment, or to a detoxification center or something like that. The monthly meeting is actually a meeting of the peers. It's all the houses in a specific area. It's anywhere from like 5 to 12 or 13 houses will meet monthly just to check in with each other. They have to give financial reports to make sure they're all paying their bills and doing the right thing there. And that's mostly peer monitoring of each other. And there's a committee there in each chapter that goes around and visits the houses every month. But my staff, my field staff, and there's only 6 across the whole state, so they do attend those monthly meetings as well to sort of keep an eye on things and potentially address policy issues that the chapter's unsure of or something like that.
Thank you. I see that that the model is based on respecting the dignity of people who are trying very hard to recover, and through the exercise and recovering their autonomy as people, actually govern their own lives, which I think is a very interesting, for me intellectually, also very interesting aspect of all this. Thank you.
Yeah, you're welcome.
Yeah, thank you. Mr. DiFerenti.
Thank you, Madam Chair. My question's also for Mr. Stevens, sorry. It has to do, I was looking at the website and there's a vote, and it seemed like there was either a majority or a percentage that you try to have if there's a question about someone returning to what they're trying to avoid. And is it majority? Is there a big sort of ethos across Oxford houses to a certain percentage, or is that part of what your field staff and you just work on? Because I imagine this is a big question when you have everybody on a lease, and how that group succeeds through the peer. And what I saw on the website was something like either 70% or something like that. And if it's not a policy, no problem. I want to just keep learning, if that's okay.
Sure. Well, first let me clarify the sort of rental lease tenant arrangement, because it's actually the specific entity that is that house as an unincorporated association that enters into the lease agreement. The individual members of an Oxford House are not technically the tenants. They're members of the organization that is the tenant. But what you probably saw on the website was that the houses conduct their own interviews, so they screen the individuals and decide who will be given the opportunity to go live in their sort of recovery family, and that requires an 80% or higher vote. Every other decision in Oxford House is a majority vote, including the determination whether or not a relapse has occurred. Although, like I said, they usually inform that with a urinalysis.
Great, thank you. That's very helpful. A question based on your statewide, and I think you said 156 statewide, and you got Tim, who I've forgotten last name, but is there a best point of contact that you either have been talking with our staff or that we ought to know about?
Sure, yeah, and it's Tim Tice, and it's 165 houses.
Oh, sorry.
That's all right. Yeah, our outreach workers in the field cover specific regions. So Tim covers the chapter that includes the houses in Arlington. There's a senior outreach coordinator. Her name is Debbie Robinson, and so she kind of looks over the entire staff. And then, of course, there's me. I'm over the staff of all of Virginia, D.C., and Maryland. So any of those three are perfectly good contacts. In addition, the national website, oxfordhouse.org, is a place that you can go and submit an email, and they will immediately, if it's related to a Virginia, area, they'll send it out to us so that we can immediately respond. There's a phone number there that you can leave voicemails on. They're sending those out to us. So the national website is also a place that you can get in touch with the field staff.
Great. I don't want to hog the mic, but I do have two just concluding sort of questions in this area. One is, I think you met with staff. Would you be willing over the coming year to meet with the county manager and a board member or two? We can't meet in groups of 3 unless we do a public meeting, and this is a chance to really just us to join staff in getting into just checking in and not, just to make sure that this is a success, because folks, you yourself and others, everybody wants this to be a success. So is that something you'd be willing to do over the coming year?
Yeah, absolutely. I mean, the unstaffed sort of self-governing nature of the houses is really the recipe for the incredibly high outcome rates, but it also means that we don't always have as much outreach as we'd like if there were, say, a house manager or a staff person in each house. So we are always happy to increase and improve our outreach with the local community.
Great. And then the last question is, I'd sort of voluntarily, with the respect to proximity, it's my impression from looking at I pulled the drop-down menu and looked at all the 165 different spots that you have a process for finding a place where you could have an Oxford House. And I'm wondering if voluntarily you'd be willing to say, because we do have 2 in one area, and proximity is the only issue, and I understand staff may have talked with you, and you said it could be that voluntarily a third in the Ballston area or a third on that block would not be your inclination. Is that reasonable?
Yes, that's very reasonable. No, we have no intention of opening another house in that block or in that specific area. We are sensitive to proximity issues. That is not typical. It usually comes about as a result of a landlord that owns multiple properties that's become a real fan of renting to us. That's the case here. That's the same owner for both houses. But yes, absolutely, we could voluntarily say that.
Thank you much. And I certainly also understand that when you find a landlord who's willing to enter into this journey, then I can understand why that is too. Thank you. I'll yield.
Okay, Ms. Cunningham.
Just to follow up on that, you mentioned the contacts are frequent or available, very available on the website and the phone. In the case of the Arlington houses, were you contacted previous to, I think the meeting happened in August, but have you received contacts from neighbors and community members prior to August?
I'm not sure. I wouldn't want to. I mean, I've been doing Oxford House in Virginia for 20 years. So over the course of 20 years, have I ever spoken to a neighbor in Arlington? Yes. I couldn't necessarily tell you when specifically that was.
Okay. And I think one of the residents shared that it's, they often hear of a concern later, like at the group meeting. What efforts have you made to make that more contemporaneous, right? So
Yeah, I
you
mean,
have a
typically,
phone call.
if we receive any indication, whether it's from, the local government or neighbors or anything like that, we immediately, we don't wait for the monthly meeting. We immediately step in, speak to all the parties, figure out if it's appropriate or necessary for us to call a meeting with the house itself, and that usually happens. Sometimes it happens within hours, but typically within a week because they always meet weekly. So that response is definitely quicker than monthly.
Great. And then one last question. You mentioned there have been up to 6 houses operating for many years in Arlington and clearly operating with great success. Have you ever applied for use permits for any of those houses?
No.
And any additional detail you want to share?
Historically, our perspective on the fair housing, law is that the accommodation doesn't necessarily require an imposition of a sort of arbitrary limit. That has, over the last 10 to 15 years, sort of evolved. This number 8 has sort of been proactively put out there by a lot of localities and municipalities, and that is being sort of held up in courts now. But in the case of Arlington, we don't unless it's clear to us that the law calls for that. And this has been discussed here, but the Arlington County Code just didn't even seem to have something that fit us. So it wasn't clear to us that that was necessary.
And so dormitory, for instance, didn't appear to fit you. Could you clarify?
I'd have to be reminded what your definition of a dormitory is.
Gotcha. Thank you.
Okay, you're welcome.
Okay, Ms. Coffey.
I would.
Problem? Sorry.
And this, I want to direct this to you, but also potentially give our CSB representative Paul a chance if it makes sense or if you want. But can you talk about the importance of independence and kind of the critical role that being self-sufficient and not overseen on a 24/7 basis plays in terms of recovery for residents?
Yeah, sure. Yeah. Yes. And I want to point out that while there are some people that come into Oxford House sort of immediately following a detoxification, the typical Oxford House member has completed a treatment program or perhaps maybe even has been incarcerated for a period of time. So most people coming into Oxford House already have at least some foundation of abstinence. And a lot of people will even, and not in the Arlington area because there's a lack of, other recovery housing models, and that would be great if that changed, but a lot of people will go to a more structured housing model and then move to this when it's appropriate. But yeah, we very much believe that the sort of, these are all people that are going to have to come back into the community and do well and be good citizens and, be functioning members of this community. So doing that in the context of where they're still receiving support, where they're still receiving peer support is very critical and is really why, that independence is really, we believe, why Oxford House is so successful. Like I said, it's, it really empowers the individuals in a way that other models don't because there's always sort of an authority figure. It's an us versus them. We raise the bar high and it may be counterintuitive to people on the outside, but they meet it, most of the time.
Thank you.
Yeah, sure.
I think my only other question.
I think Paul might have been.
Oh yeah. Did you Paul, if you would like to, I would love to hear from you as well.
I'm just trying to read the body language.
Yes,
I think
thank
he's
you.
interested. Yeah.
Sure, just real quick. Yeah, I think it's important we have different levels of care for people in different places. Some people need more help, but for people that are ready for an Oxford House, that are ready to kind of take the next steps with education, employment, becoming more involved with their family again, whatever the situation is, it's a great model for people who are ready for it. It's also important we have a place like Independence House, and I would love to see more of our housing in the area where you maybe have some additional staff oversight and additional support. But, we talked about the challenges of that, but love to work with you on how to get some more in the area.
Absolutely.
Thank you.
Great, thank you. Let's see. I think that'll be it for me.
Okay. I actually have a few. I'm going to give Mr. Stevens a break. I'm giving you a break. It's okay. I think this is a little more for step, because one of the things that comes up, Ms. Armayo's testimony was, speaking was kind of clear about this. We have issues with houses in Arlington and people living in them that are not behaving as they should. They're not with Oxford House, they're not with a sober house, they're not with any, they're just people that are here and problematic for some reason. And we do hear about issues with, enforcement and public safety. Could you, and Mr. Schwartz, I think this is perhaps you, talk a little bit about what people, if they have concerns about a house and the people in it, what should they do, and what kind of response we do and can make? Does that?
Right, and I think that, Debbie, you had a slide that you might want to put up. And I look at this in the context of, any resident in the county that has a neighbor, whether it's an Oxford House or any other neighbor, where they're experiencing noise issues or other kinds of trespassing questions, they should call. I want to make sure I get my boxes right here. Go ahead, Debbie, say it. Was it the non-emergency police number?
Which is not on the slide.
Which color am I looking at?
Actually, I don't have emergency services
Oh, okay,
on this
all right. Well,
particular
that'd
slide.
be one of them, but
but
the other things.
parking does fall into, some of the on-street parking issues do fall into non-emergency police.
Yeah, so all of these, all the complaint submittal boxes we have here apply in all circumstances, not just to Oxford houses, but to any resident in the county.
And we won't go to, I have often thought on the board, since I got here 12 years ago, enforcement is an issue. It's tough. You've got a lot of people, 240,000 people living in a small area, and some of those people have, over time, they will have mental health issues, they'll have other issues. And they may create noise, be difficult neighbors, and again, not associated with any kind of a group. And in fact, it seems to me in some ways, having a structure like Oxford House where we can give you a call if there's, and actually address it is probably better than the random folks who are just having really hard times in their lives and things are falling apart and they're creating too much noise and other things. So I will just toss out that I think enforcement in general, because we do hear from people, we called and police come and they go and they come and they go. I think there are there are restrictions to what we can actually do with people, particularly people with mental health issues. And I worry in some ways that the difficulties we have that enforcing good behavior gets conflated with these kinds of houses. And actually, I think in many ways that when there's some real some oversight, even when it's slight and a program, we're actually better off than with a house with a family or a person who is having a lot of trouble and it's not part of any program at all. But they get conflated because people make assumptions. So I just sort of wanted to bring that up. And I really appreciate, Mr. Stevens, your being here and talking about what you do, giving it a face. And I think one of the things I've sort of picked up is, well, in some ways, I was kind of unaware Oxford houses even existed. I think you came to us, and maybe I even talked with you some years ago when we were going to a particular house. I had a member of presentation, but other than that, certainly not aware of how many Oxford houses there were, which tells me a couple of things. One, you're for the most part doing a really good job, because we hear when people are not happy. And two, maybe it's almost too good, and what we need to do is have a little bit more communication. And I think that you've heard indications, maybe some interest of meetings, 6 months, just to kind of stay in touch. Not, we can't require that, but I think that actually better communication might help in general, might help you, might help us, and help the neighbors. So I just kind of wanted to surface those issues. Finally, which I think came up here, I know we have heard, not so much today, but before this, concerns about, and I think I'll be back to Ms. Kaur, maybe it's Ms. Albert. What if we're worried about, are we doing anything to make sure it's safe for fire, or it's builds the fire code and the building code? How do we know the building is safe? And I presume the same way we know any building is safe, but I'll just let staff say that perhaps. Ms. Albert, I think that's for you perhaps.
Again, the certificate of occupancy application, which would be required should the board adopt the proposed amendment, would trigger a zoning and a building inspection. The building code specifically is looking at life safety issues.
And what if somebody, a neighbor, thinks all of a sudden, maybe like none of the fire alarms are working, or that it was safe then but it's not safe now? Then what should they do?
Again, if a neighbor has concerns about safety, there's probably two different options. They could call the emergency services. Obviously, if it's an emergency, if it's not an emergency, they can call that non-emergency police number. If they are more familiar with our process and they suspect that it's a building code issue, they could submit a building code complaint. So they have a number of options. And I will say, again, we don't expect people to understand under which code or which department particular issues are enforced. So if they call the wrong department, there is a communication path within staff to make sure it gets to the department that enforces that code.
Right, that is great. We do try. You can call the board office or whatever, and we'll get you to the right and hopefully get a good handoff. And then final question, I think, is for Ms. Somerville. And I don't know if you covered it, I don't think in this presentation, but we've had it earlier, which is interesting to me, is how many residences of sober houses are receiving services from the county in other ways. One of the concerns we've had is that nobody's really regulating sober houses, nobody's checking on you. Yet I think most of the residents are receiving services, other services from the county, and there's often a way that we have a window into how the living situation is going for that person, which gives us a window onto what's going on in the houses. Is that correct? And do you want to talk about how many other services, how many residents tend to have other services that would give us a window into what's happening?
Sure, I'm happy to talk about that. Yeah, I'm estimating, it was hard to get factual numbers on this, but I'm estimating somewhere around 90 to 95% of the folks that are in Oxford House are in treatment either with the CSB or with other providers such as National Capital Treatment and Recovery, who has community treatment as well. Both of those would have a level of oversight where they would be getting support from their clinicians. I know for a fact that a few of the clinicians that I supervise have been out to Oxford houses just to do home visits, just to check in, make sure that things are going okay. It's a pretty routine activity for our folks that provide services for clients wherever they're living. And then in addition to that, we have a number of folks that are connected to the criminal justice programs, including Recovery Court, which was formerly known as Drug Court. Probably not as many in the behavioral health docket, just because that's really more significant mental health issues. But with that, there's a huge amount of oversight and supervision of folks that are in those programs. And then also through probation and parole, there's a lot of oversight. They will verify where they're living and maintain correspondence. And I'll say that I have talked to Debbie Robinson from Oxford House multiple times over the years. I know one time I raised an issue that a client had brought up, and I can't say I've ever seen anyone react as quickly. Like, I feel like she was in the car when I called her, and she was at the house like 10 minutes later. So they're very responsive, and I think when they said that they will communicate and get back to you, that has definitely been the case.
Thank you, that's very helpful. I think we do, over the last many months, we have heard horror stories, but I finally realized they're mostly from other places. And I'm really pleased to hear how well I think we are doing here and Oxford House is doing it. I think there may be some need for regulation on a state or national level, but we can't do that. And I really am pleased to hear actually about how well this seems to be functioning here, and appreciate the responsiveness over, I think you said 30 years, was it, Mr. Stevens? Yeah, that's impressive. Thank you. More questions. Mr. Carantonis, I'll get back to you.
Actually, that rhymes with the last line of questions to Ms. Somerville. So I had the opportunity to get a lot of feedback and input from the peer counselor program that the DHS is running. And That was really very, very insightful for me. And I can imagine that this is really available and accessible for all Oxford House residents. So if you can elaborate a little bit on this, because I think this is something that we often don't see, and it's important to make that more visible.
Absolutely, I'd love to. So there's always been a big component of substance use treatment has been peer recovery and the support that comes from that. And if you look back at AANA and certainly Oxford House, that's always been a part of the model. But it's been more of a movement sort of certainly within the CSBs, to prioritize having peer recovery specialists, people who have lived experience. So the CSB has 14 staff that are peer recovery specialists who have lived experience. Many have dual diagnosis of mental health and substance use. We are lucky to have, I think, 6 that are designated for substance use. With those, we're able to provide groups for people as an additional support through that. They'll also go to wherever they lived, so to the Oxford House or wherever else they're living, and meet with them and provide services. And a lot of times they'll just walk with them through the process of recovery. And as we all know, life is challenging, just going to get your ID or, figuring out how to pay your rent or any of those kind of things. And oftentimes the peers will actually literally walk side by side with them, learning how to function again.
Thank you.
All right, I see some more lights to my right. I'll go to Mr. DeFranti and then Ms. Cunningham, if that will work.
Thank you, Madam Chair.
You had a
Yeah, I wanted to, first, I want to thank you so much for the slide that was just up on 47, and also the description of the peer program. Mr. Carantonis has known that for the last week. I have not. It's not that I didn't think it was there and that I hadn't learned about it once, but learning when you just hear it or see it is not the same as experiencing it. And so I'm just really grateful there. And I think if whoever's controlling the slides, if we could just go to the preceding slide, the one with the number of people that you serve, I just wanted to, what the numbers that I thought I heard was, and that I thought I saw on the website is somewhere 86% of folks succeed. And, that's a lot. On the preceding slide, that's a lot of people in Arlington. 2,483. So I just thought, whether we have an 86%, if we could get 86% of those individuals, that'd be more than if we don't become more accommodating in my view. So enough of that. I do have a specific question that's on, as we have wrestled with this, it's on credentialing and certification. And that is in Virginia code, as I understand it, and I think you covered this a little bit in the presentation, there are 2 entities that can certify here. And, one of them in the code is Oxford House. And that is, that's a little new for me, I'll just say. And so I don't think that we, as a locality, because of that state law, can do any credentialing or certification of recovery houses. Is that right? Okay. The short answer is yes. No need to.
Yeah,
okay.
There's no authority.
Okay. So I just think that was raised by a number of folks who wrote into us, and I just think it's worth saying in this context. So there's no other question there. I just wanted to elicit that point, because much as we might want to, and this, as recently as the last week, I've been like, what about, how can we do something and write? The law is still state law. We cannot, credential or certify in this area under the law, which includes those 2 entities. So that's all. Thanks, Madam Chair.
Thank you. Ms. Cunningham.
Yeah, I would amplify that as well, that there were a number of concerns raised about the state certification robustness, and we're privileged to have one of our state representatives here with us today, so you can catch them in the hall. So I think that is something that folks may want to have a continued conversation at the state level. I had one other question on public safety, which is, I think we showed page 11 had the average calls for 2 different types of homes. And I think we verbally mentioned sort of what a typical household in Arlington, what those numbers might look like. Could we just reiterate that?
Yeah, we understand from our conversations with the police that the average single-family home could go decades without a police service call. Many, of course, do need police services, but we expect a different level of service for people who are suffering from mental health or substance abuse.
Okay, and so is there an average that's 1 or less than 1, or we don't know?
We don't have an average. There's 28 single-family homes in the county, but we don't have an average of those calls.
Okay, so but we do know that the calls for group living situations and group homes serving the developmentally disabled are substantially larger, and that is just fact.
Correct.
Yeah, okay. I think those are all my questions, though I do have an amendment to offer.
Okay, I think this might be the time to offer, if you've got an amendment you want to offer, go ahead.
So I move that the county board adopt an amendment to the zoning ordinance as shown in the attachment to the staff report with a modification to replace recovery residences as a category of group living, which would, as our other group living categories, require use permits for all recovery residences.
All right, is there I don't know if Mr. Kushner is able to put that on does he have that so he can put it on the screen?
If you give me a moment, I can put it on screen.
Yeah, we'll get it up on the screen, and then colleagues will see if there's a second for purposes of discussion.
I have a question on that as he pulls it up, Madam Chair.
Yeah.
I'm not in a place where I want to second what I think to be the motion, but I do want to understand it and see if Ms. Cunningham can, if you're willing, if you can explain or if we can talk about it without.
Sure, we'll get it up on the screen, and that might help. Yeah, and you could second it for discussion purposes. That doesn't necessarily mean you support it.
Sure. Second for discussion. I should have put my cards as to not likely to be there, but I want to understand it.
Yeah,
Thanks.
that's absolutely appropriate. And our hardworking clerk with all of our tech. Yes.
Well, Ms. Cunningham, this is an alternative motion, or is it an additional or a friendly amendment, or an amendment to the main? An amendment to the main.
But I think you want to turn your mic, but I think it would totally change the.
Totally.
It would totally change it, I think.
I think it would be a motion and substitute.
Yeah, it's a substitute motion.
So let's get it up on the board and we can figure that out, but we'll take just a minute to give Mr. Kushner time to get that.
Pardon any typos.
There we go. And so do you want to talk about what in effect this would do, or maybe we could ask Ms. Kaur to do that?
Yeah, I could. You want to do it? You might do it better. Go ahead.
Okay, so this language would require use permits for all recovery residences above 4. Above 4 residents. It would also place the category of use under group homes as opposed to residential living. And group home uses are fraternities, dormitories, and the technical definition of group home that Ms. Albert had previously referenced, which is more than 8 people living together with certain services from the Virginia Department of Behavioral Health.
Yeah, and maybe it would be easiest to project the section 5.1.2H, I think it is, the table that has the uses. I can feel the electrons trying to get there.
You have that?
I have a slide with a definition from Virginia Code.
I think that's what we were looking for.
Okay, let me put it up and you can see if that's what you're looking for.
Like the table, the table that has the.
I don't have a table from Virginia Code, but I can show you what I do have. I just have a definition.
The definition of group homes is what we're looking for.
I have a definition from Virginia Code. I also have a definition of
I
group
think
homes.
she's referring to the table
our
in the zoning
ordinance.
ordinance.
Yeah, ordinance.
Yeah,
The zoning ordinance.
the group living category in the zoning ordinance.
All right, give me a second.
I think it would be page 5.2 or S2 of the zoning ordinance, 5.2, sorry.
Sorry, I'm just trying to operate this mouse.
There, we're getting there.
Just can't seem to do. This is not going to be a good way to do it. Let's do this.
There you go, there you go. So it would essentially add a line under the group living section that would say recovery residences, and then it would use all the other language, tying it to state code as the definition.
Right, and it would be a U across, because it would require a use permit.
So it would be consistent with the ability to do the same living situation for those who are non-disabled, which are listed there.
And just a question, I believe there's a definition in state code for what sober residences are?
I believe Ms. Cunningham's intention is to use the same definition that staff has for recovery residences. It's just that she's doing it so that it's for by use permit rather than by right.
It's treating it like the other group living categories that are established for non-disabled.
Okay. I'm not comfortable with that myself personally, but we'll see if others. Ms. Coffey.
I have a question for Ms. Cunningham as the person making the motion. Is there a reason that or a rationale that you have for treating this accommodation differently than we treat accommodations for other class of disability?
I think it goes back to the interchange you guys had about what reasonable accommodation means. It means making sure that you're accommodating people to live the way that other non-disabled people are living.
But do you have a rationale for why we would treat this disability differently than a different disability?
Only that the state mandates the other one. It's very specifically.
Okay.
Right. Any other questions for Ms. Cunningham? Mr. DiFerenti?
The movement to 4, I think I articulated earlier why I'm not there on that. I understand that this is your point on state code. Ultimately, the combination of law and facts and the overall direction that I think we should head, I have thought about this as a question of is a reasonable, on a reasonable accommodation, ultimately I've thought about it, who should have the burden? And I know that you're well-intended, but I just feel that for me, the history of local regulation has been not in the direction of affirmatively furthering fair housing. We had a former president who just didn't want to do anything in it. That's not you, and that's not those who've spoken. But for me, I can't avoid that. And so I think, as well-intended as I think it is, I'm not there.
Okay. Mr. Karantonis, do you like so?
Thank you, Madam Chair. Ms. Cunningham, I believe I understand what your intention is. I do believe that what's here at stake is to treat to disabilities in a different way, and this is not what I understand as fair housing and being responsive to that. It's also coming very late, and we didn't have, extremely late into the discussion. I think there is a possibility, and you will be here to discuss that. We charged our planning department with discussing a new definition of family, right? So there is ample space to discuss these things. Further than that, I really think that there is a problematic aspect of trying to use the use permit process to regulate specifically the use that affects a protected class. In this country, we have the Fair Housing Act because we had problems with that. So this is just my rationale for not really wanting to go there, and for the reason I'm not going to support the amendment.
Okay. And may I respond, Chair?
Yes.
So first of all, on the question of it being late, I think I've been clear from the beginning that this is a complex issue and that we wanted to make sure we treated it thoroughly. There was an assumption up front there on page 5 that there was no other path through our zoning code. And I think we, as a board, may have taken that more lightly than we should have and pressed earlier. Secondly, on the question of fair housing and reasonable accommodation, I'll turn to our general counsel to clarify, do we need to give the same accommodation to every protected class, or do we need to provide reasonable accommodation to allow those who are protected class to live in this similar manner to those who are not?
You have to provide reasonable accommodations. There are different disabilities, and of course, different disabilities have different needs, and so you would treat them, you might treat them differently, or you might not, depending on what their needs are. And so I think the thing you're grappling with is this use more similar to the ID group home use, or is it more similar to a dormitory use?
And then thirdly, I appreciate the fact that the work plan does act on the recommendation of Affordable Housing Master Plan and the request of many in our community to come back and look at the definition of family and potentially modernize it so that we can live in non-traditional family units. We will do that work. That work is planned for next calendar year, and it would be my recommendation that we have the lightest touch possible on the zoning code until we complete that work, and I think this would achieve that.
Okay. I think we might be ready for a vote on your substitute. Actually, I'm not quite clear if it's an amendment or substitute motion. I guess it's an amendment.
It's a substitute motion.
It's a substitute motion. Thank you for clarifying that. All right. So all in favor of the substitute motion before us, please say aye.
Aye.
All not in favor, please say no.
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 Okay, I hear that motion does not pass 4-1. Thank you. Appreciate you offering it and having this discussion. I think it's important. And now that brings us to the main motion that we've started with from Mr. Karantonis. All in favor of that motion, please say aye.
Aye.
Aye. All not in favor, please say no.
No.
No, okay, and I don't think I heard any abstentions. I think that one passes 4-1. And I think we are ready to move on to our next item. Thank you all very much. I want to thank everybody for coming. I will just say a couple of conclusions. I found myself in all the discussions here, again, proud to be in Arlington. It was really amazing to hear the stories. I appreciate people coming out and sharing them. These are difficult stories sometimes to share. And I think we have maybe started a new chapter of some better communication with sober houses and what you're doing, and I think that will benefit everybody. So thank you so much, Mr. Stevens, for coming, being a little bit on the firing line, and for everybody who came and spoke so eloquently today. Thank you. Yeah. And thank you for staff. There's been a lot of back and forth work on this one. All right, I think that brings us to our next item. By the way, for those of you who are following along, paying attention, my plan is we'll take the next item, and then after that, we will break for lunch. So if you're here for something else, you can take a break, get lunch, go vote, whatever would work.
Vote.
A vote. Yeah. And once we break for lunch, I'll give you a suggestion on how long we'll probably be before we come back into session. So let's take the next item, and then we will take a break. Mr. Kushner, could you please call that item?
Yes, of course. Item number 31 is an ordinance to amend, reenact, and recodify Chapter 46, the Arlington County Arlington County Employees Supplemental Retirement System 2, ACERS of the Code of Arlington County, Virginia 2. Amend Article 6, Section 32, and Article 8, Section 38 to provide a 1% multiplier benefit formula and a 2.5% required employee contribution for non-uniformed employees not part of a bargaining unit hired after January 11th, 2025. Part B is to amend Article 4, Section 27, and Article 5, Section 31 to delete the option for newly hired employees in the Management Accountability Program to opt out of the ACERS pension plan and allow the 6 employees who are currently not participating in ACERS into the proposed new plan provisions effective January 12 of 2025. And Part C is to amend Article 8, Sections 43 and 52 to correct amendments made in May 2023 that were agreed to during negotiations for the current contract between Arlington County government and the Arlington Professional Firefighters and Paramedics Association, Local 2800.
Thank you, Mr. Kushner. Take a breath. And now I'll turn to our manager. I assume we have a presentation.
Thank you, Madam Chair. I'm going to ask Marcy Foster to provide a brief presentation. Over to you, Ms. Foster.
Yep, you're still good morning. Got 3 minutes.
All right, so as manager mentioned, we're going to go for a brief presentation on the proposed new retirement system. So the proposed plan before you today is to implement a new retirement benefit program for non-bargaining unit, non-uniformed employees hired starting January 11th of 2025, so new hires in 2025. We have a chart that shows the two programs side by side. So employees currently joining the organization come into a system that has a defined contribution plan, a defined benefit plan, and they make a contribution towards those programs. That will remain unchanged, but the split will be between how much goes into the defined contribution plan and how much goes into the defined benefit plan. So you can see currently employees get a 4.2% contribution into the defined contribution plan, and the pension multiplier is 1.7. They put 4% of their pay in on a pre-tax basis towards that defined benefit multiplier. The proposal is to switch those out a little bit and put in a defined contribution plan where the county puts in 7.5% of pay, and that pension multiplier is then reduced to a 1% multiplier. And the employee would make a 2.5% contribution towards that pension system. Why would we make this change? In the recruiting world that we're living in now, we're talking to a lot of employees who are looking at things differently, and they have a different career path. So we find that they may not be staying as long with the organization. They may be coming in different points in their career and looking for different things altogether. So in order to attract that workforce that will serve our residents going forward, we think we need to look at our benefit package a little bit differently. We compete with the private sector more than ever. The private sector, for the most part, does not offer a defined benefit plan at all. They're offering programs that are set up as matches. So if the employee puts in so much money, the organization will match it as well. The tenure here is people are not coming and staying for 25 or 30 years of service. Potentially in the uniform world they are, but in the non-uniform world we don't see that. Employees see a good stock market. They want to be able to invest their money and earn more money. So putting in a higher defined contribution plan that's more portable and they have more investment opportunities is more to their interest. And they want the flexibility of how much comes into their pay and how much they put to their benefit package and how portable these items are going forward. So we wanted to look at some of our competitors. Now, we talked about the current program and we talked about the proposed program. A competitor might be Fairfax as a competitor in the government world. They do not offer a defined contribution plan. Their pension multiplier is a little bit higher at 2%, but their employees are putting in 5.3% of their own pay towards that pension system. VRS is a program that might cover Loudoun or Prince William and some of the other local governments. And they have a 1% defined contribution plan and a 1% defined benefit plan. But again, their employees are putting in 5% of pay towards those programs. If we look at the private sector, the individuals we're talking about might be nurses or social workers that might be employed by Virginia Hospital Center, where again, they have that matched program that I mentioned earlier. The employee puts in a certain percent of their pay pre-tax and the employer may match it. So the employee over there can put in between 2.5% and 8% of their contribution or their pay, and the Virginia Hospital Center will match it. What's this mean to an individual? So when we started down this road, we were working with Aon as a consultant to help us design the new program. Aon at that time looked at we were looking at a larger workforce, and a couple of years ago, the average salary we were working with was about $80,000. The employees were coming on board around the age of 32. And so what Aon did is compare the current benefit with our proposed benefit at certain points in time. So across the top, that's their years of service when they leave the organization, 5, 10, 20, or 30. In the current program, you can see the pension system would accrue for somebody at 5 years, provide a benefit of about $21,500 when they leave the organization. That defined contribution plan would provide an additional $26,000. So when they leave, their total benefit is about $48,000. The new system right below, for that same individual, the pension system is a smaller component, but it's still there providing a secure base for them. And the defined contribution plan, assuming a 6.75% return, is returning a larger portion of their total package. But overall, that package for somebody staying 5 years is about $60,000. And that plays out across the 10, 20, 30-year spectrum. If you get to 20 years, somebody staying here 20 years, the current program would provide them with about $553,000. And the proposed program would provide them with about $556,000. So even after 20 years of service, the new program would provide them a comparable benefit. It's not till somebody gets to the 30-year level or past that 20-year level that the current program might be a little bit better for the individual. Now, the contribution the employee is putting in along the way is reduced in the new program. So what you see at the bottom line is the benefit of them taking that money, that additional 1.5% of pay, and reinvesting it in the 457 plan or anywhere that they want on their own. So across the bottom, after 5 years, that 1.5% that the employee has can be reinvested and provide them about another $9,500. So when you add the effects of reinvesting their salary savings, if you will, across the board, I think the new plan provides them a comparable, if not better, benefit at all points in time. So who are these people that we're looking to hire? Well, in the most recent years where we looked at what we were bringing on board, our employees in this group tend to average about 10 years. They are not staying the 20 or 25 or 30 years like they may have in the past. The average salary of this group today is about $114,000. So those nurses or social workers that we're talking about are probably in this age or in this salary range. They're coming on board now at about the age of 37, so they may not be staying those 25 or 30 years because they want to leave or retire at an earlier time frame. And they are currently investing in themselves but at the rate of about 5% of their pay overall. So another $216 of their pay, they're already investing. So they're comfortable with making these investments. And the previous screen, we showed investments earning 6.75%. Well, pretty much historically, the stock market, if you can take the bumps and the hills and the valleys in the stock market overall, is returning about 7.6%. And if you reinvest your dividends, it's probably about a 10% return overall. So employees are interested in investing and earning more than that 6.75% of pay. Again, looking at a new hire, looking at this individual who's making about $114,000, $112,000 in this case, and earning that 7.5%. Don't even worry about reinvesting that money, but staying with us for 10 years. So currently, that employee would be getting a pension when they leave the organization at 62 of $24,000. They would take the 4.2% investment, the employer contribution to the 401A, and that would provide them with about another $54,000. So in totality, when they leave the organization, they have the $24,000 pension system and the $78,000 401. And so they're leaving the organization with the pension plus 401 at age 62 is $46,000. They have annuitized the bucket of money that they have in the 401A plan, and they've annuitized it to provide a $22,000 benefit. So the bold numbers, the $24,000 plus the $22,000, their monthly pension in the current system would provide them about $46,000. You move that over to the column that says Arlington proposed. The pension is a little bit lower, as you can see, because we've gone from the 1.7% accrual to the 1.0 accrual. So the pension system's giving them $14,000. But they don't need to do anything. They don't have to invest those dollars. The company, the organization is investing those for them. Their 401A is increasing from 4.2% to 7.5%, so it's providing them a bigger bucket of money, the $139,000 that they annuitized into $39,000. And so the $14,000 plus the $39,000 gives them a monthly or an annual benefit of $53,000 in the new system. So again, after 10 years, this employee is leaving the organization with roughly $7,000 more a year because of the switch between defined benefit and defined contribution. And then the third column is comparing them to the Virginia Hospital Center. So they don't have a pension at all. They have a matching program, so when the employee makes the same contribution into the system as they do in Arlington, they're going to leave the Virginia Hospital Center with $20,000 in total. No pension at all, no secure benefit, but an annual pension that they can spend of $20,000. So again, I think we'll fare very competitively with the private sector, and I think the proposed system is as competitive as the system as we have now, but it's focused on people who do not need to stay here 20 or 25 years or elect not to stay here for 20 or 25 years. Okay, again, why would we make this change now? The labor market is not changing as quickly as we think it might. We are constantly in a battle for the talent that we need. We are hearing from employees less of a focus on retirement and more of a focus on pay. So when we're competing in this region, and we showed Fairfax, and we showed VRS, and we showed the Virginia Hospital Center, I think we've created a program that will stand the test of time against those organizations. Our tenure, as you can see, is about 10 years, so employees are not looking for what a pension system will provide them after 20 or 25 years of service. The system has portability, so if they are moving from organization to organization, there's a lot of portability in this system. It allows employees to control their own investments more, so they can earn more than that 6 or 7%. They might be able to get 8 or 9% over time. And it allows them to have more take-home pay. So if they opt to have take-home pay, there's 1.5% more pay coming to them. Or they can invest it and put it in retirement and let that grow and have more retirement. But the choice is there. So if they want to have take-home pay that they can spend to more on their family, more on housing, more on student debt, they'll have that take-home pay. And if they so choose to keep investing for retirement, whether it's with us or on the side in an investment account, they have that money to invest on their own. Okay, that concludes my presentation. Any questions?
Thank you. We'll find out. Mr. Kushner, do we have any, no commissions, I don't believe, and any speakers?
We do not.
We do not. Okay, fine. Colleagues, the discussion is now with the board, but first, Mr. DeFrante needs to read a recusal, and then I think you're just going to be leaving us, I guess, for a little while.
I'll defer to our attorney on that. I think I can do, I just need to not speak, correct?
Yeah.
After that. Okay. So with respect to 31B, which is concerns 6 employees not currently participating in ACERS and opting out to the proposed new plan provisions, I'm advised that under Section 2.2-3112B1 of the State Local Government Conflict of Interest Act, I am not prohibited from participating in the board's discussion of 31B because I'm in a group of 3 or more persons, the members of which are affected by the transaction. However, we're at 6, and so I still intend to recuse myself from voting out of an abundance of caution. And while I'm able to participate objectively in the discussions and vote on parts 31A and C, I will not participate in the vote and/or any discussion regarding 31B. Thanks.
Thank you. All right. And with that, I think, Ms. Cunningham, I might turn to you for a motion, and then we'll have whatever discussion and move on. Put your microphone on. Yep.
Okay. I move that we amend, just making sure, is this enough? I move that we amend Article 6, Section 32. Thank you.
Everything.
I'll start it this way.
Yeah.
I move that we adopt the ordinance attached to the staff report to amend, reenact, and recodify Chapter 46, the Arlington County Employees Supplemental Retirement System 2 of the Code of Arlington, Virginia, to implement a new benefit formula and employee contribution rate for non-uniformed employees hired after January 11th, 2025, who are not part of a collective bargaining unit. Offer 6 employees who are not hired retirees currently in a standalone defined contribution plan to move to the new benefit structure, and make minor corrections to code language that was amended in May 2023. And with the inclusion of amendments to 46-52 as displayed on screen.
Excellent timing. Is there a second? I'll second that. All right, motion's been moved and seconded. Ms. Cunningham, would you like to speak to your motion?
I would. I really want to say deep appreciation to our staff for the thoroughness of this analysis across longer than several of us have been on the board to really get this right, to use the right consultants to look actuarially at the impact both across the county and to individuals. I know it can be uncomfortable to touch benefits in any way, but I think this is very responsive to the situation that not only is the county's average tenure declining over time, but nationally, I think the average tenure for women in particular is down to 3 years. So just a different workforce and a different time and different family structures that are driving that. And I think that this has done a nice job of creating the opportunity that one can within the IRS regulations to allow individuals to make their own personal financial decisions, particularly, as you mentioned, balancing student debt, childcare or elder care expenses, housing needs, and in some cases, medical expenses. So I think that while it can create some additional risk, our overall posture with our employees is to provide an incredible amount of consulting and support to make sure that each of us is able to manage that risk appropriately and make the right choices. I think it is absolutely clear that people need to switch jobs more often than they used to, and while we appreciate a much longer tenure than the average, we want to not lock people in and enable them to live their lives and move home to take care of a spouse or a elder for a bit and then come back if need be. So I will be in support of the motion and really appreciate the additional information that was provided in the presentation since we last saw it.
Thank you. And I appreciate all of the information we've had too. I will say when I first started this, obviously I'm of retirement age. And this touches me very closely, and I am lucky enough to have be the benefit of a very nice widow's pension through the federal government. They don't have pensions that are that good anymore, but at least we still have some defined benefit. So this is, we've got defined contribution, but also some defined benefit here to help folks. This is not all of the retirement. I was pleased to see how well we compared to Virginia Hospital Center, and a little appalled actually at how few retirement benefits some workers have. I think this does match what's going on more in people's lives and will continue to benefit them. So I am pleased to support this. But we all did give it a fair amount of look and concern to make sure that we're treating our employees well, not only when they're with us but when they retire. Other comments, Ms. Coffey?
Yeah, can I ask a question?
Absolutely, absolutely.
So I think one thing that we talked about in the briefings, and I think would be helpful to talk about a little bit more, is how rare is a 7.5% non-match employer contribution, both in public sector and private sector?
You got it.
I would say it's extremely rare. My experience, when you look at the private sector, when you're setting up a match, the most common one you'll see is a 50% match on the dollar up to 6% of pay, which equates to 3% from the employer. So 7.5% is much more than that you'd see. That doesn't mean there aren't some that go that high, but there are also some that go lower. So right down the middle, probably something along the line of 3%. When you look in the public sector, the local jurisdictions, we kind of showed you a little bit that the defined contribution plan is not a high component yet. They may get to the exact same place, but VRS, which is Prince William Loudoun, has that 1% defined contribution plan, which we're now stacking up against 7.5. They also have the defined benefit component of 1%. So a lot of them are the hybrid models like we have, but the 7.5% is highly unusual. We were not trying to save money, we're trying to spend a comparable amount, just restructure how the program is to reward a different career path.
Yeah. Yeah, I think this has been a really tough proposal for me to evaluate, being so early in my career and having heard much advice already about saving for retirement and how to plan. And I'm 29 years old, and I think I'm on my 4th or 5th retirement account.
You're a good example of the issue.
Yeah, I don't know that it's necessarily 100% by choice, but it does seem to just kind of be how things end up. And I think, the slide that showed the current versus proposed value to me was really helpful, I think, in understanding both along the timing of when people stay and go, but also in terms of really what individuals are paying in dollars right now versus getting out in dollars. And I think, this may be too complex a question to answer on the fly, but my perception is that we're using fairly conservative market return on investment rates in evaluating what the 401A plans could look like. But have we thought in terms of, how bad would the market have to do for this kind of 5, 10, 20-year proposed plan to be, substantially worse than what we currently have for retirees?
We did look at the different investment venues and offerings for employees. So if you are investing your own money, we do have 4 on-site certified financial planners here through Voya. There is a Morningstar opportunity built into our Voya plan as well. I did walk through that myself. It's extremely easy to use. You put in some of your own personal information and it'll plot out a course for you. And so it's very easy to implement if you don't even want to talk to an individual. Employees coming on board right now are automatically deferring 2% of their pay into their 457 plan. So most employees leave that money. They don't back it back out. So I think they're getting comfortable investing. And we have guaranteed funds, and we have what we call life cycle funds. So when you join the organization, you say, I don't know anything about investing, but I know I'm going to retire in the year 2050. You pick that life cycle fund, and the course is kind of set for you. So I think they have options, and if they sit down and talk to somebody either in the Human Resources Department or with Voya, they can avoid some of those uh-ohs, if you will. But we did look at the returns over time. In any period of time we picked in the course of history, yeah, there's going to be some downs, but it doesn't take that long to rebound. So we kept looking at periods of time where that performance would be above that 7.5%. And I think we feel pretty good that employees can get there.
Gotcha, thank you. And then I think the other area, thinking about, how to think about retirement, what numbers matter in all of this. I think looking at the proposed annual benefit at age 62 to me was an important one, and seeing that there is in fact the possibility or even the likelihood that with the massive 7.5% contribution into an investment account, that individuals retiring later on would actually receive a higher benefit on an annualized basis than they would if we maintained the current retirement plan. Am I reading that right?
It's a higher benefit. It's different at different points in time. So it was meant to show that employees should not be worse off in the new program. It just gives them some flexibility, some more take-home pay. And again, in the years that they're not earning 7.5%, if they were to get 6.5%, it may look like neck and neck, but they also have the opportunity to do so much more with that money. But it will show a better benefit. Up until past years 20 years and out, the current program is slightly better unless they start reinvesting that extra 1.5% of pay.
Yeah, and do we have data on the current and over time the tenure of our employees? It's hard to measure people leaving if they haven't left yet, but I'm just wondering if we have any metric by which to show that, not just the national trend of people moving around more often and not staying in jobs as long, but some data that shows that here in Arlington County employees are moving on faster.
We look at it periodically, and usually through the budget process, we share some employee data. I would have to see what we have stored historically that we could share back with you, but we think that tenure is going down. Not remarkably down, but our uniform employees tend to say the 25 or 30 years. I think that number is rolling back as well. So I think it's kind of common across the entire workforce that they do move around for lots of personal reasons, cost of living in this area, they want a shorter commute. So the tenure is shrinking. I don't think it's a huge amount that's so scary, but we do see that it's shrinking. So we can see what we have historically, but right now we're looking at that almost 10 years.
Gotcha. And then I think my other question is for the manager himself on collective bargaining. I think, we have units that are working to organize, units that may want to in the future organize. And I think to me, it's really important that, at whatever time, with whatever base of retirement plan, that we have a real commitment to negotiate even retirement benefits, back, if it's back to what we currently have, if it's something else that is not this plan or the proposed plan or the existing plan, but a third thing that we're really gonna negotiate in good faith on all aspects.
Yeah, absolutely. And so our experience when we went through with the 3 certified bargaining units is that the issue of retirement did come up, and we maintain the status quo. I will say that we've continued to have conversations even outside the formal context with some of our public safety unions about perhaps, and I'm not saying they will, but taking a look at some of the concepts here to see if they can bring them there. That doesn't mean that they would. And yes, if we get into collective bargaining with the yet to be certified units, absolutely, we will bargain in good faith, and it may be that as part of the trade-offs that we hear from the collective bargaining representatives that they want to go in a different direction, and absolutely, that would be part of the give and take of what happens.
Thank you. I'll pass along now. I've taken up a lot of space.
No, that's just fine. Mr. Karen Tonis, I think I'll work my way down.
Thank you, Madam Chair. I have a couple of questions. They are just for me to understand a little bit the fact that, with a quite attractive offer for an alternative arrangement for retirement savings, that ACERs won't suffer too much. So one part of that is that the defined benefit multiplier is proposed to be reduced from 1.7% to 1%. So I understand that the Virginia retirement system has 1%. So the thinking was to equalize with the Virginia retirement system, or was it different?
When we started down this path a couple of years ago, working with Aon, we were looking at what would attract employees and what would keep employees here at the county. And so we had a workforce, or a work group of employee representatives from all departments, and some had been here many, many years, and some that had just recently joined the organization. And so working with Aon, we got to the point where they felt like, in the instance that somebody could not invest money or invest poorly, how would we as an organization feel? And we thought some defined benefit guaranteed floor was the way to go. But employees also realized the stock market's been good. I feel good about investing. I need the portability in case I'm not here 20 years to get a really good, solid foundation. So they wanted a combination. And so when we started to look at it, we did look at the Virginia retirement system because that is in this region and people are familiar with it. This is slightly more generous on the defined contribution side than the Virginia retirement system, but was meant to give people a floor of support or comfort and then let them build off of that in the defined contribution side.
But we give up on the idea of performing better than the VRS. So many years we have a higher multiplier. Now we are just right where VRS is.
Right. Now VRS just recently changed themselves, so they had a higher multiplier in the past as well.
Now, the second thing is in the part of the board report that talks about fiscal impact, and it says these amendments will gradually reduce the contribution to the ACERs over time. So the expectation is that more new employees, the rotating in workforce, will be opting for the new system, right? So, ACERs will be also receiving less contributions over time.
Who would be receiving less?
ACERs, our defined benefit
the funding for the pension system.
The county will be, it says the amendments will gradually reduce the county's contributions to ACERs over time. But this differential will be invested, it's not that the county won't be contributing, actually it will be contributing, even under certain circumstances. I believe that must be a tipping point somewhere where it may be even more. But because 7.5% is a very high percentage. So, so the calculation here is that, the calculation is that this will be so attractive for this more ephemeral workforce, or this more rotating workforce, that ACERs will begin to decline as the preferential system of retirement.
So anytime we make a change to the pension system, we do have an actuarial report created for us. So they look at the strength of that fund to support the benefit payments into the future. So when the actuary looked at it, he said that over time, this will reduce the county's contribution into the ACER system. It's not a huge change in contribution level, but what we need to keep putting in that plan to support the benefit payments. And that plan is actually pretty much supported on the investment earnings, not on the dollars coming in from the county. It's a strong plan. There's a lot of money under investment, and they assume 6.75%. So they're investing conservatively for the future of all those benefit payments, and they're assuming they're going to reach 6.75% on a conservative approach. So we're letting employees take a little bit more risk on, keeping that secure base, but letting them invest the 7.5%, hopefully getting more, so.
And they own the risk then. This is their private risk then in
Right.
how this,
Right.
while Acer still invests in, the available investment vehicles, but it is assumed that it is a more collective ownership of this risk.
Correct.
Okay.
Mr. DeFranti?
Thank you, Madam Chair. I believe that Ms. Malarick is here, and I had a conversation with you, and Max's last name, I think, is Ewert. He's out of town today, but you sent me some articles. I read them, and they were very helpful. There's some question about the rate of return. That was one of the articles. And then there's also a broader intersectionality and a big question. So for me, I'm not, I think 6.75 and 7.58, I trust, I trust them, but I also, it depends on the moment, right? If you have to take money out in 2008, and depending on how much you have to take out, that's the question. So I was wrestling with this. I would say that it's very helpful that the 1% pension is kept, because I think that puts us in a slightly different circumstance. That's just my view. My impression, so that's sort of one piece of my thinking on this. The 1% is very helpful to me. I don't profess to know the precise percentages. With respect to for me, the exchange, Ms. Coffey with Mr. Schwartz, that really is the fact that collective bargaining is a possibility to address that is what ultimately leads me to support this. I think that it's hard to say exactly how many employees are covered by this, but I think in conversations it's somewhere between like 900 and 1,300 or 800. It's not the majority of our employees, because majority of our employees are covered under our collective bargaining agreements. Do I have a ballpark sense that's kind of close?
No, you're in the ballpark. I'm doing that in my head right now. I would have said around 1,200, 1,200.
Got it. And then, so if collective bargaining happens, which I very much hope it will happen for additional employees, I think we're there. I want to ask just a clarifying understanding question. It says non-uniformed employees, and our sheriff's deputies, the chances that we will soon get collective bargaining, in Virginia for you are not overwhelmingly high. So I'm just curious if I understand, current employees, under the way this is, will continue, who were here before January 25th of 2025, will continue to accrue under the old system of 1.75 per year?
Correct.
Got it. It's just that, and so new deputies, would they be covered, just out of curiosity? Would they fall into this group that would be in the new plan? Is that right? I'm not actually sure because it says non-uniformed.
We've written it for non-uniformed.
Okay, got it. So it would continue, as far as we understand, 1.75 would continue for those new. It just occurred to me, but that number in collective bargaining is what leads me to be supportive of A. The language with C is not a problem. My remarks were limited to A and C. Thanks.
All right, thank you. Ms. Cunningham. You have to, yeah.
Trouble with the microphone. I just have a quick question to make sure I'm understanding. I know employees have an opportunity to invest additional, to do a voluntary contribution Can you say a little bit about how we help employees, especially those who may not have a track record or family history of complicated financial investment decisions? How do we auto-enroll folks at the max and then they can dial back? Or I know there's a lot of national studies about, if you make it the max and then let people adjust it, more of us, especially those of us who are first generation in some of these programs, may be more likely to save more.
So the component that's not shown on the screen anywhere is the 457 plan, where employees can put in their own dollars out of their pay pre-tax. We auto-enroll them at 2%. So a new hire coming on board is automatically enrolled at 2%, because, as you've probably read, people are less likely to make the change. They automatically learn to live with that paycheck with 2% going into that system. They can always increase it. They can always decrease it, but I'm going to say 95% of them leave it alone or increase it. So people are not decreasing it. They are also then, through new hire orientation, told or have the ability to speak with the VOIA representatives. Now remember, there are 4 certified financial planners on site that meet with individuals one-on-one. And so they will consult with them about their risk tolerance, how they're comfortable investing, perhaps steer them towards a life cycle fund. I mentioned that the mutual fund is designed and it will start perhaps aggressive and then go conservative over time as you near retirement. The fund is created that way. There is a guaranteed account that the guaranteed rate is renewed or reviewed every 6 months. VOIA will change that guaranteed account if they really feel like they need to be in a guaranteed fund. But depending on where they are in their career and how many little pockets of money they may have somewhere else, that VOIA individual can walk them through that. If for some reason they are not comfortable doing that or they don't have the time to do it, Morningstar, which is a well-known investment advisor, is part of the VOIA package, and they can just get online and answer some questions. I did it myself in the last 2 weeks. Very easy to use and make some really sound investment comments for you based on what information you put in. And it will ask you if you want to reallocate your funds based on the investment advice they gave you, or if you want to reallocate it on your own, take it away and think about it. So it's pretty easy to use. So they have a lot of opportunities to learn more about investments. We have over 30 mutual funds in the plan. There is another individual window that lets you get beyond those 30 mutual funds into the stock market for somebody who's really, really aggressive and into investing. So I think through that VOIA program, there are a lot of options to get somebody to a comfortable place.
And if we were to, at some point in the future, decide to auto-enroll at the kind of max contribution, is that just a decision that could be made at the manager level that wouldn't touch these plan documents or require this particular action?
Right, so we can make that change. We have talked in the past, probably within Human Resources, about even increasing it to 3% once people become comfortable. The max is a big number, but we can gradually get up that way.
Great, thank you.
All right. Anything more? I think we're ready to vote. We have a motion before us, and I think, Mr. DiFranti, your vote is going, excuse me, Mr. Carantonis, you had something more?
No, only for a closing comment.
Okay, that's fine. And Mr. DiFranti, I believe your vote is going to refer to parts A and C and not B.
Correct.
Excellent. All in favor of the motion before us, please say aye. Aye.
Aye.
Thank you. Motion passes 5-0. Please, I will.
And then no, not 5-0. I will.
Oh, I apologize. Is there a no?
Yes, there is a no.
Okay.
And I can
Motion passes 4-1.
Exactly.
Yes. Mr. Carantonis, you surprised me. Sorry.
So it probably is not very surprising. We have struggled with that. I'm an economist. I am a kid of the 2008 shock. I have a very different appreciation of risk. I saw myself how Bear Stearns came down. I saw myself how, the institutions with more than 2 centuries of financial support were crumbling down. And these included also pension funds. And I think that I believe in a different public function, a public function that aims to be more, attract more talent for a longer run in general. I do understand, and if I was in your shoes, and I really appreciate all the work that went in the work group, et cetera. If I was in your shoes, probably I would give to my board the same set of options. I mean, there is absolutely nothing wrong with your approach or your, I just have you can call it a philosophical, ideological problem with that. I believe that privatizing the risk of retirement, given the fact that we have demographics in the United States that are going to ask us to invest enormous amounts of money in a generation that is aging right now without the backup of a Social Security type of support in the system is extremely risky. And one place where I can find an instance of resistance to that, trying to stabilize the system, essentially is the public function. We have tens of thousands of federal employees, and they know that, and they are very happy with what they have, I believe. Now, I recognize the challenges for us. We started this conversation because we were in a very challenging employment market. We continue to be in a very challenging employment market. I appreciate the issue of volatility and precariousness in the professionals staying with us. I get that. And I'm not saying that what you propose is not going to work or what my colleagues have voted for is fundamentally wrong. I just have a different tolerance for risk, pun intended here, and on this. I also believe that Arlington County is an excellent employer, and I want to say that. The pension system that we are offering may be underappreciated by some, but it is really an accomplishment. It's an accomplishment of a community that has invested in the public function, public work over decades. So I have to say, this is part of, for me, bedrock Arlington to have this, and I want to keep that. Now, this is not immediately in danger here. I understand that, and I look forward to the collective bargaining process to see how we better make that safer and how we, guide employees to make the safest possible and the risk, not the safest, the least risky decisions for their future, having seen it a couple of times challenged. Thank you.
Thank you, Mr. Karantanos. I apologize for not realizing that you were going to be a no vote on this.
Sorry for that.
No, that's all right. And I understand obviously, I understand your concerns. I am only comfortable because it's a combination. There is some defined benefit and some defined contribution. I would not be comfortable with something that was totally defined contribution. Yes, Ms. Coffey.
Yeah, I just wanted to make some concluding remarks as well, because I rarely come in really feeling like I don't know where I'm going to land on something. And this has been, among many other topics that we've been talking about all week, a really challenging decision for me. And I think I agree in terms of making sure that we retain a very important defined benefit. But I think the generosity of the 7.5% and seeing what that can add up to and accumulate to me was just very persuasive. I've never seen such a generous contribution. And I think just from my perspective, being on the generational change end of things, I think I have no belief that any defined benefit plan would ever, whether it's Social Security, a federal pension, a county pension, would ever be able to provide fully for cost of living and retirement. And so I think that's where, for me, the trade-off ultimately ended up coming, that if we're not planning to rely on that, giving people more portable money and such a sizable increase from 4.2 to 7.5, very persuasive, but I still very much support and believe and will continue to support the negotiations in collective bargaining for whatever our employees believe is the correct retirement benefit for them. And I think also let's think about this over time, and if we don't see the benefits materialize that we thought we would see, and if we have any questions or concerns about the longevity of our county retirement plan, I think we do need to come back and talk about it again. But for now, I think this will be an interesting thing to try out, and I'm at least interested in kind of seeing how it goes and whether it can help with some of the recruitment and other workforce issues.
Thank you. Any other concluding comments? Seeing none, I think we will take, the motion's passed, I think we're good, as confusing as all that was. And we're going to take a break for lunch. Colleagues, 1:15, is that doable, you think, back here at 1:15? Okay, so we'll plan to get back here approximately at 1:15. Again, y'all can take a break, go vote if you'd like to, and haven't yet, and we'll see you back here in just a little bit.
Everybody for bearing with us for the half an hour that we took for lunch. It is necessary, as it is for everybody, so we appreciate that you take the time and that you have been patient with us. The county board is back in session. I'm Takis Karantonis presiding as the vice chair. Our chair will join us momentarily, and until then, I will continue presiding the session. Mr. Kushner, our county clerk, will call the next item. I believe it's item number 32.
It is indeed. Item number 32 is a request to advertise a public hearing on an ordinance to amend, reenact, and recodify Chapter 14.3, which is the immobilization, removal, towing, and storage of vehicles from private property of the Arlington County Code.
So we have, Mr. Manager, we have staff presentation of that. I assume that we do.
Yes, thank you, Mr. Karantonis. I'm going to ask Caitlin Thomas to provide a presentation, and we have Aaron Miller joining us and other assistance as needed. So over to you, Ms. Thomas.
Hello, everyone. I am here as the Trespass Towing Advisory Board Staff Coordinator to request authorization to advertise the proposed amendments to Chapter 14.3 of the County Code, towing and storage of motor vehicles. So I have a few slides to go over. It's going to be only 6 or 7, it's not going to be super long, but I do want to talk about how we got here today from just within this one calendar year. In January, we had our TTAB meeting, and at that meeting, the members voted unanimously for a desire to implement a permitting system here in Arlington, and I do want to note that the one towing operator was absent during that meeting. And in July, there were a few bills that were passed and signed into law, which I will go over on the next slide. But once one of those that was adopted allowed us to implement a permitting system, among other changes. Between June and October, the TTAB met 3 more times and provided input for a few other recommendations to the county ordinance. And today we are here to request authorization to advertise those proposed changes. So on this slide, there is a lot of fine print laying out the 3 bills that were signed into law that impacted towing this year. We have one from Delegate McClure. That one allowed us to have a permit system included in our proposed ordinance changes. The second bill, House Bill 959, did a few things. It allows localities to require an additional signature at time of vehicle removal, in plain language, second signature. It allows the Attorney General to recoup the 10 times the towing fee for a consumer. It allows regulations and monitoring practices, and it implements a $20 fuel surcharge that went into effect July 1, 2024 through July 1 of next year. And then the final bill is House Bill 925, and that actually, it requires towers to place a notification on a car 48 hours before removal from a multifamily property should the reason be for an expired registration or safety inspection. So from these items, it's a lot to say, but I will show you on the next slide what that means for us. There's 2 main buckets. We have fees and process. The fee changes that we are requesting to advertise include increasing the base towing fee from $135 to $150, increasing the drop fee from 10 to 20, and the drop fee means when the tow truck, when it hooks up the vehicle, if the owner of the truck owner of the vehicle returns before it is removed from the property, they can pay $10 to the tow truck driver to retrieve their car before it's removed. And then there is a fuel surcharge of $20 that we added due to state code changes. And then we have a bucket of process changes. The big one is the permit system. It's a fairly large section of the code now. We worked closely with Fairfax County to learn from them, and we've heard a lot of good things on they like their code, the towers like how they work with the county. And so we learned a lot, and we worked very closely with them. Our permit system framework includes portions for licensing, for implementation, for grounds for revocation, for denial, and then also for appeals, should any of those situations arise. We also have in the code the plain language second signature, which is requiring real-time authorization of the tow in the field should the business be open, in addition to the written contract already in place. And building from that is now when if this is adopted, the person that has signed the contract, their information will be provided to the county when the tow truck drivers report the tow. Again, the 48-hour notice for multifamily properties, we added that in. I already spoke about it. We have a few things for truck signage, load securement, photographic evidence. It's just increasing the size of the lettering on the trucks. There's language to make sure the car is secured before leaving the property, and increasing the requirements for photographs to include the actual reason for tow inside the photos. We have timely vehicle release. This is saying that your vehicle will need to be available for you to retrieve it as soon as you pay. And also there's language to address that a receipt will be provided either in the field or at the tow lot. And the last item is, it's related to third-party mobile parking payment solutions. So Park Mobile, things like that, it adds some language to make sure that that evidence is retained and provided to police upon request. So that was a lot. It's super high level. And we are here today to request authorization of advertising a public hearing on November 16th for proposed amendments to the trespass towing ordinance, chapter 14.3 of the Arlington County Code. And so that concludes mine, but I'm going to turn it over to our chair, David Kennedy of the Trespass Towing Advisory Board.
Thank you. Please come forward. Yes, here. Or, as you please, but this is more practical, but you have to turn on your microphone.
It's fine. So I get the clock turned on also? Okay. So I just wanted to say thanks to Caitlin. She's been incredible to work with, patient, on top of things. You've just been terrific, so thank you. So I'm just I'll just give a little, I guess, kind of sky view of kind of how the TTAB has worked and how I've understood us to work and what our charge has been. I will say I've learned a lot about this business. I've really appreciated the give and take between the citizens, consumers' perspective and the towing company's perspective. And I think we've become a good working group, and with Detective too. So just so you know, Al Leach from Al's Towing was hoped to be here today, but his daughter is to have a child. So I think she might be in labor as we speak. And And then Detective Toomey also is on the third member of the TTAB. And again, we've worked well together, and I think we've really tried to listen. My view is, so I'll just talk to some of the things Caitlin talked to and how I understand it and where I think we are, at least from our advice to the county board and how to proceed. Multifamily units, for sure, we actually that's legislatively required, and we're totally on board with that. The teeth of this is the permitting system. And the fact that we will now have a permitting system, I think that's going to make all the difference in the world. One thing we actually suggested, though, and this came from Al, that I didn't see in the final version that I thought was actually pretty insightful. We had recommended that, and this was the concern of the towing company, if they're cited, if their permit is to be revoked, they have the right to appeal. And there's a laid out process that seems just fine. But what we as a TTAB thought would be appropriate is to see those appeals and have to see the result before a final decision is implemented. And we felt that that was appropriate responsibility of the TTAB. Now, I see that was struck. And I'm just going to raise, again, as the chair of the TTAB, I think that takes away some of the goodwill that we had in this process, because the towing companies, for right or wrong, are worried that they are going to be targeted. And I'm not saying could be right or wrong, but they're worried that they could be targeted. And even if they appeal, it might be loaded against them. And so to have one more check in the system where the TTAB comes together and just says, hey, you lost, you played poorly, your permit's revoked. For the TTAB to also have some kind of role in that process, to me, and I'm all about the consumer here, seemed legitimate. So I do feel like that's an oversight that's being presented to you, that we specifically recommended and approved was excluded. I think that was a mistake. I don't understand why it was struck, but it was struck. Just a couple other thoughts. We actually also approved, I call it the boot. I guess in the business it's called the immobilizer. And right now I believe the fee, if a company, and I'm again from a consumer standpoint, I'd rather get the boot on my back wheel or front wheel, wherever it goes, than being towed. The fee for the boot that the tow company gets in the current provision, I think it's $10. They're not going to there's no incentive for them to boot, there's incentive to tow. So we recommended that this immobilizer fee be increased from $10. We talked about $95. I think Fairfax might be $75. I don't know what the right number is, but I don't think it's $10. And so a $75 or a $95 fee, I actually think is better for the consumer, because I'm a consumer. I'd rather get the boot and then call, and the way I understood it, they would show up immediately and remove the boot as I paid my $75. That got struck. That's what we recommended. So again, I'll just raise that as a concern. The third thing that I think then I'll just talk to is the second signature. And This one, the first time we really talked about it in depth was at our final meeting. And I've heard both sides to the second signature. The second signature being the owner of that parking space, essentially, would have to be present, like Caitlin said, between 9 and 5 on business days. And they would have to sign off on the tow. I like it because it creates, to me, it creates this waiting period. And that's a good thing. On the other hand, I've heard the tow operators say it's problematic, and I'm sure they'll speak to it during the public comment period, but they said it was problematic because it actually can lead to violence. And that's compelling. But what I think we need to do around whether it's a second signature or some other, there's got to be a process that outlaws the predatory towing practice where a spy lurks, sees someone, maybe a pregnant, soon-to-be mom, pull into a spot, and see her walk into the wrong store because that slot was for buoy monger, and she just happened to walk into the bank first, be towed because of that predatory practice. So whether the second signature fixes that, if that's a surefire fix, then I actually would support it. We didn't support it at the TTAB because of what I thought was a compelling argument against violence, potential violence. But there has to be something with teeth that gets away from that predatory practice. So that's my comments. And thanks, Matt, Chairman, or Council or Board Member Matt. He's been a great help also, just helping us
Thank you, Mr.
understand the
Kennedy.
process. Yeah.
Our chair is back.
I know, but you're managing things fine. Keep going. You're good.
Okay, Mr. Clerk, do we have any other commissions? Probably not.
None further. Understanding Mr. Leach will not be joining us. So no, we do not.
So we have speakers.
We do indeed have public speakers. Give me just a moment. Our first public speaker is John Musso, followed by Scott Pedowitz.
Good afternoon, Madam Chair, members of the County Board. My name is John Musso, Government Affairs Manager at the Arlington Chamber of Commerce. On behalf of the Chamber, we're requesting that the request to advertise before you this afternoon exclude the language in Section 14.3-5 regarding the real-time authorization or the second signature. The TTAB, County Advisory Board, to study these recommendations had a multi-month process of considering all sorts of different recommendations and considerations for potential enactment. And during the discussion on second signature, they considered the merit, but they ultimately unanimously rejected inclusion into that document. And we ask that you please adhere to those recommendations. As noted by Chair Kennedy and concurred with the Chamber, there are very clear safety concerns that have not been addressed regarding written authorization or second signature. Members of staff or property management specialists or designated agents of these properties or businesses would have to be involved in situations where a vehicle is being towed due to being parked illegally, and local news stories and archives have fundamentally showed that these can be very dangerous situations at times, and these staff or agents or designated individuals for authorizing this are simply not prepared or equipped for these types of situations. So we recommend that you please adhere to the unanimous decisions by the advisory board, the TTAB, and please remove this from consideration from the request to advertise. Thank you very much for your time.
Thank you.
Our next speaker is Scott Pedowitz, followed by Joel Dinkins.
Good afternoon, Madam Chair, members of the board. Thank you. My name is Scott Pedowitz. I work with the Apartment and Office Building Association of Metropolitan Washington. I live here in Arlington, and after many, many years of trying to hold out, I own a car here in Arlington. I associate myself with the comments made by the previous speaker. I want to take a little bit of time to expand on kind of why we have the opposition to including second signature in the advertisement. And to be clear, we want proper parking and proper parking enforcement. We are not against any regulation here. In fact, we worked very collaboratively with Delegate Shin on HB 925, which was included in that presentation and related to multifamily housing properties. And the originally introduced version of HB 959, which is at issue here, which gave redress under the Virginia Consumer Protection Act. We were cool with that. We're not going to engage in that. Let's all do our business appropriately. I'll be the third speaker in a row to mention safety, and that is a serious concern. Now, let's be clear. Nobody, under any circumstance, should be threatening, brandishing a firearm, striking, or anything of that nature anybody else. I think we probably all agree on that. And we hope that it doesn't happen, but unfortunately, in an emotional situation, if one of your main pieces of property is not where you left it, that people have misbehaved, we are worried about seeing that that could be directed at our members' employees, our members' tenants' employees, or our members' residents, and that is a concern of ours. We also hear a lot of discussion about towing operators and drivers. There is a property concern. We don't want to lose sight of that our commercial property owners are putting forward parking to support their business. If you pull into the space for business number one, when you go to patronize business number two, you are depriving the business number one who has that space of the ability to use it for their customer. You may mean well, you may have misunderstood, it may just be for a second, but you are still taking that opportunity for them to use their space that they are putting out for their business. That is why we have this trespass towing process. Passions run high, as I mentioned, when it comes to this discussion. Again, I understand that there's human nature. I think that our TTAB, being comprised as it is designed to be able to have these discussions with the temperature taken down. I think we should put a lot of stock in the fact that they had that discussion and said that second signature would be best not to be part of the advertisement. I hope the board will concur in that judgment. Thank you.
Thank you, Mr. Pedowitz.
Our next speaker is Joel Dinkins, followed by Delegate Alfonso Lopez.
Hi, I'm here as a commercial property manager in Arlington. Public speaking is not my strong suit, so sorry. I manage about 17,000 square feet in Arlington and about another 80,000 square feet in Northern Virginia. And unfortunately, we have to tow because people will park and walk off the property to patronize other businesses, and rent is very expensive. And part of that rent is the ability to have your customers have access to your business. And the properties that I manage are spread out throughout Northern Virginia, so I'm not always on site. So the inclusion of the second signature is really detrimental to our operation because I can't be at two places at once. If there's a roof leak at a property in Alexandria, I can't run over to Arlington to sign that the tow company can tow a car. I should be able to sign a contract that says, I give you permission to tow from the lot when applicable, that someone has parked, walked off, and not patronized any of the businesses to protect the tenants and the landlord. So, I mean, and there's some protection in that because if I get a call from tenants that the tow company is towing people irresponsibly, it impacts the businesses already, like they would lose customers. So I would immediately find a different tow company to come provide the service. So I don't see the need for a second signature other than to just impede the landlord and tenant's ability to protect their interest. And that's all I've got. Thank you.
Yeah, thank you.
Our next and final speaker is Delegate Alfonso Lopez.
Good afternoon, everyone. Thank you for, I appreciate the opportunity to speak, and thank you for the progress you guys have made on this issue. I want to talk about where we were and then also respond to some of the issues about second signature. There's one issue that reunites residents of Northern Virginia across party lines more than any other: the intense level of frustration with predatory towing. This can all be contributed to over a decade of systematic efforts to undermine the towing section of the Virginia Code, just as it relates to tows in Northern Virginia. Under the Virginia Code, victims of what would be described as predatory towing in any other part of Virginia or the nation could not sue the towing company. Only the Attorney General of Virginia could sue for damages. Also, the Attorney General was only able to seek damages of up to $150, which is often less than the cost of a tow of $180. Moreover, the victim of an unlawful tow couldn't collect any recovered penalty, which went to the Literary Fund of Virginia. So what we did was we had created a disincentive to sue and essentially gave impunity to towers in Planning District 8, Northern Virginia. To be clear, Northern Virginia was explicitly prevented from having towing ordinances that are normal practice in every other part of Virginia and most of the major cities across the country. So I'm happy to report that after several years of work with towing and advocates, experts across Virginia, legislation from myself and Della McClure finally fixes what has become an ostensibly legalized predatory towing system in Northern Virginia. Moreover, it ensures that Arlington has the tools needed to address predatory towing practices. It's a local option bill that brings back equity and a more even playing field. Here's the thing. In Hampton Roads, towers comply with second signature, local ordinance with no major issues. It only requires it during business hours, Monday through Friday, 9 to 5. It isn't needed for garages or parking lots, and this is ensured everything is done properly, efficiently, and the affiliated businesses are fully informed and engaged. And it also prevents a DoorDash truck from being taken, a Meals on Wheels truck from being taken. A second signature prevents a police car from being towed. It prevents, oh, don't take that car, that's my cousin. It helps the businesses. So let me just speak to the operational challenges. A study was done in Hampton Roads by Hampton Roads Towing that said the employee's regular factor or duty factor over 3 years, over 200 private property tows were studied, with only 3% of tows reporting they had to wait for an employee to disengage from their work assignment to sign the second signature form. They can also have the designee do it for them. And then finally, no one wants violence. It's abhorrent that any of these situations would lead to violence. But the same study found that over 3 years, 100 trespass tows that were studied, the tow driver or the drivers considered confrontational. The study interviewed the person who was being towed to discover their concern. It was found that the overwhelming factor that contributed to the confrontational tow was the tow driver's attempt to collect the towing drop fee. And the second factor contributing to the confrontational tow was the visual of the person's car being hooked up to the tow truck. It was concluded that the two factors that contributed to the environment in which the tow could become confrontational were in the control of the towing company. So therefore, many towers in Virginia Beach no longer collect the drop fee. That's easily fixed in this reg. Thank you for being open to these changes. Thank you for following the code, and I look forward to seeing what you accomplish.
Thank you, Delegate Lopez. And that's our final speaker.
No further speakers.
All right, thank you. I think the conversation is now with the board. I think I'll turn to Mr. DeFranti if we get a motion on the table, if that's all right. And maybe, Mr. DeFranti, we make that motion, clarify what authorized to advertise means and the issue of scope, because I think that may help people that are following us.
Sure. Thank you, Madam Chair. I guess I'll start with the motion and then see if there's a second and then speak to the other point. I move that we authorize advertising for a public hearing by the County Board on November 16th, 2024 on proposed amendments to the county's trespass towing ordinance, Chapter 14.3 of the Arlington County Code set forth in Attachment A as posted. I'm not sure I have the posting date.
The staff report, I think.
I think October 15th.
Yep.
Thank you.
I think that's good. Yep, thank you. All right, is there a second, please?
Second.
All right, motion's been moved and seconded. Mr. DeFranti, would you like to speak to your motion?
Thank you. First, on the request to advertise, this touches some of the points that Mr. Kennedy, you made, and some of the other issues. Request to advertise, we have to we have to, and I may be corrected by our attorney, but we have to advertise the most significant impact, and then we could tailor down. It's called being in scope or out of scope. Is there a more eloquent way you could say that, Madam Attorney?
So when we advertise an ordinance, the purpose is to give notice to the public. And so the general practice is to advertise broadly so that, the maximum number of people who could be impacted will know that they might be impacted so they can show up and participate in the public process. Advertising is not the same thing as adoption, and so the board could always narrow the scope of what they finally adopt, but they would not broaden it in a way that would not put people on notice of what was being done.
Thank you, very helpful. And I will just say, my understanding, I think the big issue is the second signature that is in your motion. However, it could be taken out at adoption, so it gives us time to talk about it. Is that fair?
Yes, that's correct. And the contrary point is actually also the case. If we did, is my understanding, if we did not put language in here on second signature in this moment, we could not consider it in November. And so that's part of why I will be supporting that provision in this piece of it. So I don't know how you want to proceed. I can speak to the three items that Mr. Kennedy, I can speak a little bit to the three items.
Sure, go ahead and speak to your motion, and then
Sure.
we'll see what others would like to say.
Sure. So with respect to the subsequent appeal to the TTAB, just for the few people who aren't sure, there are three members of TTAB right now, Mr. Leach, Mr. Toomey, and Mr. Kennedy. Understand your concern about process and wanting the challenge is that one of those three members is Mr. Leach. It's a small enough group that if he were conflicted out, if his company did a tow, then it would be, that would be a small universe of individuals who would be doing that. That's one of the concerns for us, that subsequent step for an additional appeal. The second is that was raised in discussion was sort of the timing of the appeal. We were able to get people at we were able to get a quorum at the later three meetings, but not the first meeting, and I think the proposal was to do it within 7 days. The big, broad piece of it, you will recall, and the towers in the room will recall, that there were some amendments that we changed to listen to concerns with respect to the county manager or designee, and that level of process, I think, is a fair concern. We're going to have to, as this proceeds, we're going to have to be accountable. I think I've covered everything on that piece. Is there anything that Caitlin, or excuse me, Ms. Thomas, or Mr. Miller, that you wanted to add on those at all? You don't have to, but I just wanted to make sure we're addressing. The other two, state law with respect to drop going to $95 or $75. My recollection that state law doesn't allow us to go that high. Is that correct, Mr. Miller, or is there?
In consultation with the county attorney, 46.2-1231, which covers mobilization fees, there's a passage in there that reads, the charge for removal of any device used to immobilize a trespassing vehicle shall not exceed $25 or such other limit as the governing body of the county, city, or town may set as ordinance. It was the advice of the county attorney that because the state code there does say not to exceed 25, that we are not able to exceed $25. And that was their advice.
Great, thank you. So that's what we got with respect to that second one, and I won't deny there was some discussion of other places, but that's, we listened to the staff and attorney together. I think on second signature, my prior remarks probably at least addressed. That may not satisfy. So those are the three items that were mentioned. I want to share in closing in support of the motion that this is we will have to implement it. There will be much further discussion next month, and but I do think it's, as Delegate Lopez says, it's important for us to get started. And so both we'll have to implement this over time, and the permit system is a big piece of this. So I'll stop there.
Thank you. Colleagues, other questions? Ms. Coffey?
Yeah, I mean, I think, to me, advertising the broadest versions that we can hear more along the way, more from the public. I am very interested in reactions and considerations. I think we have a quite a tuned-in community when it comes to this issue, and I definitely invite more comment and conversation over time. I have a couple of just clarifying questions. Property managers, for second signature, property managers can designate someone else to sign, right? So like a manager, someone who will be physically on the premises. It would not have to be the overall property owner that has to be present every single time, right?
That's my understanding, and that's how the language should call for.
Okay, thank you. And then the other question I have is kind of related to concerns over violence and escalation, and maybe I'm just not understanding, maybe this is something to be addressed in future public hearings and public comment. But if a consumer comes out to their car before the tow is completed, wouldn't is it required that the tower drop the car for the drop fee at that point? I think I'm a little uncertain what the escalation is there, because they should be getting their car back at the point where they come out.
Yes, that's true.
Yeah.
Are you combining that with the second signature concept?
Right, yeah. I think
Okay.
If they're coming out, they had more time to come out because there's a second signature or whatever it is, but they're physically there, then the car should be dropped, and it seems like that would be a de-escalation, not an escalation at that point. Yeah.
Yeah, I think one would hope that it's a de-escalation, but as was previously mentioned, someone seeing the property removed and you just don't know. That was the point that was brought up. So.
Okay, I just wanted to add, because I think I see there's two scenarios here. So yes, the person comes out, the car is on the truck, it's still in the lot, then they talk to the tower, it's a drop fee. The car is removed. If the person is still in the business, the tower, if second signature was implemented, then the tower goes to the property owner or whomever is designated, gets them to sign it, and then the car is gone before the consumer comes back. So if that all happened at once, then the consumer came back as he was signing, then that's a different scenario. So did that help?
A little bit, yeah. Yeah, I think I'm just trying to, there's many permutations here, but I'm trying to just understand the situation of concern and whether there are, ways to de-escalate and to be safe while also, having a check and balance on making sure that, everything is in compliance. So I'm, again, invite members of the public to comment on that, explain their experiences as well, and we'll have more conversation. I think that's what I'm most interested in terms of this being an advertisement, not an adoption.
Mm-hmm. Thank you. Other questions? Mr. Karantanis?
Just piggybacking on this question, and like Mr. Pitovitz, I resisted very long, but I have also a car and I never have been towed. I don't know how I accomplished that.
Knock on wood.
Drive enough. So the sequence of events, and correct me where I'm wrong, is the towing company or the owner or, designee of the owner of the shop or the property that has a towing contract identifies a vehicle that is not appropriately parked there, that's in the wrong place. So then the first thing that happens, if we adopt a second signature, is to get agreement between the tower and the owner that this car needs to be removed. And then the process of hooking up the car, et cetera, would start. it wouldn't be like, somebody hooks already the car and then goes inside and gets a approval.
That's a good question. Yeah, I mean, I guess that's, as far as I know, we don't speak to that in the code, the order, but that is a good question. But I think that still the core element is the car won't be removed from the lot or from the property until it's signed off. And if that person does come back, the vehicle owner, while it's still there, then they can pay the drop fee, and it should de-escalate it.
Until, I understand that the drop fee would only be possible if the order to tow with the second signature is in. So
I think we'll need the attorney's input on how it's all going to work together, but the drop fee alone, without second signature right now, the drop fee is if the vehicle has not left the property. That's what it is.
Yeah.
So however that interacts with the second signature, I don't think we don't speak to that, and so I don't want to speak on how that.
Yeah. These are little
Important details.
It's a taste of more than a few of the details that we need to care about in this process. I personally look forward to this conversation. This is a request to advertise, so a lot to learn about towing in Arlington.
And I'd actually like to follow up your question, if I might, before I go to see if Ms. Cunningham's got some statements with our attorney. Could we then put in here what the order should be? Can we specify that, it seems like there's some question if there's a delay, or can we just be clear that as long as the car is there before and the owner comes back while the car is there, the drop fee applies, or is that already in code?
I was talking to Mr. DiFerranti when the question came up, so I did not follow up.
Okay. I think the question is, I think, as I understand, and I think these are all, it's all a little bit confusing. I think the concern is everything's almost in train. They go to get the second signature, and while they're getting that second signature, the owner arrives. And I assume, and then the question is, because they've moved forward to get the second signature, does that mean the owner, the drop fee applies? But I assume it does. As long as the car has not been removed, the drop fee would apply. I think that's in the current code?
That's right.
Okay, I'm just clarifying that. Thank you. Ms. Cunningham, did you have any questions? Because I haven't gotten to you yet. Okay. I've got the mic here. Another question. I think this might be for our attorney, too, Ms. Kaur. So there's this whole issue of getting the second signatures and being different places could be resolved, I think, possibly, if a virtual signature, we've all done DocuSign and things like that, could that be made to apply, or is that beyond our purview to say that that applies?
I don't believe there's anything in the law that says it has to be a wet signature, so it's really more of an operational issue than a legal one.
So we could even put in that we consider that applies, or something to just clarify for us, if we wanted to. This is going to be for discussion.
If you wanted to.
Yeah, okay. Thank you. Mr. DiFerranti.
Thank you, Madam Chair. I just wanted to sort of move us to close, and I think the discussion here is kind of shown why we need to first see language, work the language, and we would like to advertise broadly and then come back. With respect to process, I want to address that and the prior meetings. We had a number of discussions. We fully complied with all the law with respect to TTAB. The second signature issue, the TTAB meetings have not been chock full of attendees. And if you live in Arlington, you know that towing there's what we must do to comply with the law, and then there's also trying to get broad enough discussions so that people know about this issue. And that is something that's to the extent that's possible. And we have complied with the law, and we also want enough discussion so that we can have a public hearing where it's broad, it's considered. And so for my part, that is why I like to in this case, I want to advertise broadly. And that's also relevant to the 4 years ago or so in the last hearing. There are people who care about this issue who weren't in any of those 4 TTAB meetings. And so that's part of the reasoning for the process issue that you mentioned. So that's it. There's, didn't mean to take Ms. Kaur's time, but I wanted to make sure there's a couple of issues that I wanted to clarify in the text that are in scope for next month. And one is, I think we need to add a couple of words on page 14.3-16, which is required. And then Ms. Thomas and Mr. Miller, you'll know, I think there's some operational questions that are relevant in section E with respect to permit procurement, unlawful procurement and distribution of locality permits. That's a question of where implementation of this will be. It'll be a combination of ACPD as well as this county manager's office. And so I just want to make sure that we talk about that in the next month. But those are the implementation questions. Thank you, Chair and colleagues, for bearing with me. And I think this is an important first step. I really also have to thank all of you who spoke and testified. You might have wanted to speak at 11 or 11:30, and so grateful for everyone who stayed.
Thank you, Mr. DeFranti. We appreciate your doing the liaison work and helping to shepherd this along. I think we're ready to vote. All right, we have a motion before us. All in favor, please say aye.
Aye.
Aye. All right, any noes, nays? Okay, motion passes 5-0, and I think we're ready for our next item. Could you call that, Mr. Kushner? Thank you all.
Of course, item, lost my page, pardon. Item number 33 is a request to advertise a public hearing on an ordinance to amend, reenact, and recodify Chapter 13, which is Firearms, Article 2, the Firearms Ordinance of the Arlington County Code, to amend Section 13-14 to exclude the discharge of firearms for county-supervised deer management activities from the prohibition of firearms on county property. And Part B is to amend, reenact, and recodify Chapter 17, Miscellaneous Offenses and Provisions of the Arlington County Code, to amend Section 17-5 to permit the discharge of firearms for county-supervised deer management activities.
Thank you. And Mr. Schwartz, I'll turn it back over to you.
Thank you, Madam Chair. I'm going to ask John Marlin to go ahead and give us a presentation. He's also joined by Jennifer Fioretti. So over to you, John.
All right, thank you. Pulling up the presentation now.
You're not the first today that have found some delay in our technology. There we go.
Okay, good afternoon, Chair Garvey, Vice Chair Carantonis, and members of the County Board. This is a request to amend, reenact, and recodify Chapter 13, Article 2, known as the Firearms Ordinance, to amend Section 1314 to exclude the discharge of firearms for county-supervised deer management activities from the prohibition of firearms on county property. This is also a request to amend, reenact, and recodify Chapter 17, known as the Miscellaneous Offenses and Provisions of the Arlington County Code. The amendments to Chapter 17, Section 17.5 propose permitting the discharge of firearms for county-supervised deer management activities. This request is necessary to implement the primary deer management recommendation of the county's recently concluded deer management project, which called for professional sharpshooting to immediately reduce deer populations in our natural land parks to protect the ecological health and integrity of those forest systems, and to conserve the documented climate change, heat island, flood mitigation, and human health benefits those forests provide to Arlington County. Before we dive into the details of the proposed amendments to code, we'll briefly review the deer management project, which concluded in September and was the county's multi-year effort to understand its deer population, measure that population's impact on county-owned natural land parks, and explore methods for potentially managing that population and its impacts. The deer management project began in 2022 and was broken into 3 phases. Phase 1 consisted of data collection, analysis, and narrowing down management options to consider. Phase 2 consisted of publishing a report of those findings and then engagement and education around that report to inform the public and seek their feedback on potential management options. Phase 3 consisted of developing draft recommendations, seeking feedback on those recommendations through public engagement, and then finalizing the recommendations. For additional context, here's the timeline from the deer management project, and you can see that the project ran from August 2022 and concluded with delivery of our final recommendations at the September 17th board meeting. We'll now briefly cover the history of deer monitoring and management in Arlington County. This work provided data used to inform our final deer management recommendations. And so to understand a deer population and its impacts on forest health, you need to collect 3 key pieces of data. How many deer do you have? Where are they? And how are they impacting the native plants in your forests? And to answer the first 2 questions, we hired a consultant to fly a drone over Arlington County and count the number of deer within county limits excepting federal lands. They documented 290 deer county-wide, with the key takeaway being that the deer were not evenly distributed throughout the county, but were highly concentrated in our forests at levels beyond what those forests can sustain. That finding prompted us to enlist another consultant to collect the 3rd key piece of data, which is how are deer impacting critical native plant communities in our forests. To answer this question, our consultant enlisted experts to conduct herbivory impact assessments in 12 ecologically significant parks in Arlington to determine if our elevated deer populations were harming plant communities and therefore forest health. In 12 out of the 12 parks surveyed, his team observed substantial damage to native plants from deer overpopulation. The consultant also conducted a review of the scientific literature and benchmarked neighboring jurisdictions to further inform our assessment. And before we go further, I'd like to spend a few moments on this slide, which speaks to the crux of the issue with deer overpopulation and why our department has made it a priority. On the left, we have Lacey Woods Park, which is relatively untouched by deer. You can see that Lacey Woods has a diverse and dense understory with lots of different plants at different heights. This understory is key because it provides food and shelter to many animals and supports its own web of life. It also represents the future tree canopy of the forest, as some plants within the understory are young trees prepared to take over when older trees die. On the right, we have Barcroft Park, which is heavily browsed by deer. Here you can see that the understory is severely degraded, meaning that those understory plants and the animals that rely on them are absent. There are also far fewer young trees poised to take over for mature trees when they require replacement. Eventually, this process may result in the loss of our forests. Our community will lose access to the documented health and well-being benefits of experiencing nearby forests, and also lose the documented climate change, heat island, and flood mitigation benefits that our forests provide to Arlington County. Overall, the Deer Management Project featured a robust, multi-year engagement process that solicited feedback through diverse channels, both virtually and in person. More specifically, the engagement plan included 2 online and 1 in-person feedback forums, virtual meetings with key stakeholders, presentations to the Civic Federation and 6 civic associations, informative communications, including a video translated in English and Spanish, project FAQs, an online story map and bilingual yard signs, educational information shared via paid and earned media, and in-person pop-ups strategically located along Arlington parks and trails. The Deer Management Project ran 2 major public engagement campaigns. Engagement 1 occurred from June 15th through July 18th, 2023. This engagement allowed community members to review the results of the consultant's herbivory impact assessments, literature, review jurisdictional benchmarking, and consider a range of potential methods for managing Arlington's deer population and its impacts. Engagement 1 included an online feedback forum, an in-person community meeting, pictured here, smaller scale meetings with key stakeholders, and bilingual pop-ups and yard signs throughout our park system. Overall, the engagement showed that most respondents at that time were supportive of a deer management implementation strategy, with 55% in support. However, the sentiments on which strategies to employ were mixed, with surgical sterilization garnering the highest support at 63%, followed by professional sharpshooting at 43%, and archery and fencing entire parks trailing at 34% and 21% respectively. Open-ended feedback ranged widely, but coalesced around certain themes, such as the need for urgent action to protect our natural resources, skepticism that deer management was necessary, prioritization of humane or non-lethal methods of management, public safety, and evidence-based management. Engagement 2 occurred from June 17th through July 19th, 2024. We used the second round of public engagement to inform the public about our draft recommendations and solicit their feedback on those recommendations. It included an online forum where participants could provide feedback directly to county staff, a virtual community meeting where participants took the opportunity to learn more about the recommendations and ask questions directly to project staff, and presentations to the Parks and Recreation Commission and Forestry and Natural Resources Commission. The online feedback forum had 601 respondents providing 1,100 comments, and the virtual community meeting had 158 participants. One key question from the online feedback form asked participants to characterize their opinion about a county program to manage its deer population. 85% of participants responded as very supportive or supportive of a deer population management program, with 11% responding as very unsupportive or unsupportive. Another key question dug deeper by asking participants to characterize their opinion of a professional sharpshooting program to manage the deer population. 80% of respondents responded as very supportive or supportive of a sharpshooting program, while 16% responded as unsupportive or very unsupportive. And themes from the open-ended feedback included support for the project, the need to speed up the process, the private property damage from deer browse, preference for public archery, focus on the need for safety, the need for more data, concern about the spread of disease either to humans or to deer, and the preference to consider surgical sterilization instead of professional sharpshooting. After analyzing feedback from Engagement 2, the project team developed final recommendations for deer monitoring and management that centered on professional sharpshooting as part of a hybrid approach to manage the deer population on county-owned natural land parks. This was also the primary population management recommendation of our consultant. And since this is a request to permit professional sharpshooting in parks, I'll provide a brief description of the method as it would be implemented in Arlington. Professional sharpshooting is a lethal technique employing professional sharpshooters using firearms to reduce deer populations. Professional sharpshooting has been shown in peer-reviewed literature, as well as operations regionally, such as those on National Park Service properties, to reduce deer populations sufficiently to support forest regeneration. Professional sharpshooters would fire downward from tree stands at short range using sound suppressors to mitigate noise and special ammunition that breaks apart upon contact with vegetation. And the Deer Management Project found no reported cases of injury to bystanders in professional sharpshooting operations nationwide. And professional sharpshooting operations would be carried out when parks are closed under the supervision of Arlington County Police Department and Department of Parks and Recreation staff. And venison from sharpshooting operations would be donated to those facing food insecurity when feasible. And moving on to the rest of the recommendations. To allow for data-driven adaptive management, we recommend monitoring the deer population with periodic aerial drone surveys and monitoring deer impacts on forest health with 2 different established methods of herbivory impact assessment. And these monitoring methods are also the primary recommendation of our consultant. And we also recommend that the county review Arlington County Police Department, Animal Welfare League of Arlington, and Virginia Department of Transportation deer vehicle collision data intake and collection methods. If we have better information about how many deer vehicle collisions there are and where they occur, we can target public safety measures like signage, speed limit reductions, and wildlife crossings. And finally, we recommend monitoring tick-borne diseases such as Lyme disease and exploring options for monitoring other relevant diseases. And now for next steps. So we are currently proposing amendments to county code for your consideration. Then in winter 2024, staff will develop a deer management plan. And finally, in winter 2026, staff anticipate commencing professional sharpshooting to reduce deer populations in natural land parks. And for a deeper dive on anticipated activities in the coming year, if professional sharpshooting is permitted, again in January 2025, staff will begin work on a formal deer management plan. This will be a high-level document that outlines areas of interest for management and monitoring procedures and metrics, and the operational cadence for program activities. In February, staff anticipate replicating the aerial drone survey from 2021 to establish a new baseline for our deer population to inform management and procurement decisions for professional sharpshooting operations. In spring, we'll begin procurement for a professional sharpshooting contractor to be in place in winter 2026. In fall, we'll implement herbivory impact assessments as part of ongoing annual monitoring of deer impacts to the health and regeneration of plants in our forests. And finally, in winter 2025, we'll begin robust public outreach ahead of sharpshooting operations in winter 2026. And to return to the purpose of this RTA, this is a request to amend, reenact, and recodify Chapter 13, Article 2, known as the Firearms Ordinance, to amend Sections 1314 to exclude the discharge of firearms for county-supervised deer management activities from the prohibition of firearms on county property. Chapter 13, Article 2 currently prohibits possession, carrying, or transportation of firearms on county property, with exceptions made for certain persons like on-duty military personnel or private security personnel. The proposed amendment provides a new exemption for professional sharpshooter personnel hired by the county to carry out deer management activities within county-owned or operated parks. The amendment is necessary for the deer management program to carry out its primary recommendation of using professional sharpshooters to manage deer populations within county-owned natural land parks. This is also a request to amend, reenact, and recodify Chapter 17, known as the Miscellaneous Offenses and Provisions of the Arlington County Code. 17.5A currently prohibits the discharge of any firearm within the county unless the activity is specifically exempted in 17.5D. The proposed amendment to 17.5D provides that exemption for county-supervised deer management activities. This amendment is also necessary for the deer management program to carry out its primary recommendation of using professional sharpshooters to manage deer populations within county-owned natural land parks. Which brings us to our staff recommendation. Staff's recommendation is for the county board to adopt the attached resolution to authorize the advertisement of a public hearing by the county board on November 16th, 2024, to amend chapters 13 and 17 in county code to permit professional sharpshooting operations for deer management in parks. And with that, thank you again for your time and consideration today. And of course, thank you to all the community members who show up today to provide feedback and have provided feedback throughout the process.
Thank you, Mr. Marlin. And I think now we will go to our commissions. I believe we have several here.
We do have a couple of folks joining. Mr. Klingelhofer with the Forestry and Natural Resources Commission, followed by Ms. McIntyre with the Climate Change, Energy and Environment Commission, and Ms. Barker with Park and Recreation Commission.
All right. Phil, come on up. You can sit at the table if you want or stand at the podium, whichever you'd prefer.
I'll sit.
That's absolutely fine. Just need to turn on your microphone, I think. You got it.
Okay, I'll go ahead and start. First, I want to thank you all for giving me an opportunity to speak tonight to this RTA, request to amend. And having sat through several hours of this meeting, I commend you for your stamina and your diversity of interests, because everything's been quite different and interesting to hear. Let me get started. As was made evident by John Marlin's presentation just now, Arlington has a serious deer overpopulation problem. And as much as we all love animals, these deer are having a devastating effect on our forests and ecosystems. They're killing new saplings needed to keep our forests healthy and destroying crucial habitat for a wide range of insects, birds, and other creatures. The experts who assess the effects of the deer warn that without rapid action, we could soon reach a tipping point where the county's forests will no longer be able to regenerate themselves. The county's expert consultant recommended aggressive deer management. To move forward with that crucial deer management, the county board must update the local firearm ordinance to allow sharpshooters to operate in the county. That process begins with this RTA of the ordinance update, which is hopefully going to be concluded today. We strongly urge that the board approve this request to advertise so that we can move forward with this urgently needed deer management program starting now. Thank you very much for allowing me to share the views of the FNRC.
Thank you, Mr. Klingelhofer. And now I guess we'll go to Ms. McIntyre. E2E2.
Yes, good afternoon. I'm Joan McIntyre, speaking on behalf of the Climate Change, Energy, and Environment Commission. C2E2, first off, would like to say we really greatly appreciate all the efforts that Department of Parks and Recreation put into doing the study documenting deer overpopulation and its impact on our natural resources and engaging the public in discussing potential solutions. C2E2 wholeheartedly endorses the proposed deer management plan and supports this proposed ordinance to move forward with that plan. The evidence is clear. We are losing our woods because of deer overpopulation, particularly when you add it to the pervasive invasives within the areas. And in fact, the county board's spending a lot of funding to get rid of those investments, and that really will come to naught if the deer keep browsing away any of the newly planted or regenerative growth within the forest. So this is an essential part of really restoring our natural areas. The current situation is not only detrimental to the healthy ecosystems, but also to the deer themselves. Sharpshooting has proven to be safe, effective, and the most humane solution for managing deer overpopulation, and it's most appropriate for Arlington's dense urban population, urban environment. And sterilization has proven actually to be stressful to the deer, and in open areas where there's it's just not really effective in areas where you have open populations where they can come from other areas. We look forward to following the implementation of the efforts as the county moves forward, tracking the deer browse and adjusting the cull rates and management policies based on what the results are showing. Healthy natural ecosystems will support a diversity of wildlife, including deer, and provide access to nature for all Arlingtons and all of the benefits that come with that access to nature. So thank you very much.
Thank you. And Ms. Barker? Welcome.
Thank you, Chair Garvey and distinguished board members. I am Chair of the Park and Recreation Commission, and I'm pleased to appear before you on behalf of the Commission to support the request to advertise item 33, which, if adopted, would permit professional sharpshooting of deer to implement the proposed deer management plan. On July 18, 2024, the PRC wrote to you a strong letter of support for the proposed deer management plan, including the use of sharpshooters to reduce deer populations in county-owned natural lands. At that time, the PRC stated that the plan should move ahead quickly with the request to advertise for management and the necessary code adjustments. So we were very happy to see all this work being done and coming to fruition. The deer management plan is based on extensive study. The overabundance of deer in Arlington demonstrably hinders the growth of a diverse native ecosystem here. You've heard all the scientific evidence that was presented, and the current rate of deer overbrowsing for both woody and herbaceous native plants is reaching a critical point where the forest might not be able to regenerate itself. Failure to act could cause irreparable harm to countless wildlife species, our natural resources in general, and the quality of life for Arlingtonians. Community groups and park volunteers in Arlington contacted the PRC to express support for the plan, especially noting its scientific underpinnings and adherence to best practices such as those exercised in most of our neighboring jurisdictions. We received letters of support from Eco Action Arlington, Sierra Club Potomac River Group, and the Audubon Society of Northern Virginia, now known as the Northern Virginia Bird Alliance. In addition, 9 of the Bill Thomas Park volunteer awardees dating from 2012 to 2020 signed a joint letter in support of the plan. These are Glenn Tobin of 2020, Elaine Mills of 2019, Bill Browning of 2018, Joanne Hutton of 2017, Paul Holland of 2016, Hussein Hu of 2016, Judy Funderburk of 2015, Mary McLean of 2014, and Steve Young of 2012. Luminaries. Park stewards, other park stewards, and numerous other park volunteers wrote to us about the devastating impact that the overabundance of deer has had on our forest understory from their points of view. They represent collectively many thousands of hours of volunteer experience in our parks. Now is the time for the county board to act. The PRC urges the board members to vote for the request to advertise and to prioritize implementation of the deer management plan. PRC intends to send a written letter after our meeting this week. I'm happy to answer any questions, and I really appreciate the staff's work. Thank you.
Thank you all for being here. And that brings, I think we have some public testimony.
We do. Give me just a moment.
Call the speakers.
Our first speaker is Marion Jordan, followed by Glenn Tobin.
Good afternoon. My name is Marion Jordan. I am a long-term volunteer in Arlington County's parks, and I lead volunteers in habitat restoration in Barcroft. I've observed firsthand how overbrowsing by our deer population has eliminated the understory in many areas of Barcroft and other parks. The understory of tree saplings and native shrubs is critical habitat for all of our wildlife, including birds, small mammals, amphibians, and the deer themselves. I urge the county board to support the work of county staff and approve the request to advertise the code changes needed to implement professional managed sharpshooting to reduce the deer population and bring it back into balance for the long-term protection of our forests. County staff has studied this problem extensively and also brought in 2 expert contractors. The first counted the deer and found too many in our natural areas. And the second managed deer browse. That white buffalo study showed browse rates in natural areas that are so high, they prevent regeneration of tree seedlings and saplings and native shrubs. County staff have also done an excellent job of public education on this difficult issue. Their opinion survey result shows that most Arlington residents understand the need to bring the deer population into balance. I've seen this myself many times, informal conversations and public education talks to community groups on the issue of deer overpopulation. Residents love our deer and our forests, and they now understand that we must reduce the deer population for the long-term protection of the deer, or the wildlife, and the forests themselves. Thank you.
Thank you, Ms. Jordan.
Our next speaker is Glenn Tobin, followed by our 3-minute speakers, beginning with Jim Lyon.
Thank you, and thank the board for being here today. It seems like it's been a long day. I'm an active volunteer in local parks, and I certainly support the advertisement of this initiative. I received the Bill Thomas Award in 2020, largely for work that I did in, I continue to do in Windy Run Park, as well as in across the parkway in the George Washington Memorial Parkway. And the thing that's relevant about that for this conversation is in some parts of the national park, deer browse is less than there is in Arlington County parks, in Windy Run Park, for example. And so within a very short distance, you can actually see a forest that is heavily deer browsed and then one that is less deer browsed. And I know there's kind of endless analysis on this topic, but I thought I would just try to personalize it all for you with 2 kind of short vignettes. If you walk in Arlington County parks, it's like all the adults are there. It's all the big trees, there's some bushes. When you walk in the national park, just across the parkway, it's like the grandparents, the parents, the children, and the babies are all there. You have all different sizes of trees, and they are growing up at different rates, and they are creating a set of ecosystems and kind of habitat that is very conducive to all kinds of living creatures. Second vignette is in the national park, there are native azaleas. I don't know if any of you have ever seen the flowers from our native azaleas, but they are stunning. Everyone loves the azaleas in Arlington County, the ones that show up in large bushes by people's homes. But the native azaleas have a different color, a different shape. They're vibrant, they're alive. My perspective is that you all are responsible for the invaluable asset of Arlington County, which is our natural forests and the rest of the natural lands. And we really have to ensure the longevity and the vibrancy of these assets. Anything else would be irresponsible. And if you just take the role, unfortunately, the role of deer touch both. They touch the longevity because of the trees vignette, and they touch the vibrancy as well because of the native azaleas. And my hope really is that as I continue to volunteer in Windy Run Park until I'm 90 years old is my plan, I'd really like to see a hillside full of our native azaleas flourishing in Windy Run Park. Thank you very much for your time. And I'd also like to, if anyone wants to see this, I'd offer to
take a tour
any of you around, and like to thank Board Member Cunningham for coming on a walk with me earlier this week and seeing both the Windy Run Park as well as the GW Park.
Great.
Thank you very much.
Thank you, Mr. Tobin.
Our next speaker is Jim Lyon, followed by Terry Armeo.
Hello, Jim Lyon. I'm on the board of Eco Action Arlington, a community-based organization that's been working here for 46 years to promote environmental sustainability. But I'd say before retiring, I also worked for the National Wildlife Federation for 25 years, an organization with its own storied history on wildlife conservation. And while I'm not speaking on behalf of NWF today, I do draw on my experience in working with wildlife scientists and experts on conservation matters across the country. EcoAction is concerned about the ecological issues of deer overpopulation, the need for active management, and we commend the county staff for the very thorough and credible study of deer population levels, and the findings of whitetail are causing significant impacts to the forest, plants, wildlife habitat health. And we support the recommendation that the deer herd must be culled to sustainable levels for a healthy deer population, forest regeneration, biodiversity. We've already seen the study that confirmed 290 deer in very highly concentrated areas of wooded and meadowed watershed areas. Average deer needs to eat 6 to 8% of its body weight every day in green foliage. That amounts to over a ton of food per deer per year. Overpopulated herds impact other wildlife species competing for the same food stocks and habitat values, nesting birds, bats, amphibians, forest and riverine mammals. Now, I note that Arlington is not the first in the nation to face this problem. In fact, I'm a little surprised that this moment hasn't come much sooner, like in our surrounding jurisdictions, but also in Baltimore and Philadelphia and Pittsburgh and half in New Jersey. They have all needed to professionally manage deer overpopulation, and frequently with lethal culling as one of the methods. I'll leave with this. We need to be mindful of the delicate fabric of the natural world and its interwovenness, and it is stressed. A recent report in Science found that North America has lost over 3 billion birds since 1970. Reasons cited included forest and habitat loss. And while Arlington is just a small cog in that wheel, we're complicit if we don't act to stem the forest, tree canopy, and native plant loss. And sometimes it means making hard decisions today.
Mr. Lyon?
Yes.
There you are. Are you finished?
Yes.
Yeah, thank you. I wasn't quite sure if the screen had frozen or you had finished. Thank you very much. Appreciate your comments. That's okay. Thank you. And next speaker.
Our next speaker is Terry Armeo, followed by our final speaker for 5 minutes, Ms. Connie Erickson.
Yeah, but Connie's not here.
Hi again. I'm a little surprised that there's nobody here speaking for the deer. They couldn't afford an attorney, they told me, and they were disappointed that they couldn't sign up themselves, but you can understand how they couldn't. So I'm here speaking for them. I was going to say the same thing that this gentleman did. I invite you to go around and put on some comfortable walking shoes, and you're going to see what I saw when I went yesterday to 4 parks that were on the list of the staff report. And I went specifically and I took pictures, and guess what I saw? I saw browsing, but I saw regrowth on every single one that looked browsed. I saw new leaves popping up on shrubs and on trees. And I saw canopy trees, mid-level trees, small trees, and tiny new trees at every park that I went to, except for Bluemont, because it is so covered with porcelainberry and English ivy that the whole area on the W&O Canal, the footpath that's paved, is disgraceful. And you want to talk about not providing habitat to animals, that's how you kill them. So Mr. Lyon was correct. There are 3 billion birds probably killed a year. A lot of that is during migration, and it's flying into glass windows, and it's predation by cats. It's not specifically loss of forest, although that is critical. And I am, believe me, Miss Tree. I am the tree canopy coordinator for my neighborhood, and I have been. If I see a chainsaw come out, I'm there begging people not to cut their trees down, you know, and if they do, to replant. I love insects, rabbits, skunks, I don't care what it is, I love animals. And so I am very invested in this, and I invite two of you to come for a walk with me. And let's go look at the browse rate, because it's not what I saw when I went yesterday at all. And I was very surprised. I took pictures, but I didn't upload them. So killing deers with guns from high up, basically, you're eliminating possibly the best of the gene pool, because it's indiscriminate killing. And hunters do this when they go out looking for the biggest bucks. So they're killing the best of the gene pool, and later iterations and populations are weaker. And we shouldn't allow indiscriminate killing. I totally am against this, and I urge you not to request to advertise until you go with somebody or yourself and go look for yourselves. I urge you not to do this. Thank you. And also, I hope you read your flyer from the deer.
Yes, we did.
I hope you did.
Thank you, Ms. Armayo.
Our next and final speaker for 5 minutes is Connie Erickson. Who I
Ms.
saw
Erickson, are you
earlier,
there?
but I
She's
am
not in
seeing her.
person.
She was here earlier, but.
She may be online. One moment.
Is she online?
I do see her online in the meeting. Ms. Erickson, if you're with us, if you want to unmute your microphone. Last call, Connie Erickson.
Yeah.
It is
All right.
possible she has stepped away.
Yeah.
I can certainly try and reach out if you'd like.
Okay, I think we should probably go ahead, if that's all right. I think we should move on. And I think with that, those are our last, she would be our last speaker. I think I'll turn to Ms. Coffey to make a motion for us, and then we will have board discussion. If that's all right, Ms. Coffey?
Thank you. I move that the county board, A, authorize the advertisement of a public hearing by the county board on November 16th, 2024, to amend, reenact, and recodify Chapter 13 Firearms, Article 2 Firearm Ordinance of the Arlington County Code to amend Section 13-14 to exclude the discharge of firearms for county supervised deer management activities from the prohibition of firearms on county property, and B, authorize the advertisement of a public hearing by the county board on November 16th, 2024 to amend, reenact, and recodify Chapter 17 Miscellaneous Offenses and Provisions of the Arlington County Code to amend Section 17-5 to permit the discharge of firearms for county supervised deer management activities.
And I will, all right, seconded by Mr. DeFranti, thank you. All right, would you like to speak to your motion to start?
I'll keep it pretty short.
Short is fine.
I think we've received a number of presentations from the manager's staff in previous board meetings, as well as communications from many of our advisory commissions, many of our citizen groups. I think that this has been a very long and robust engagement process to get to where we are. I think, you know, I was a bit surprised seeing where our peer localities are, particularly noting that, you know, Fairfax County and Washington, D.C. National Park Service are already doing this. And to me, I often think if both sides of our neighbors on the Virginia side and across the river are already doing something, I think we should be asking ourselves if we should probably be doing it too. And so I look forward to additional discussion at the would-be advertised hearing and in between. And I think we are ready. I am ready to move forward.
Thank you. Mr. DeFranti?
It's an RTA, I've said plenty today. Is it a problem? Slide 6 of your presentation, 12 of 12 areas, see too many deer, and thus it's a problem. The next, is there a solution? Archery is not humane. Sterilization costs much, much more, and it's not recommended under the official things. And then the third point is, as we look to the future, we will manage into the concerns about the AWLA and sentient beings, and we will figure out just the smallest number of deer that we have to take. Thanks.
Thank you. Mr. Karantonis?
Thank you, Madam Chair. Cognizant that this is an RTA and we're not going to discuss the entirety and in depth. I have one question on the slide that is upcoming in 2025, and it's the sequence of things. So it says February 2025 contracted aerial drone survey to recount deer population locations. Why is the first count not good as a baseline?
Well, so that first count is from 2021, and as we know...
It's too old.
Yeah, it's too old, yeah. So deer populations are very dynamic, and also they have a high rate of reproduction. So we really want to make sure we have established a new baseline to allow us to better determine what sort of management decisions we might want to make going into 2026.
And then it says the first is staff will develop formal management plan. So parts of this management plan are, for example, the method. So what we're discussing today is to authorize one method of reducing and controlling this. So this is one, but that means that during the management plan, what is the level of involvement or public input or other, so how is this going to be managed, the management plan? Because I understand that the management plan is not only about deer, it's also the resilience of the ecosystem. You know, you have to care for your forest at the same time, et cetera, right?
Right, so unless I'm directed otherwise, I imagine this is just going to be a staff-led management plan. We're going to take these recommendations that we've gone through engagement around. We're going to get together with other experts and pull in regional expertise and, again, map out how the methods are going to work, and again, the operational cadence of the program. Yeah.
Okay, so just as a 2 points on that, I personally, first of all, I have to preface that with I was a big believer on, sequential solutions, rational models of how we strengthen the resiliency of forest systems. Last year, I had the opportunity to get educated about how resilient trees themselves are and how healthy forest ecosystems actually care for themselves in an amazing way, and how we humans have committed major misdemeanors there in intervening and not understanding how trees manage their own resiliency, as ecosystemic resiliency. The difference between the national forest and what Mr. Tobin said, and the fact that we have, it's not only because of the deer browsing, it's also because of the deer browsing, but mostly because we have an ecosystem on the federal side that has been left alone to manage itself excellently. That's a difficult insight to get. I had even to learn that trees, for example, arrange between themselves when to flourish, when to bloom, depending on the issues that they have or the threats that they have to manage locally. So, for example, a maple here has a different timing and a different cycle than a maple like 3 miles further up, and that really depends on who else is in this grove, etc. Coming back to so for me, part of the management plan has to include some narrative about what we do to restore the resiliency, not only the base, but the resiliency of the forest ecosystem in Arlington, and understand the real reasons why we had this precipitous degradation of the same. The second thing is on the method. I am really torn on this. I think that animal welfare is part of our duty of care when it comes to managing natural resources and natural ecosystems. It is not the deer's fault that it is overpopulated. It's actually our fault that we have an overpopulation of deer. So if we have to, as ultima ratio, as last resort, to manage this population with such a radical solution, we better make sure, absolutely sure, that it is really what it is saying that it is, professional sharpshooting. So for me, it will be interesting to know, how do we control that we really, that this killing is compliant with animal welfare, that there's no agony there, et cetera. There's a reason why we don't go with arch oral methods. And finally, how we sustain the effectiveness of that, because as I read the literature, there needs to be a constant mix and vigilance, of a mix of methods and constant mix of vigilance as we go forward. So I look forward to the conversation, and we will talk about that, I guess, in November again. Thank you.
Thank you, Mr. Karantonis. Ms. Cunningham, would you like to?
I just feel like I'd be remiss with several of our stalwart volunteers here who have spent the whole day with us going through all the county business. But I wanted to give a special shout out to Glenn Tobin and to Jill Barker, who this week were able to elevate a grave concern about incorrect tree removal along the parkway. I just want to say thank you, and also celebrate your success in stopping that for the time being.
Yep, and I would like to add you, because you played a role in that too, Ms. Cunningham, and I think a big call out to Congressman Byers' office. But it's pretty appalling. I saw those pictures just, anyway, I'm glad we stopped it. Thank you. It's really upsetting. No comments on this. I would, Mr. Morrow, I'll be quick. Are you able to pull up slide 7? That's the one, A Tale of the Two Forests. I like that one. It's Lacey Woods and Barcroft. When I first got on the board about 12 years ago, Naride Ellis and Tonda Rush were concerned about the deer. They came to me. You did too, Mr. Klingelhofer, way back. And they took me for a walk. At that point, they lived near Potomac Overlook. And we took a walk there, and it was really easy walking. I didn't even think about it. And they said, see how easy it is to walk here? It was actually like trees and dirt. There's like no understory at all. And then they took me to, oddly enough, Barcroft Park to show me a park that was not touched by the deer. So that was like 12 years ago. And now Barcroft Park is the example of what's been eaten by deer, which shows how this is increasing. I think possibly if in future presentations for our public, a couple of things I would just sort of suggest. What's missing here that people might not realize is all the critters that live under there. So possibly some pictures of, because I understand where Ms. Armayo's coming from, and the deer are really cute and they look lovely. But with the deer eating through here, they are destroying the habitat for the squirrels, the chipmunks, the newts, the little birds, the everything. So I think that it just kind of would help balance the visuals and the emotional impact. Nobody likes to be killing animals, certainly not deer, but the fact is it's so out of balance, and I will argue with you, Mr. Karantonis, because you said humans have been committing major misdemeanors. I think it's actually felonies, what we've done to nature. It's really pretty horrible. And so it's so out of balance.
I would agree with that.
Yeah, I thought you
Increase in
might.
indictment.
We definitely need to work on that. And the other thing I thought, Mr. Marley, we might include in future presentations, which you showed us, which was really helpful, was the map of the region and the two places that aren't actually regulating, which I think is us and I forget, is it Falls Church City? Fairfax City.
Sorry, it was Falls Church in Alexandria.
Okay, yeah, but maybe Fairfax City too.
Not to name and shame.
At any rate, it's that also. I'm really big on visuals, and it really makes it so clear what an outlier is and what a problem we are then for deer control everywhere. Because I understand they may just all come here, eat our forest, and then kind of spread out and make it harder for our neighbors to do what we need. So I'm, with that, obviously ready to support this. It's going to come back to us. There's a lot of emotional impact here, but I think we do need to move forward. I'm a little distressed at how long it's going to take us to actually move forward, because in the time that Barcroft has gone from being like a Lacey Woods type place, which I kind of remember from my walk, to what it is now, in another few years, it'll still be even more harm. So, and I understand finally, Ms. Armayo, we can have conversations at other times. I know you can go and you can see regrowth, but that's just the poor thing trying to sprout up a few more leaves, and then those get eaten and you just cannot do it, which is the evidence is here in this particular picture with Barcroft Park showing how devastated it is. All right, with that, I think we are ready to vote. All right, motion before us. All in favor, please say aye. Aye. Motion passes 5-0. Thank you very much. This will come back to us in November. Mr. Kushner, I think that's the last item for today. Is that correct?
business.
All right, thank you, everybody. And again, thank you for those who went out and tried to save the National Park Service from itself to some extent and doing the really good work, and really appreciate everybody sticking with us all throughout this long day. Board is in recess until the 22nd of October, Tuesday at 3 p.m. Thank you all.